Ang tinatanong ko sa iyo, yun ba yung legal basis mo considering that it was only an opinion?
I'm sorry, Mr. President. Mr. Chairman, I did not hear clearly. I'm sorry.
Kasi galing yung tanong na yun kay Congressman Ace. He was asking you as to the legal opinion or as to the legal basis of the IRM, specifically yung inyong PhilHealth Circular 2020-007. Ngayon, ang sinasabi mo ay meron kayong ginawang legal opinion which was ratified by the board? Is that correct?
Mr. President, the legal opinion was issued on March 16, 2020, and later on, the PhilHealth issued the circular, and that circular was later ratified by the PhilHealth board. So, but as I said earlier, Mr. Chairman, the only thing that the legal opinion covered pertains to the authority of the board to approve or formulate policies pertaining to provider payment mechanisms. And it also mentioned that the IRM policy or program must be presented first to the board of directors. Thank you, Mr. Chair.
Alam mo, Attorney Del Rosario, kung sasabihin mo lang ang totoo, madadali tayo eh. Yung sinasabi mo ratification, March 30, 31 nung ni-ratify ng board. Pero yung inyong pagpapatupad ng IRM COVID-19, March 23 pa yan eh. Nauna kayo ng 1 week sa ratification. Yun ang totoo, hindi ba?
That is correct. That is what...
Sa mga tweet, bago pa na-ratify ng board, inunahan nyo na. Yun ang nagiging problema sa inyo eh. Sasabihin mo sa amin ngayon na mayroong legal basis, pero yung ang basis ninyo, gawa-gawa lang na opinion na pinaratify nyo sa board 1 week later, pero inunahan ninyo. Paano ngayon masusuri ng board ang implementation kung kayo-kayo, pinapaiikot ninyo yung board?
Mr. Chairman, we have our members of the board present here if you want to hear whether the accusation...
I am not asking the board. Ikaw ang aking tinatanong dahil ikaw ang nagpanukala niyan. Ang tingin ko kasi, kung kayo ang gumawa niyan, historically, ang basis ninyo is 1/4 para lamang makita ninyo yung karapat-dapat na advance reimbursement na ibibigay ninyo sa bawat ospital na hihingi ng tulong sa inyo. Kaya lang, kayo mismo ang lumalabag sapagkat kanina tinatanong kita yung National Red Cross na wala namang historical claims. Isa-cite mo na naman yung Bayanihan 1 o kaya yung sinasabi mong PhilHealth circular. Wala nga sa circular na ikaw ay makakapagbigay nung wala siyang historical claim. Pero binigyan nyo ng 100 billion ang PNRC, hindi ko malaman kung anong kadahilanan. So paano mo ngayon i-justify yung ginagawa ninyo? Parang discretion nyo na lang kung kailan nyo ibibigay yung funding or hindi. Wala kayong consistency. How do you explain that?
Mr. Chairman, I think that was explained earlier by Attorney Robert Labe, our corporate counsel, on the basis of the 100 million amount. And as I mentioned earlier, Mr. Chairman, there was a negotiation by the Red Cross and PhilHealth pertaining to that matter. And
kaya nga, ang tinatanong ko sa inyo, bakit kailangan magkaroon ng special treatment ang National Red Cross? Ang pinag-usapan natin is your guideline. Wala naman sa guideline ninyo na dapat, ang guideline ninyo dapat meron kayong historical claim at least 3 months. Bakit kayo umalis doon sa guideline na yon? At ang pagkakabigay pa ninyo ng amount, sa tingin ko, masyado namang malaki. Samantalang wala pa naman silang claim sa inyo. Pangalawa, lalabag pa yun doon sa mismong charter ng Red Cross. Sapagkat tumatanggap lang ang Red Cross, balik kabayaran doon sa serbisyong ni-render, wala pa nga sapagkat by nature, yan ay advance reimbursement. Kaya maling-mali yung patakaran, yung pagkakagawa dyan sa Red Cross, nang dahil lamang ba sila ay madaling na-accredit yung kanilang mga PCR testing laboratories? Yun ba yung dahilan lang?
Deputy
Mr. Chair,
Speaker,
narinig po ba nila?
yes, can we have your last question?
Wala pa sagot, Mr. Chair eh.
Attorney Del Rosario, would you like to reply?
I don't. I think the good deputy speaker has already some notion on the matter. I'm not really privy, Mr. Chairman, on the top-level negotiations between Senator Gordon and President Morales. So I cannot answer that question.
Mr. Chair, ang nahalata ko lang pagka ganyan ng tanong, palaging hindi privy yung Attorney Del Rosario. Sino po ba yung tutulong naman sa kanilang board kung hindi yung mismong nakakaalam? At sa iyong posisyon bilang Executive Vice President COO, hindi mo kailanman may tatanggi na ikaw ay isa sa mga pinagtitiwalaan dyan. Pagkatapos sasabihin mo, you are not privy. Palaging ganyan kasi ang binibigay niyong sagot sa amin eh. Itong pangalawang tanong, withhold ba ng income tax ang PhilHealth doon sa binigay ninyong advance reimbursement sa mga HCIs?
Ano po yun, sir? I'm sorry.
Withhold ba kayo ng income tax doon sa ibinigay ninyong advance reimbursement o advance payment?
That question can be best answered by the withholding agent office. But as far as I know, there was a payment for the taxes made to BIR, Mr. Chairman. But that can be better addressed by SBP for fund management. And
Pwede
for
ba sagutin? Pwede ba sagutin niya?
Executive Vice President CEO, Mr. Chair, the EBP CEO is Mr. Arnel De Jesus. Thank you, Mr. Chair.
The SBP for fund management is recognized.
Mr. Chair, Your Honors, magandang hapon po. If po pwede po, with your respect po, si Attorney Labi po mag-answer ng question po ni Congressman po.
Yes, please.
Good afternoon, Mr. Chairman. Good afternoon, Congressman Marcolita, sir.
Sino po ang sasagot ng tanong?
The lawyer in fund management will answer. Deputy Speaker Marcoleta, that would be the last wrap-up after the reply of Attorney
Robert Labi po, Mr.
Attorney
Chairman.
Robert Lapi. Go ahead, Attorney.
As regards po doon sa withholding of tax to doon po sa IRM, Mr. Chairman, the stand of the corporation is IRM is not subject to 2% AWT upon its release, but subject to withholding of 2% AWT upon liquidation po. Ang basis po noon, Mr. Chairman, is Section 2.57.4 of Revenue Regulation 2-98 does not necessarily apply to the IRM because we treat this as cash advance. Ang nakalagay po kasi doon is the obligation of the payer to deduct and withhold the tax under Section 257 of this regulation arises at the time an income is paid or payable, whichever comes first. Then the term payable refers to the date the obligation become due, demandable, or legally enforceable. In effect po, kasi the operative word here is income is paid or payable. At this point po kasi nung nag-release po kami ng IRM, it's not yet treated as income on the part ng HCI. And it's not yet payable also because the obligation is not due and demandable naman po on our side. So at the point of liquidation po, doon pa po kami nagcha-charge ng EWT which is 2%, Mr. Chairman.
Mr. Chair, ito po ang problema sa PhilHealth mula't mula pa. Ang mga sagot nila sa atin puro papaikot eh. Kanina ayaw nilang sabihin na ito ay cash advance. Sapagkat sa mismong nomenclature ng IRM, reimbursement talaga ito. Tingnan ninyo kung paano nila minamagic pati yung mga terminology natin. Kung hindi sa reimbursement, ayaw nilang sabihin na cash advance. Ngayon, kung cash advance, maliwanag na income po yan ng ospital sapagkat gagamitin niya yan. Ngayon, imbes na yung correct na section ng ating Internal Revenue Code ang gagamitin, which is section 272, iba-ibang ginagamit nila. Ngayon, may collusion dyan, Mr. Chair. Makikita ninyo kagad dyan. Paano ngayong itatrato ng cash advance ay hindi income? Cash advance din yung tinitingnan eh. Alin sa dalawa, bumalik kayo sa reimbursement o cash advance? Pati dyan, mari kayong makasuhan na dyan eh. Ano ba talaga? Reimbursement of cash advance?
Mr. Chair, if I may, doon po kasi sa IRM po natin, we are not really have to rely doon kung ano po yung ibig sabihin ng IRM because nasa definition naman po ng issuance ng PhilHealth yan. And in every issuance po, we have to rely kung ano po yung ibig sabihin on the part ng PhilHealth. Kasi define naman po yung ibig sabihin ng PhilHealth issuance doon sa definition po. If I may...
Alam na natin ang definition eh. Alam na natin ang definition. Ang pinag-uusapan dyan, kung cash advance yan, meron naman i-reimburse naman yan, ililiquidate nila sa makatwid, yan ay siguradong ibabalik sa inyo nung ospital na pinaghiraman nyo. Kasi cash advance lang ang turing ninyo eh. Sa makatwid, kapag pinahiram mo ang isang enterprise, income niya yon. Itatrato niyang income yon, ililistan sa libro niya, income yun sapagkat ibinigay mong cash advance. Pagkatapos palulusutin mo ngayon dahil meron kayong collusion, dapat walang income tax. Mali na naman kayo dyan. Alam ba ninyo kung ano yung mga elements ng plunder at saka malversation? Kasi lalabas yan, at the very least, malversation o kaya plunder. Sana kabisado ninyo kung ano yung elements ng plunder at saka yung malversation para madali ninyong masagot kung sakasakaling dumating ang panahon na makasuhan kayong lahat. Alam po ba ninyo ang mga elemento ng plunder at saka malversation?
Yes. Thank you, Deputy Speaker Marcoleta. We will get back to you on the second round. Dalawa na lang po yung natitira natin for this first round.
Salamat po, Mr. Chair.
Thank you so much, Deputy Speaker Marcoleta. We now proceed to the Honorable, our Minority Floor Leader, Benny Abante is recognized.
Thank you po, Mr. Chair. Can you hear me clearly?
Yes, Minority Floor Leader.
Salamat po. I just would like to start with a query. Kung nai-submit na po ng PhilHealth ang mga tinanong ko sa kanila tungkol sa accreditation fees, kung ito po yung nai-submit na sa committee, ang tungkol dito kung magkano ang nakolekta, kung saan ginamit ang mga fees na ito. I just would like to ask the PhilHealth officers on that, Mr. Chair. Submit na po ba?
Yes, sorry. Is Mr. De Jesus already, has he left already the building? Or is he still here? May we know, Dr. Pargas, you were the one asked by the Minority Floor Leader the last time. Yung pong accreditation fees and the distribution of such, nasabit po ba?
Yes, Mr. Chair.
It's already here with us.
Yes, Mr. Chair. It's with the Secretariat.
Mr. Chair, if I may, kasi kanina hinahanap ko yung accreditation fee at ang binigay ng COMSEC sa atin, asan ba yun? Ay yung wala siyang total. And at the same time, wala kayong nilagay kung paano napapunta sa mga benefits and bonuses. So, incomplete po yung dokumento na sinabit nyo. And I was looking for it a while ago and I even asked Chairman Mike Aguinaldo about it. So, can you clarify kung alam ninyo, kung nakita nyo naman po, magkano po yung iniligay sa mga board members ng PhilHealth? Yun po yung tinatanong ni Congressman Abante, kung magkano ang napapunta sa bawat isang member ng board doon sa accreditation fee.
Congressman Abante, meron po dito mga sinabmit na dokumento pero hindi nga daw po kumpleto. But you may want to continue with your interpolation.
Yes, kung hindi kompleto yan, it's very clear, Mr. Chair, na nabanggit ko na dapat isubmit lahat sapagkat sila po ay nakakolekta ng accreditation fees mula 1995 hanggang 2020 until June. Ang nais nating malaman, sino po ang nagbayad ng mga fees na yan? Pangalawa, magkano po ang total na ibayad yan? Pangatlo, kanino po napunta yan? Sapagkat inamin po nila ng 2019 na pinagbawalan na po sila ng COA sa aking pag-intindi na gamitin po ang accreditation fees na yan sa kanilang bonuses. Dahilan sa kulang po ang sinadmit nila, gusto kong tanungin si Mr. Vargas, Dr. Vargas, ano po, na bakit hindi kumpleto ang pagkakasubmit ninyo ng mga documents na hinihingi namin sa inyo.
Yes, please.
I'm just checking po with our secretariat, yung pong mga na-submit na dokumento pagdating po dito sa tinatawag na MACC.
Mr. Chairman, if I may, if ever na magsasubmit po sana sila ng mga dokumento, pwede ba soft copy na lang para madali na yung transmission ng dokumento natin? Kasi kung hard copy pa yung aantayin natin, talagang it will take time.
Yes, Mr. Chair. Mr. Chair, our secretariat has submitted documents and meron pa rin pong ibang isasubmit ngayon with regard to this MCCA.
Yan po ba, Mr. Chair, kumpleto na? Dr. Vargas?
Pinapacheck po namin ngayon sa secretariat po.
Mr. Chair, Dr. Vargas, ayoko po isipin that you are deliberately delaying the submission of documents. I would like to remind our resource speakers that not only did you take an oath to speak the truth, but you can also be held in contempt for delaying the proceedings of these committee hearings. Do you understand that, Mr. Chair, Dr. Vargas?
Yes, Mr. Chair, I acknowledge po, and the documents are coming from the different offices. According to, may I, Mr. Chair, may I request our Senior Vice President for Fund Management who have the documents for the releases of these allowances for them to respond?
Yes, go ahead, Tony Chaco.
Mr. Chair,
yes, go ahead.
Your Honor, good afternoon po. Relative to the MMCA po, ang ating naibigay po sa ngayon ay ang total ng accreditation fee na nakolekta sa period po na naibigay po, and then the usage of the fund po ang pinaka-summary niya, and then at the same time po ang listahan kung sino-sino po ang naka-receive, pero po yung listahan na naibigay po natin ay ang galing sa central office.
Mr. Renato Limsiaco, I will be giving the copy of the accreditation fees collection from 2005 to 2019 to Chairman Defensor. And at the same time, kung saan napupunta po itong mga koleksyon na to. Ang tanong ko lamang dito, Mr. Limsiaco, ano itong medical mission and critical allowance na sinasabi niyo dito?
Mr. Chair, Your Honor, yun po yung MMCA, is accreditation fee po yung source ng ating pagbibigay ng allowance po. Ang nandiyan po sa ngayon ay ang listahan ng mga recipient po released at the central office, given po na ang mga iba ang portion po diyan
ay galing po sa ating mga regional offices. We are requesting our regional offices po to provide us with the data so that we can consolidate and submit po dito sa ating po sa committee po.
Mr. Chair,
Ito na hinahanap ni Congressman Abante. Congressman Abante, narito po yung listahan.
Po.
At ibibigay ko na rin po kay Chairman dahil pag tinignan ko po to, Mr. Chair, merong mga individual dito na nakatanggap ng 823,000, merong 176,000, 344,000, 729,000, 466,000, 467,000. Andyan po yung mga corresponding na tao na tumanggap doon po sa accreditation fee. At siguro, Mr. Chairman, dahil ngayon lang po nila dinala to, ay hindi po natin malaman kung ito pong pambinigay para sa isang taon o isang buwan. Pero sobra naman lalaki nito, Mr. Chairman. Kung sakasakali na binigay sa mga individual na tao yung accreditation fee, Mr. Chairman, napakalaki to. At ito po ay dinisallow na ng COA. Isn't it?
Okay.
Mr. Chair.
Minority Floor Leader Abante, I think, what you requested is here with us. Kung saan lang po nakuha itong collection, Mr. Limsiaco, hindi po masyadong malinaw, no? As to which accredited healthcare institution.
Mr. Chair, Your Honor, yun po, wala pa ho tayong data.
Okay lang.
Kanino po natin nakuha
No, it's
yung
okay.
accreditation
Ang
fee po.
nakalagay mo dito is the total collection and now it was distributed.
Yes po.
Yes. So, Minority Floor Leader Abante, nandito po yung listahan.
Mr. Chair, ano pong year nagsimula yan, Mr. Chair? Sapagkat sabi ni Deputy Speaker Dan, 2011 nagsimula. Kailan po nagsimula? Sapagkat nagsimula sila ng
Nagsimula
1995.
2008 hanggang 2015.
O nasaan po yung 1995 up to 2007?
Do you have that, Mr. Limsiaco? 1995 to 2007.
1995. Sorry, Mr. Chair, ang data na nakuha po natin, 2005 po yun. And hanggang sa 2019 po na accreditation fee na collection ng corporation. And yun po ang utilization po niya through the medical mission critical allowance ay 2008 po hanggang 2015 po.
Okay, Mr. Limsiaco, you're directed to submit to us the list from 1995 to 2007. Hanapin po ninyo so that this could be given to Minority Leader Benny Abante. Andito po, Congressman Abante, listahan sa akin and I will have it given to you immediately para po kayo na rin po yung maglabas ng mga particular na tao na gusto niyo pong ipakita yung mismong pondo na indicated po dito.
Mr. Chair, kung nakita po natin, sinabi po ni Deputy Speaker Dan, yung mga naibigay sa mga individual na umaabot ng 800,000, no? Gusto kong tanungin po itong si Mr. Ano po siya, Limkuwako o whatever. Gusto ko lang pong tanungin kung ano po yung batayan ng batas na inyong ipinamigay yan sa mga individual na mga opisyal ng PhilHealth o ng guidelines po ninyo. Saan nyo kinuha yung batayan na pwede nyong yan ay ibigay sa mga opisyal ng PhilHealth?
Mr. Chair, Your Honor, may I refer, with the indulgence po, may I refer the matter to our SVP for Management Services Sector, si SVP Dennis Mas po.
Good afternoon, Mr. Chair and Congressman Abante. I had with me itong chronology ng pagbigay ng medical and mission critical allowance. Though hindi talaga ako involved dito before, pero ito yung binigay nilang mga legal basis. There was a board resolution passed numbered 933 in 2006 for the resolution establishing the managed accredited healthcare providers development trust fund and defining its purpose. Ang report na pala ito na submit na to ng PhilHealth sa committee. So nandito yung mga basis niya, no, mga board resolutions.
O ibig sabihin, Mr. Chair, na ang basis ng pagbigay ng allowance, ng accreditation fees sa mga opisyal is based on the board resolutions that was approved by the board members of PhilHealth. Yun ba yun?
Yes, Your Honor. Tapos,
Okay.
dun sa report
I do not question the legality of that, but I would question the legality of that because pinagbawalan kayo ng COA. Ibig sabihin, hindi above board ang resolution na yan sapagkat pinagbawalan kayo ng COA ng 2019.
na-stop na ho yan ng 20...
That's what I'm saying. They stop. Ang tanong, bakit mo in-stop?
Diniscontinue na yung pagbigay.
Kaya nga po, bakit, why was it discontinued?
Sino ba makasagot? Sino? Disallowance. Your Honor, because of disallowance issued by the Commission on Audit.
Therefore, that would constitute technical malversation. Di po ako abogado, pero nakikita ko po na kung meron kayong disallowance na yan at nakita po namin na to the tune of 800,000 ang ibibigay sa individual, ay nangangahulugan from 1995 to 2019. Hindi lang po yan 100 milyon. Might be about 200 million or more. Oo. Eh, kung yan po'y tinigil ng COA at binigyan po kayo ng disallowances, that would constitute in a form of malversation and therefore part of corruption. Hindi po ba, Sir Chair?
Your Honor, hindi kasi ako medyo familiar dito sa transaction na ito eh. Report lang naman yung binigay sa akin, but...
Sino po ang pamilya sa transaction na yan?
Mr. Misako, you were the one who submitted this document. Kindly reply to the minority leader.
Come again, sir. Ano po yung tanong, sir? Relative to the COA po, sir, I think our legal sector can help us give us an update on this. But nevertheless, sir, mayroon ho tayong 36 million na disallow po ng Commission on Audit, sir.
That's what I'm saying. Ang tanong ko po dyan, ganito, kung yan po dinisallow ng COA, therefore, yung paggamit niyo po sa mga fees na yan is not proper. Tama o hindi?
Mr. Chair, yun po yung pananaw ng Commission on Audit, Mr. Chair, and ito po ay...
Ibig sabihin, hindi niyo pananaw yan. I mean, mali ang pananaw ng Commission on Audit.
Yun po yung pananaw po nila, and kaya po ina-appeal po ng opisina ito sa ating Commission proper para po mabigyan nila po ng pahintulot ang pagbigay po nito.
My question is, I look at it in a very improper form. Why would there be a board resolution on your own? Kayo mismo ang nagde-designate ng kung saan pupunta ang mga fees na yan. Kayo sumisingil, kayo ang binabayaran, at kayo rin po ang nagde-designate kung saan dapat pumunta ang mga fees na yan. Tama po ba ako, Mr. Chair? Yes or no lang po yan. Yes or no? Ang sabi po sa akin, that is based on board resolution. Therefore, kayo po ang nag-charge, kayo naningil, kayo ang binayaran, at kayo rin nag-approve kung saan pupunta ang mga accreditation fees na yan. Tama po ba ako?
PhilHealth, pakisagot po.
Your Honors, Mr. Chair, may I suggest that someone to answer, si Attorney Roger Pucalian, kasi siya yung nag-file nito ng mga in-charge sa PhilHealth, yung internal legal department namin, at alam ko, may disallowance na ito sa commission proper, and then parang sabi niya kanina sa akin, parang may desisyon na yung Supreme Court on this.
Attorney, pakisagot po.
Good afternoon. As to the grant of MMCA that was through PhilHealth Board resolution, no? And the disallowance by COA of MMCA became only final and executory and in September of 2015. So because of that ruling of the court, the PhilHealth stopped the grant.
Mr. Chair, what is the basis of the ruling? So what I'm saying is, it is improper for you to be able to use all the accreditation fees on yourselves. Am I right?
Yes, the decision, sir, of the PhilHealth in granting these disallowed bonuses and allowances was based on Section 16N of Republic Act 7875, no? Allowing the corporation to fix its compensation or the compensation of the personnel. So that is, yan po yung naging basihan ng board natin, ng PhilHealth to grant. Kaya nga po siya nabigay because also of the board resolution. Ano. However, the Supreme Court later, the COA, on the other hand, has the legal interpretation that the fiscal autonomy of PhilHealth is not absolute, and therefore it is limited, subject to approval by the President of the Philippines.
Tama.
So that legal issue became the continuing issue for COA and PhilHealth, no? Until the Supreme Court finally ruled that the Section 16N of RE 7875 is not absolute, the authority to fix compensation, and therefore should always be subject to presidential approval on the grant of benefits. But because of the decision, the PhilHealth stopped the grant of these board-sanctioned allowances, specifically in the case of PhilHealth versus COA, which was only decided last November 29, 2016, wherein there is a categorical ruling that only the grant of benefit by PhilHealth should have prior presidential approval.
So, Mr. Chair, Attorney, I'm sure that you also believe that in the granting of the allowances and bonuses by the board, you know, on the basis of the resolution, there is a limit to it. Am I right?
Sorry, sir.
There is a limit to the granting of bonuses and allowances, even though it is based on the board resolution.
Sir, there is a continuing grant because of the PhilHealth board, no?
So why don't you explain to me why one person is granted 800,000 allowances for the year?
Sir, I don't think
submitted.
that figure is correct, no? 800,000.
No, it is correct. I saw the list. There are about, no, total to, from 2005 to 2018. So it is correct. I
Sir,
just don't want to name the names because that privilege should be with the Minority Leader Abante who raised this issue. Pero siguro mga 5 tao nakita ko doon. For the record, si Mr. Liam Siaco yung nagbigay ng papel, 6,700 pesos ka lang total. Kaya, yeah, binanggit ko na yung sa'yo. Go ahead, Congressman Abante.
Yeah, so that what I'm saying is there is always a limitation to whatever board resolution you approve to become the basis of the bonuses and the allowances. May limitation yan. Kaya nga sabi ng COA sa inyo, there ought to be a presidential approval. And you did not seek for any presidential approval. Therefore, the giving of allowances and bonuses using the accreditation fees would be improper. Yes or no, Chairman, Mr. Chair, Attorney?
Mr. Chair, Congressman Abante, at that time, the PhilHealth relied in good faith the legal opinion of the OGCC that the PhilHealth Board has the absolute right to fix the compensation of its personnel and officers. So that is also one of the reasons why the PhilHealth Board allowed the grant of these board-approved benefits to employees.
Well, we will look into that later. No? So the chairman already has directed you to submit to us the documents from 1995 to
Yes, sir.
the time. Will you submit that to us in the next hearing, Mr. Chair?
Yes, sir, we can po.
Ah?
Yes, sir po. We can submit, sir.
You do not submit that to us. Submit that to us. I would request the committee to charge in contempt these people who keep on delaying what we're trying to achieve. I'd like to remind our resource speakers that this is not an investigation per se to find fault, nor this is an accusation to any of you, nor this is a judgment being passed to you. We are having this investigation so that we could be able to study the law and be able to review it, modify it, amend it, make it more, palatable to our people. See? Ngayon, pero isa dito, the next major issue I would like to ask is concerning the fund balance and reserve. No? PhilHealth incurred a net operating loss of 29.1 billion pesos in 2013 to 2017. Ito, due to fraudulent benefit claims and other misdeeds by senior health officials, according to the 2018 COA report. Do you accept that report, Mr. Chair, PhilHealth officials?
Minority Floor Leader Abante, gusto ko lang pong parating sa inyo na si Executive Vice President and CEO Arnel De Jesus, sumama ho ang pakiramdam at nagpa-excuse. So, he will write an official letter of excuse because hindi na po natin siya nakita sa kanyang pagbalik. But at any rate, may I request Dr. Pargas to answer the question of or the assertion of the Honorable Abante. Yung pong sinasabi niya, 2013, 2018, masyado daw pong yung fraud within PhilHealth.
Mr. Chair, again, may I refer this to our fund management because they are the ones handling the COA findings.
Okay, Mr. Msiako, kindly reply.
Mr. Chair, Your Honor, hanapin ko lang po yung memorandum, a letter coming from our COA relative doon sa fraud po na sinasabi po.
Habang hinahanap mo, Mr. Hindi ko makuha yung apelyido mo. No?
Mr. Limsiako, opo.
Okay. The report showed that overpayments, ito, matagal pa, wala pang pandemic ito that overpayments and similar schemes adopted by corrupt PhilHealth officials have defrauded the state insurance company of as much as 154 billion pesos.
Mr. Msiako.
Did you get an answer from that?
Mr. Chair, Your Honor, hinahanap ko po yung letter coming from COA relative to the 154 billion pesos po, sir.
Okay. Now, pero nabasa mo na yon, Sir Chamco, no? Nabasa mo na yon. That's the reason why PhilHealth is bleeding dry, no? Itong tanong ko, babang hinahanap mo. At this point in time, is PhilHealth on the brink of bankruptcy? Mr. Chair, Mr. Licamco,
Mr. Chair, Your Honor,
napapankrat na po ba ang PhilHealth?
fund balance of PhilHealth sa ngayon po as of June 30, 2020, ang ating investment po ay nasa 132 billion, Your Honor. And ang ating cash equivalent including our time deposit po ay nasa 80 billion, Your Honor. So ibig sabihin po, mayroon ho tayong pondo sa ngayon po para pagbayad sa ating mga benefit claims po na kailangan natin i-sustaintuhan para sa ating mga miyembro po.
So liquid kayo, very liquid kayo. Hindi kayo wala malayo sa bankruptcy.
Mr. Chair, Your Honor, sa figure po natin sa ngayon po ay sapat po ang pondo natin. Relative po doon sa ating projection naman po sa pagpapatakbo ng ating National Health Insurance Program, ay if with due respect po ay i-refer ko kayo kay sa ating actuary po si Ma'am Neri Santiago po.
VP Neri Santiago, you may reply.
Good afternoon, Mr. Chair, Mr. Congressman. Bago po itong mag-COVID tayo, sustainable naman po ang ating pondo. It will even exceed 10 years. However po, because po of the COVID, at kung wala pong additional na pondo na magagamit para sa COVID, mahihirapan po tayong bayaran po ang mga COVID claims because of that, Your Honors.
Mr. Wag muna natin pag-usapan yung COVID, no? Kung naniniwala kayo rito. So based on my reading ng AFS at COA report, I will quote, no? With assets worth 230 billion pesos and only around 119 billion pesos in liabilities as of March 2020. March 2020, the Philippine Health Insurance Corporation has more than 110 billion peso in retained earnings or equity. Although PhilHealth posted a net operating loss of 3.4 billion pesos in 2019, its reserve fund earned 8 billion pesos in interest, leaving it with a net income of 4.6 billion pesos. Tama ho ba yun?
Mr. Chair, Your Honor, the net income for year 2019 is 4.658, Your Honor.
4.658 billion.
Yes, Your
Yun
Honor.
yung net income nyo ngayon? Oo.
Net income po.
Para po malaman ng taong bayan. Ngayon po, currently, magkano ang total assets ng PhilHealth?
Ang total asset po ng PhilHealth as of June 30, 2020, Your Honor, ay umabot sa 261.4 billion, Your Honor.
Magkano po ang total liabilities?
Ang total liabilities po ay nasa 155.6 billion, Your Honor. That includes the current liabilities and non-current liabilities, Your Honor.
So magkano po ang retained earnings?
The returned earnings or members' equity ay nasa 105.8 billion, Your Honor.
Okay. Now, net income po ba or net loss ang PhilHealth last year?
Last year po, Your Honor, 2019, ay net income po tayo ng 4.658
Billion.
Honor.
Magkano po ang balance ng reserve fund?
Last year, ang balance ng reserve fund po natin ay nasa 110 billion, Your Honor.
Bakit po nagko-complain ang marami, particularly doon po sa Senado, pinag-usapan puro yung Bibron dialysis machine supplier. Bakit po nagko-complain na marami kayong utang sa kanila na hindi nababayaran? Bakit nagko-complain ang maraming dialysis centers sa buong Pilipinas na hindi nyo nababayaran? Mr. Chair.
Mr. Chair, Your Honor, ang mga kadahilanan po bakit hindi nakakabayad si PhilHealth sa mga bayarin natin sa mga providers po ay number one, nasa pandemya ho tayo and ang ating po opisina.
No, that is before the pandemic yan, kapatid. Mr. Chair.
Minority Floor Leader Abante, may we have your last question? Mr. Demsiaco, please reply.
Mr. Chair, Your Honor, ang claims processing po natin ay continuous po even before pandemya. Yun nga po dito sa pandemya sa ngayon ay naantala din po ang pag-process ng claim ng ating opisina. That's the reason why po ay mayroon din tayong mga outstanding na bayarin sa ating mga facilities. Yun po ang tinatrabaho ngayon ng opisina po, ang instruction ni President Morales at saka ni EVP Arnel De Jesus na para po mabilisan ang pag-process doon ng claim sa ating mga regional office and then po makabayad. Sa katunayan po, July po ay bumalik na po sa 12 billion po ang ating benefit payment po. Kumbaga, nandoon na po siya sa level ng pre-COVID ng January, February po with that instruction ng ating top management po.
Okay, hindi pa totoo na kaya nyo po hindi nababayaran tong mga dialysis centers na ito sapagkat mayroon kayong mga opisyal na humihingi ng interest? Wala kayong knowledge doon, Mr. Chair, You have no knowledge of that.
Mr. Chair, Your Honor, ang pera po intended para sa ating pagbayad sa hospital po ay preparado po, nakahanda po siya. And relative naman po sa ating mga investment po, ang pera na hindi pa natin magagamit po ay talagang minamaximize po natin. Na
So po yun, meron po kayong salita, no? Ang tanong ko lang po, may knowledge ba kayo na ang ibang official ng PhilHealth, upang mabayaran po itong mga centers na ito ay humihingi po ng interest?
Humihingi ng interest o kaya ilagay, Mr. Chair. Yun po din ang gusto ho natin malalaman po sa ating mga kasamahan kung mayroon ho bang ganyan mga instances. Gusto din po natin malalaman po yan para po mailabas sila at ma-clean up po yung
Session suspended. We have a medical emergency. Minority Leader Abante, nagkaroon lang po si Attorney Del Rosario humingi ng assistance.
Okay.
Tuwing nagkakahiring tayo sa Kongreso, nauna si Executive Vice President De Jesus, tapos si Attorney Del Rosario. Buti na lang, not during the interpellation of Congressman Barsaga, because Hearing resumed. Congressman Minority Leader Abante, you may now proceed. Oh, before you start, Congressman Abante, just an update to the members of the committee. Si VP Arnel De Jesus po, kasi di ba nagkaroon po siya ng recently nagpalit ng kanyang pacemaker. So he's still very weak. That's why he had to excuse himself earlier. At ito pong si Attorney Del Rosario, Rodolfo Del Rosario, bigla pong na pakiramdam.
Okay. Hello? Hello? Naghang yata.
Anong?
Yeah.
Baka kailangan i-pray over yung mga yan. Lagi nagkakasakit eh.
Mukhang kinakabahan na ako magtanong eh. Pagkat nung nagtanong ako nung una, may nagkasakit din. Kinakabahan na ako magtanong.
Ikaw yata ang dahilan, Manong eh.
Ako yata.
Dapat may standby na doktor dyan sa atin eh.
Totoo lang. Kanina habang nasa suspension tayo, I was praying for them. Actually, I was really praying for them. Totoo lang.
That's good.
Totoo lang.
I think they needed that for them to be enlightened.
Ano nangyari? Pwede ba akong ituloy na? What happened?
Wala, parang nakahang eh.
Pati yung internet may sakit din.
Palagay ko nagkasakit din. Kaya pala si Manong Dante.
Okay, hindi ako naniniwalang ipinanalangin sila ni Kong Abante.
Bakit?
Oy, maniwala ka. Itong kaibigan mo, pastor to, nagsasabi kung totoo.
Kabaligtaran sa panalangin mo.
Yun na nga eh.
Yung inyong mga regional director, kung maaari po ay makausap ang inyong mga regional director para malaman po natin kung sila ba ay pumapayag o hindi pumapayag na magsabit ng kanilang waiver, Mr. Chair.
Yes, Chairman Alvarado, we will do that. At the same time, yung ating COMSEC, no, you're directed to kindly check with the regional officials and area officials of PhilHealth.
Thank you, Mr. Chair. At maaari na po natin, mukhang nakahanda na po si Bishop Benny Abante na ipagpatuloy ang kanyang pagtatanong.
Congressman Abante, for your last question. Minority Leader Abante.
Okay na ba? Okay na po.
Yes, go ahead, Congressman.
Okay. Medyo kinakabahan na ako magtanong, Mr. Chair. Anyway, ito nga pong gusto kong muling itanong. Ano po ba yung pili niya? Si Mr. Lichauco ba yun?
Lim Chauco. Apa.
Ang Bibron, palagay ko alam na naman nila yung Bibron, no ha? Malaki ang utang ng PhilHealth. Ang sabi sa akin to the tune of about 200 million, no? The PhilHealth also knows how much they owe the dialysis centers. Kahit bago pa yung COVID. Ang pinagtataka ko lang, liquid naman ang PhilHealth, bakit hindi nababayaran? Mukhang meron yata ditong nangyayaring magic din kung bakit nadidelay ang pagbabayad sa mga yan. Samantalang maraming pera ang PhilHealth. So, muli, I'm asking them, okay, para i-clear natin po ito sapagkat napakarami ng utang ng PhilHealth sa mga providers. Ito po ang sabi I am asking them to come into the open and be a vital witness to this investigation. Ano po ang sabi ng iba? Takot mag-testify ang mga centers. Bakit? Sapagkat baka balikan sila. So I would like to ask our PhilHealth officials, no? Wala silang nasabihin sa atin, walang dapat ikatakot itong mga vital witness na ito if we will get them to testify on the alleged corruption in the PhilHealth. Meron po bang pwede sumagot dyan?
Minority Leader Abante, the question is the private healthcare institutions would want to testify because they're...
pero natatakot sila. Natatakot sila. So I would like to have some assurances from the PhilHealth officials na okay lang sila mag-testify just to find out the truth. Ito po, text sa akin to ng ilan na mga may-ari ng coalition ng mga dialysis centers. Can the PhilHealth officials assure us that they can openly testify on that alleged corruption and that they do not need to be afraid of that?
Okay, thank you, Minority Leader Abante. We would like to ask Mr. Zamsiaco to reply, after which we will proceed to Congresswoman Stella Kimbo. Go ahead.
Mr. Chair, Your Honor, I would like to clarify that the claims processing po ng PhilHealth and ang pagbayad po ay nasa ating mga regional offices po. And instruction po ng President PCO Morales and ABP Arnel de Jesus that ang ating mga health facilities po ay kung maaari po ay maka-reconcile ng records with our regional offices po para malaman po kung ang mga kiniklaim ng ating mga facilities po ito ay mga valid claims pa po. There are instances kasi, Mr. Chair, Mr. Chair, Your Honor, that sinasabi ng facilities po na X number of amount ay ang kanilang receivable kay PhilHealth, pero po on the part ni PhilHealth po ay mga claims po yan ay nasa status ng return to hospital or denied claims. So ibig sabihin po,
VP Zamsiaco, the question is very simple. I think this goes for everyone. Kung may magte-testify about dan sa hingingan sa loob, wala kayong problema. And you even encourage it.
yes sir, definitely sir.
So siyempre, dahil ang sinasabi mo, VP Zamsiaco, ang corruption if ever nasa region dahil doon ang koleksyonan at wala sa central office.
Mr. Chair, Your Honor, clarify ko lang po, hindi ko po sinabi na yung corruption na sa regional office. Ang sinasabi ko lang po, ang pag-process ng claims po natin ay nasa region po at saka yung pagbayad po ng ating mga hospital ay nasa region po yung proseso po natin.
Tama, kung may corruption man, nasa region. Kung sakali.
Mr. Chair.
Mr. Chair.
Sige po, si Bishop Benny po muna, Mr. Chair.
Mr. Chair, alam nyo, yung sinasabi po ni Mr. Lechauco, nakausap ko po itong mga ibang centers na ito. Tama po ang kanilang binibigay ng mga dokumento. I do not know why kinakailangan sabihin sa kanila na dapat checkin nila ito. Tama eh. In fact, kung hindi po sila natatakot, they are willing to testify. Yun po ang sinabi sa akin. But they are afraid to testify. Isi po. Anyway, Mr. Chair, yun lang po ang tanong ko. I will give way to Congressman Stella Kimbo. Pero please allow me to be able to have the second round, Mr. Chair.
Of course, Minority Floor Leader Abante. Deputy Chairman Alvarado.
Mr. Chair, susundan ko lang yung statement mo kanina. Kasi napansin po natin na yung mga regional director po na questionable, sila pa yung hindi nagbigay ng waiver para sa AMLAC, Mr. Chair. Kaya yung sa sinabi po ni Mr. Lim Xiaoco Jr. na doon nagbabayad, Mr. Chair, makikita natin na kung doon sila nagbabayad, malaking pagkakataon ang mabubuklat natin kung makapagte-testify rin dito sa harap ng Kongreso yung mga pinaghihinalaan na regional director sa PhilHealth. Although hindi naman lahat ng region ay may problema, pero kagaya po ng Region 5 at Region 8 na may red flag sa COA, sana po sila po ay nakakapag-testify dito sa ating committee, Mr. Chair.
Thank you. Bipilim siya ko, may po-point out lang ako sa iyo. Di ba yung kinuha ko kanina, 51, sabi ko, na institutions na may fraud cases, binigyan nyo ng IRM. Tama ba? Kanina, yung present ko, nung umaga pa lang.
May mga
51 na mga healthcare institutions, may fraud cases sa inyo na pending. Binigyan nyo ng IRM. Nakita mo yung kanina, di ba?
yes, Your Honor, sa presentation niyo po.
Okay. Pagmasdan mo doon ng mga region, may mga region doon na malinis. May mga region doon na may mga fraud cases, binigyan pa rin ng pondo. I think that in itself is an indication. Makikita nyo kagad. Before I recognize Congresswoman Stella Kimbo, yes, Kong Janet.
Yeah, Mr. Chair, if I may just be allowed to quickly interject. Kanina po kasi naitanong nyo na yung po bang opinion ng ating butihing resource person sa pagsabi niyang sa regional level nangyayari yung fraud kasi doon nangyayari yung bayaran. Mr. Chair, can we have that stated again?
Mr.
Excuse
Chair,
me, Congressman Janet, Mr. Chair. Sa pagkakaintindi ko po, hindi po sinabi ni Mr. Lim Xiaoco na doon nangyayari ang fraud. Ang sinabi po niya, kung di po ako nagkakamali, ay doon nangyayari ang bayaran. Ang sinasabi lang po namin ni Chairman Defensor, malaki ang pagkakataon na kung doon nagbabayaran, baka doon din nangyayari yung lokohan o yung sindikato, Congressman Janet.
Mr. Lim Xiaoco, you can clarify your put state on the record kung ano po yung eksaktong salita.
Mr. Chair, Your Honor, maraming salamat po. Sa proseso po ng pagbayad ng PhilHealth, pag-release ng pondo po sa ating mga facilities para pagbayad sa mga claims na sinasabit po nila sa atin, ang claims po galing sa hospital ay pumapasok sa ating mga regional offices and sila po ang nagpo-process noon. And after ma-process po nila at saka ready for payment po, sila po ay hihingi ng fund transfer sa ating Treasury Department po. And ang Treasury Department po natin magbibigay ng fund transfer doon sa region and ang ating mga regional offices po, siya na po ang nag-release ng payment to the healthcare providers po natin. So yun po ang sinasabi po natin. Hindi tama po si Kong Alvarado that hindi ko po hindi ko po sinabi na mayroon pong corruption doon sa regional office po. Maraming salamat po.
Yeah, Mr. Chair, just to have that clarified, wala po bang instance, Mr. Chair, Your Honor, na yung mga opisyal sa central office or mga miyembro ng board or opisyal ng Department of Health or chairman ng board or kung sino mang mga nasa poder dito sa central office ng PhilHealth ay tumatawag to either follow up, fast track, or facilitate payments to hospitals or clinics.
Ang tanong ni Kong Janet Garin,
Naintindihan-
meron ba tumatawag sa central office ninyo, including the chairman of the board?
Mr. Chair, Your Honor, hindi ko po masabi po yan kung mayroon po o wala po.
Mr. Chair, allow me to reiterate and to remind our good resource person that you are under oath. Kasi kanina, sa sagot mo, tila pinapalabas mo na walang alam ang central office kasi ang pagproseso ng mga bayaran purely sa regional level nangyayari. We want to go to the bottom of this problem. Wala po bang mga nagfa-follow up, tumatawag, kumakausap for fast-tracking releases or reimbursement at the level of the central office? Because I find it unfair and I find it futile, Mr. Chair, na kapag ang isang organisasyon, you refuse to acknowledge flaws in the system, mahirap po talagang linisin. Mr. Chair, if I may, Mr. Chair, very quickly lang po. Ang proseso pong sinabi ng ating resource person, let me take cognizance of that. Kasi po, nangyayari ang mga pagnanakaw, paglilin lang sa PhilHealth, hindi lamang po dahil sa baba o dahil lamang po sa taas. It's actually a collusion of events. Why are you going to make policies that will make fraudulent claims easier? Why are you not going to decide on cases or why are you not going to implement decided cases at babalik ta rin lang po? Because if you look at the mother of all frauds, which started on cataract, ang nag-squill ng lahat ay regional office. Anong nangyari? Naging kawawa, kinasuhan, pinapahirapan. Mr. Chair, I understand the feelings of a resource person na maiipit sila kapag sila'y sumagot. But precise for me to put it on the record, nangyayari ito dahil merong pagsasabwatan na nangyayari. Maraming salamat po.
Thank you, Honorable Garin. The Honorable Kimbo is recognized. Please proceed.
Thank you, Mr. Chair. Mr. Chair, may I have your permission to share a screen?
Go ahead, please.
Mr. Chair, my questions are for Dr. Pargas.
Where is Dr. Pargas? Ay, okay. Si Dr. Pargas attended to
sige po kay...
Pero nandito na po siya. Go ahead. Please continue.
Alright. So, magandang hapon, Dr. Pargas. Tulad ng nabanggit naman in the previous hearings, ang IRM naman ay hindi bago, di ba? You started using this nung panahon ng Yolanda. And ang purpose naman talaga ng IRM is to facilitate claims. In other words, ayaw natin na maging balakid ang kawalan ng pera sa hospital, na maging balakid ito sa healthcare na kailangan ng ating COVID patients. No? Tama naman yon. Yan ang primary na layunin ng IRM.
Tama
to
po,
avoid delays. And in other words, Dr. Pargas, kung hindi nangyari ang COVID, ay hindi natin ibabalik ang IRM system. Tama po?
Tama po, Mr. Chair.
So ang ibig sabihin nun, kung hindi nagkaroon ng COVID, ang current natin na pondo, ang current natin na sistema ay sapat para tugunan ang needs ng ating mga kababayan.
For the funds, Madam, I would like to refer that to our fund management.
No, pero in general, di ba? Kasi nag-IRM tayo para sa COVID. So kung hindi naman nangyari ang COVID, ang current system natin ay more or less in fighting form. Tama po?
Yes, Mr. Chair.
And right now po, ang na-authorize na IRM allocations ay umaabot sa 26.8 billion pesos. Ito po ba ay bunga ng isang board resolution?
Yun pong pagtatalaga ng IRM bilang kasama sa mga special privileges pagdating po sa fortuitous events Meron po itong board resolution noong January po. At yun naman pong pag-ratify nung pong amount na around 27 billion, meron din po itong board resolution.
And so nag-deliberate, in other words, sa isang board meeting as to the ratification ng amount at saka pati ng pagbalik ng sistema. Tama, no?
Tama naman po.
And sa board meeting na to, present po ba si Secretary Duque na siyang chairman ng board ninyo?
Mr. Chair, our corporate secretary is here para lang po ma-certify if the secretary then as the chair was present during the meetings. Ni Jonathan Mangawang po.
Attorney Mangawang is recognized.
Good afternoon po. Secretary Duque was not present during the RBM on March 31.
So wala siya sa meeting.
Yeah.
But I suppose aware siya sa IRM. Aware siya sa nangyaring pag-approve ng pagbalik ng IRM para sa COVID at pati ng amounts approved. You copied his office.
Yes, I would think so, Congresswoman Stella Kimbo.
All right. So thank you. Pwede ba natin linawin, saan ba talaga galing ang pondo para sa IRM? Ito po ba ay galing sa reserve fund?
Mr. Chair?
Dr. Vargas?
Yes. I'd like to ask for our fund management for the funding.
In other words, did you have to move these funds from your reserve fund? Nilipat niyo ba yan sa inyong ordinary expense account?
VP Lim Siaco.
Mr. Chair, Your Honor, ang ating pondo para sa IRM ng COVID ay to address the COVID pandemic ay kinuha po as part ng ating COB, Corporate Operating Budget in the year 2020 po.
So in other words, sir, hindi nyo na kinailangan mag-withdraw from your reserve fund?
Sorry. Mr. Chair, Your Honor, yun po kasama para sa ating current COB po ng 2020. So yun po ang source po ng ating IRM po.
In other words, sapat naman ang inyong pera at the moment, so you did not have to get from your reserve fund. Tama, no?
Mr. Chair, Your Honor, tama po. Tama po. Subalit po, ang ating actuary po ay may computation ng amount para sa COVID po that kailangan din po natin makonsider po.
Sige, mamaya na lang natin yan pag-usapan. But right now, pwede ba natin linawin kung ano yung proseso? So you determine the allocations. So yan po ay nasa isang board resolution. Pag okay ng ang allocations at i-release na ito, sino po ang humahawak ng IRM releases? Ito ba ay pumupunta sa regional office or diretso sa hospital?
Mr. Chair, Your Honor, ang proseso po ng pag-release ng IRM po, initially po ay through our regional offices po, 88% po ay release ng ating mga regional offices and eventually po, transfer po sa head office and 12% po ay nilabas ng release po ng head office directly to the healthcare facilities po.
So ito pong 14.9 billion na na-release nyo na, yan po ay hawak na ng mga hospital. Tama po?
Yes, Your Honor.
So in other words, nasa bank account na ito ng mga facilities?
Your Honor, yes po. And
so pagkatapos,
na-receive po nila yung pera po.
So ang mangyayari po niyan, kapag nakarating na sa bank account ng mga facilities, eventually, saka lang nila ililiquidate. Tama po?
Yes, Your Honor.
And so sa ngayon, narinig ko kanina, ang claims na pwedeng i-charge against the IRM would of course include COVID, pero kasama din dyan ang non-COVID. In other words, it's any kind of claim. Tama po ba yun?
Tama, Your Honor.
So itong hospitals, pwede ba nila gamitin yung pondo na yan for other purposes? Ibig sabihin, halimbawa, pambili ng testing kits, halimbawa, o pambili ng supplies. Pwede ba nilang gamitin yan, yung pondo na yan?
Tama, Your Honor.
Pwede. pwede rin nilang gamitin yan para pang sweldo ng kanilang mga personnel?
Your Honor, pwede po nila magamit para sa salary ng mga personnel din po nila.
So in other words, yan ay talagang within the control of the hospital. Ibig sabihin, hindi lang para sa claims, kundi pwede nilang gamitin yan for their operating expenses. Tama po?
Ang pera po ay na-transfer natin sa healthcare facilities po para sa kanilang operation din po, and then based sa claims na nasa atin at saka isa-submit pa po nila.
So in other words, kung ang so far, halimbawa, nag-release ng 100 million, tapos ang claim so far ay 10 million, yung balance na 90 million ay pwedeng gamitin ng hospital yan for other purposes tulad ng pasweldo ng kanilang empleyado?
Tama po, Your Honor.
Naku, Mr. Chair, kaya pala tayo nagkakaproblema dito, Mr. Chair, dahil talagang halos walang control itong paggamit ng pondo galing sa IRM. No? So, balikan ko na lang yan, no? Kasi ako yung nagulat na napaka-liberal po ng paggamit naman ng IRM. Dahil ang alam natin, kayo ay isang insurance fund. Hindi naman po kayo nagpapautang sa ospital. Kayo ay isang insurance fund, so dapat ang pinupondohan niyo lang po ay ang mga insurance claims. Hindi po ba? Pero anyway po, pupunta na ako sa aking next question. Ito pong 26.9 billion pesos po. Sa tingin niyo po ba yun ay eksakto lang yung amount na yan? Paano po ba natin na-determine yan?
Ito po ay kinompute nga natin according to the historical claims of the facilities for 2019 over 90 days or for the quarter, at ito po ay ang ibinibigay natin doon po sa mga na-identify na mga facilities po. Maaring hindi po ito tama, ano ba tawag? Maaari pong ito may kulang, maaari din pong lumabis, depende sa pangangailangan ng ospital, kung kaya nga po doon sa atin pong, pero yun po, yung ginamit na paraan para po makompute ito. Pero kung ito po ay tama lang or may kulang, it would depend po of course on the pangangailangan ng ospital.
Okay, Dr. Pargas, isa-isahin natin ha. Tama po ba na ang predicted number of cases ninyo ayon sa isang hearing is 209,000 cases? Tama po?
Before you answer, Dr. Pargas, Congresswoman Kimbo?
Yes, sir.
Yes. Based on your questions and the reply of PhilHealth, unless meron pong kumukontra doon sa sinabi ni Mr. Limsiaco about doon sa advances to the hospitals, I would like to enjoin the committee to both of the Committee of Public Accounts and Good Government Public Accountability led by Chairman John Alvarado. I would like to move that we unanimously resolve to call for a suspension and to stop any payment and to withdraw all funds in the IRM. I so move for the part on the part of the Committee on Public Accounts.
Mr. Chair, bago po umayon ang Committee on Good Government and Public Accountability, otherwise known as the Blue Ribbon Committee, ipaintindi lang po natin sa taong bayan na ang paggamit ng RIM ay hindi naman likas na masama. Yung paggamit ng IRM, hindi likas na masama. Bagkus iyan po ay dapat kung gagamitin sa mabuting paraan, ay makakatulong naman talaga sa ating mga ospital. Lalong-lalo na yung mga ospital na maliit lamang yung kakayahan upang magpagaling ng ating mga minamahal na taong bayan. Ngunit sa panahon po na ang isang insurance, kagaya po ng PhilHealth, na dapat ay nagbabayad pagkatapos na nung dapat po nagre-reimburse o nagbabayad pagkatapos po na ang isang miyembro ay magkaroon ng sakit at kailangan bayaran sa ospital, ay nagbibigay na ng advance na tulong sa hospital at kagaya po ng sinabi kanina ni Mr. Limsiaco Jr. na yung hindi magagamit na pambayad o singil, yung hindi masisingil doon sa IRM o Interim Reimbursement Mechanism ay maaari nang gamitin ng ospital sa ibang pangangailangan nito. O kahit saan ay hindi na po tama, Mr. Chairman. Kaya po, dahil po sa nakita ng komiting ito na pang-aabuso na ginagawa ng ilan sa mga opisyal o kasabwat pa ang ilan sa mga ospital sa IRM o Interim Reimbursement Mechanism, ang chairman pong ito ng Blue Ribbon Committee kasama po ang ating mga miyembro ng Blue Ribbon Committee ay umaayon sa Committee on Public Accounts para ipatigil muna ang pagre-release ng IRM.
Just one interjection.
Yes, Congressman Barsaga.
Dr. Pragas, may mga report na nakakarating sa akin coming from private and public hospitals na up to now, hanggang sa kasalukuyan, walang implementing rules and regulations itong IRM na kung saan nag-release kayo ng 29 billion. Meron na bang implementing rules and regulations?
Congressman Barsaga, before we proceed to the questions, we have yung pong ating joint motion of the two committees. Okay, kasi po yung sinabi kanina, nung tinanong ni Congresswoman Stella Kimbo,
Mr. Chairman,
they can use the fund for anything. Number two, kanina sinabi po ni Dr. Pargas, they can use it on suspicion of COVID, hindi po positive sa COVID. At ito nga po, ang response natin is to suspend release and whatever fund is there to withdraw for the IRM. So, motion, there being no objection, motion is carried on the part of the Committee on Public Accounts.
Mr. Chair.
Mr. Chairman.
Mr. Chair.
Mr. Chair.
On the part of, there's a pending motion.
Yeah, Mr. Chair, can I...
Is
can
that
It's a proposed
tinututulan niyo po
amendment.
ba yung motion natin, Congresswoman Garin?
Point of
I have a
clarification
proposed
lang, Mr. Chair.
amendment to the motion, Mr.
Point of
Chair.
order, Mr. Chairman. Point
Yes,
of
what
order.
is the point of order?
We need to
Deputy Speaker
clarify, Mr.
Einstein
Chair. We need to
Fernandez.
clarify yung motion. Kung ito po ba ay i-halt na natin yung implementation ng IRM, is it...
Recommendation po ito.
Yes. Yung recommendation
Deputy Speaker
natin.
Einstein, ito po ay
Correct.
recommendation
I understand,
po
Mr.
natin.
Chairman, I understand. Yung pong pagpigil natin through a resolution at recommendation natin, does it follow that the funds that were transferred through advance payment sa mga regional offices follows that ibalik din nila ang pera
Congressman
sa
Dan,
PhilHealth?
point of order lang just to clarify. On the part of the Committee on the Public Accounts, that motion is carried. So you have to carry it and then we have to have
Yeah, I
clarification.
have a proposed amendment, Mr. Chair, to the motion.
Yes, amendment.
Mr. Chair, if I may be allowed to...
Yes, Congresswoman Garin.
Yes, to propose that an amendment be incorporated that the motion include without prejudice to liquidating the initial IRM funds released. The basis of that, Mr. Chair, is that after the cash advances were released to the hospitals, as a memo was issued by PhilHealth saying that there is no need to liquidate as of the moment. Baka po kasi ma-misinterpret na dahil nga hinuhold na yung pag-release, hindi na i-liquidate.
Congresswoman Green, if I may clarify, let's first clarify the motion and then we would use, we can have a follow-up motion to that motion, to the decision of the
No problem with
committee.
me, Mr. Chair.
For the committee
Yes, para po sa kaalaman ng lahat, baka po naguguluhan kayo. Si Chairman Defensor po kasi ay Vice Chairman ko po sa Blue Ribbon at ako po ay kanyang Vice Chairman sa Public Accounts. Kaya po yung motion po na ginawa ni Chairman Defensor kanina ay yun po yung active motion para sa Blue Ribbon Committee at yung motion ko naman po na ginawa ay iyon po ang naging active motion ng Committee on Public Accounts. Para lang po sa magtatanong ng kung may order po yung ating ginagawang proseso. Kaya hearing no objections po, sa parte po ng Blue Ribbon Committee, wala po kaming naririnig na pagtutol sa ating binigay na motion. Rekomendasyon po ng Blue Ribbon Committee na ipatigil muna ang paggamit ng IRM.
Mr. Chair,
Before we proceed, what is the clarification of Deputy Speaker Fernandez?
Mr. Chairman, if we're going to stop yung implementation ng IRM, does it mean that all the public hospital as well will stop the implementation of this IRM?
No.
Sa lahat?
Yeah. Ang sense of the committee, based on the motion that we approve, is that we suspend the release kasi meron pa silang remaining 15 billion pending and to withdraw whatever is there. Ngayon, babalik po tayo dun sa motion ni Honorable Janet Garin kasi may 2.7 na nandyan na po sa mga hospital under liquidation.
In other words, Mr. Chairman, yung pong na-advance na almost 15 billion sa mga hospitals will not be stopped anymore. Ang sinasabi po natin, sa totality ng 30 billion, yung pong na-i-advance na po sa mga hospitals, ililiquidate na lang po yon. At yung remaining na 15 billion...
The motion is that we are telling PhilHealth to withdraw the remaining funds outside of the 14B. Kasi di ba, 27, nag-release na ng 14,
Yes.
may niliquidate na 2.7. So ano yung pending doon? Medyo linawin natin to. Baka mamaya mababo yung pondo ng ating mga miyembro ng PhilHealth.
Motion to
I-withdraw.
suspend, Chairman Defensor.
Okay, Mr. Chairman...
Motion to suspend.
Sorry. Session suspended. Session resume.
Mr. Chairman.
Congressman,
Yeah.
Deputy Speaker Fernandez.
So we wanted to be clarified doon sa ating pong approval ng ating pong kahilingan sa PhilHealth na yung pong na-advance na almost 14 billion, is that right, Mr. Chairman, ay subject for liquidation ng PhilHealth. At yung natitira pang additional na 15 billion, yun muna po ang hold until such time na ma-liquidate na ng mga hospital yung na-advance ng PhilHealth. Yun lang po ang gusto kong i-clarify, Mr. Chairman.
Thank you, Deputy Speaker Fernandez. The Honorable Garin.
Mr. Chair, clarification lang po. Yung pong inaprubaran natin is a motion that no further release of IRM will be made. Tama po ba, Mr. Chair?
Yes.
Kakibat rin doon sa inaprubaran natin dahil merong memo na nirelease ang PhilHealth na yung unang nagkaroon ng cash advance o IRM ay okay lang na hindi muna mag-liquidate. Yung po ibinabaliktad natin and we are calling for the immediate liquidation of cash advances. Tama po ba, Mr. Chair?
Yes.
However, because we firmly believe that hospitals and PhilHealth members should not suffer, tayo po ay nananawagan ng mabilis na reimbursement ng mga legitimate na gastusin related sa COVID ng ating mga ospital at pasyente. Tama po, Mr. Chair.
Tama yun. At ito ay pagbalikwas na, o ito na rin yung pagtatama nung ginawang circular ng PhilHealth na wala mo ng liquidation. Yung binabanggit mo sa ngayon na Congresswoman Janet Garin.
Yes, Mr. Chair.
Thank you.
Mr. Chairman,
Yes, Honorable
in support of
Busaga.
the statement of Congresswoman Garin, may na-receive tayong information that this August, the Board of Directors of PhilHealth has already made a decision to suspend further releases for IRM. Totoo ba yun o hindi? Who will be the competent person?
Pwede po namin kilalanin ang ating members of the Board of PhilHealth. Sige po.
Good afternoon po, Your Honors.
Can you introduce
Actually,
yourself and what office you represent?
Dr. Gonzaga, member of the board.
Presenting ano, ma'am? Representing which sector?
Expert panel po.
Apa.
Nasuspend na po namin yung release ng interim reimbursement mechanism during the last meeting of the board. Ngayon, if I remember correctly, ang initial ho namin requirement was to liquidate within 60 days after the check has been released. But as far as I remember, marami po nakiusap na ospital dahil sa dami po ng pasyente at karamihan po ng mga empleyado ay work from home. Kung pwede daw pong ma-delay ng kaunti ang pag-liquidate. So, hindi
Nag-request daw po ang
umaabot ng-
ospital na mag-delay ng pag-liquidate. Apo, tuloy po.
Ngayon, sa halip po naging 60 days, in-extend po ng 120 days para po mapagbigyan ang karamihan ng mga ospital all over the Philippines.
Ang clarification po, nagkaroon ba ng pasya ang Board of Directors ng PhilHealth to suspend further releases for IRM?
Ang initial po namin na pag-usapan ay within 2 weeks, subject to review, kasi periodic po dapat ang aming evaluation ng mga pag-release ng pera ng IRM.
So, suspended muna.
Opo.
Okay. So, there is no conflict between our motion as well as the present position ng Board of Directors, Mr. Chairman.
Yes.
Okay. I'll just follow up my pending question, Dr. Pragas. Sa pagtatanong sa iyo kanina ni Congresswoman Gimbo, ang sabi mo pwedeng gamitin sa sweldo, pwedeng gamitin sa pagbili ng testing kit ng mga ospital na tumanggap ng IRM. Tama ba yon?
Mr. Chair, it was SVP Limsiaco po. It was SVP Limsiaco who answered.
Limsiaco po. Mr. Limsiaco, can you please reply?
Mr. Chair, Your Honor, ganito po ang sistema po
Hindi, ang tanong lamang kanina, pwede bang gamitin pambayad ng sweldo yung IRM?
Mr. Chair, if po pwede po, maibigyan ko po kayo ng context ng sagot
Hindi,
ko
wag
po.
na yung concept. Tinatanong natin, ako private hospital or public hospital, tumanggap ako ng 50 milyon IRM. Pwede ko bang gamitin to sa sweldo?
Okay. Mr. Chair, Your Honor, ang pera po na ibibigay po natin sa mga hospital po ay gamitin ng hospital para po sa health services po natin.
So,
When
hindi
we say
pwede.
health services po,
No,
kasama
tanong
din
lang
po
natin,
yung
pwede ba o hindi sa sweldo?
pwede po dahil kasama
Mr.
sa health
Limsiaco,
services po yun.
iklaro mo kasi yung sagot.
Testing facility, pwede.
Come again, sir.
Testing facilities.
Facilities, yes po, sir.
Oh, pwede.
Magagamit po yan.
Ang tanong ko, tama ba yung impormasyon na nare-receive ko na up to now, walang implementing rules and regulations ang IRM?
Dr. Vargas can answer that one, Mr. Chair.
After that, we will return to the Honorable
Hindi lamang
Kimbo.
tanong, meron bang implementing rules o wala?
Mr. Chair, the Circular 2020-007 is the guidelines
Hindi
po.
na, Circular 2020, is that the implementing rules?
Sir,
Or
that's
tanong
the
ko, meron bang
guidelines po.
implementing rules? Yes or no lamang? Kasi ang sabi ng mga doktor, kung PD, verify mo naman, may IRM kami na hindi ko malaman kung paano ko i-dispose to. Sapagkat walang implementing rules and regulation. Ganun lang kasimple. Totoo ba na up to now, walang implementing rules and regulations yung pondong nilabas nyo na umaabot ng bilyon?
Mr. Chair, idagdag ko na lang yung tanong. Dahil ba sa sinabi
Ano
nito-
nga, may implementing rules ba? Wala.
Honorable Barsaga, Honorable Garin, it is still the time of the Honorable Kimbo, so please answer and then we'll return
Answer,
to Honorable
nakakaya
Kimbo.
na kay Congresswoman.
What we have po is the guidelines. What we have is the guidelines po.
Okay, so walang IRR.
Wala pong IRR.
Oh,
mismo.
yan ang sinasabi ko. Bilyon-bilyon ang nirelease yung pondo, wala kayong IIR, kaya yung mga ospital, hindi nila alam in good faith kung paano nila gagastusin. And that is the follow-up to the question of Congresswoman Gimbo. Eh baka dito, liable na kagad kayo.
Dr. Pargas, Dr. Limsiaco, balik na tayo kay Kung Kimbo. Ako may-ari ng ospital, nilagyan niyo ako ng IRM. Winidraw ko yung pera, nagsabong ako. Pwede, hindi? Pwede.
Hindi po.
Bakit hindi? Nandun na nga sa account ko eh. Malalaman niyo ba?
Nakalagay po sa ating guidelines na ang pera po ay gagamitin para po sa PhilHealth claims.
I know. Pero nandun
Provision
na nga
of
sa
healthcare
pondo ko, di
services
ba?
po.
Wala nga direct guidelines on the utilization kung paano. At anyway, I'll go back to Honorable Kimbo. Please continue.
Mr. Chair, klarong-klaro naman po no na ang IRM ay tila nagiging blank check na binigay sa mga hospital na pwede na lang gamitin sa kahit na ano, pambili ng floor wax, pambili ng kotse, at saka na lang ililiquidate. No? Kaya talaga nagtaka pa tayo kung bakit late na late po ang pag-liquidate. Out of the 14.9 billion, ang naliliquidate, 2.7 pa lang. Eh syempre naman po, because hospitals can freely dispose of the funds for the time being habang hindi pa liquidated. Kaya ako po isang ayon po sa inyong motion. Ang IRM po ay tila po nagiging blank check para po sa isang interest-free loan na binibigay sa mga hospitals. Na yan naman po ay talagang wala po sa mandato ng PhilHealth. Dahil ito po ay isang insurance company, hindi po yan pautang at pautang na interest-free. Kaya po, if I may proceed po, I will share my screen again po. Kasi po ang aking pong tanong ay ano ba ang basis nga nitong 26.8 billion na inallocate sa IRM. So please confirm, Dr. Pargas, 209,000 cases ang inyong forecasted number of cases for 2020. Tama?
Mr. Chair, I'll defer to our actuary.
Sige po, Madam Actuary, I heard you say this, 209,000 cases for 2020. Is this correct?
You're correct po, Madam Congressman.
And of course, dito sa 209,000 cases, hindi po lahat yan maho-hospitalize. Tama?
Tama po.
And are you aware that according to the WHO, 20% lang po sa lahat ng cases ang siyang magde-develop ng difficulty in breathing and would require hospital care. Tama po?
Tama po.
And ayon sa DOH, ito po ang breakdown ng lahat ng COVID cases. Mild, 90.3%, ang severe, 0.9%, and ang critical naman po ay 0.6%. Tama po?
Tama po.
And ito naman po, tama-tama, ito ang classifications po para sa case rate na itinalaga ninyo para sa COVID. Kasi ang case rate para sa critical ay 786,000, ang severe 333,000, ang mild naman is 43,000. Correct po?
Tama po.
At kung i-apply ko po ito, kukunin ko yung 20% ng 209,000 cases at i-apply ko po itong breakdown of COVID patients by severity of illness, makikita po natin dito sa table, kinompute ko na para sa inyo, ay 3.3 billion pesos lang ang ating expected na hospitalization claims dapat para sa 209,000 cases. Tama po?
Yung po kasing 209,000 cases na nilagyan din po namin yung mga mild na mapupunta po sa community isolation units na babayaran po namin ng 22,000. So on the assumption lang po yun.
So ang sinasabi niyo po na itong 90% ay makakapag-claim din ng 20,000?
Kung nailagay po sila sa mga community isolation units po, meron pong pakete para doon po, Mr. Chair.
Pero at this point in time, halos wala po yan kasi nga empty. Una sa lahat, kulang ang ating isolation facilities. Pangalawa, ay hindi naman po puno. Napakakaunti pa lang po ang naka-admit po dyan. So more or less, sa ngayon po ang aking pag-estima, 3.3 billion pesos lang po. So ang tanong ko po, bakit ang laki naman po ng inyong itinalaga para sa allocations ng IRM? 26.8 billion pesos kumpara po sa 3.3 billion pesos. Hindi po ba OA masyado itong 26.8 billion pesos na inestima ninyo?
Honorable Kimbo?
Yes, Mr. Chair.
Yes. Yan nga yung kanina, anyway, napag-usapan na naman and we made a motion in the committee. Kasi kahit yung 15 billion that currently are in the hospitals, napakalaki na po nun eh. In your estimate, it is 3.3 billion. Is this correct, Honorable Kimbo?
Tama po, 3.3 lang talaga. Kaya kahit na yung 14.9 na na-release na natin, kung ang motion nyo po kanina is to withdraw, ay agree din po ako doon. Pero syempre, sang-ayon naman po ako sa majority ng decision. No? But sa totoo lang po, yan lang po ang kailangan.
Gusto ko tanungin dito, yung binabanggit ni Congresswoman Kingbo na 3.3 billion lang, kahit na anong pagtingin niya, meron ba makapag-refute dito from hospital policy, Dr. Pargas, to our actuary, Ms. Santiago, Ms. Neri Santiago, meron po ba kayong numero to controvert o kontrahin itong numero na binabanggit ni Honorable Kimbo? 3.3 billion. Kahit na po sabihin na natin na 5 billion, meron po ba tayong ebidensya na mapapakita na makokontradiktong assertion ni Honorable Kimbo? Yes, Ms. Santiago.
Mr. Chair, Ms. Congresswoman, yes naman, maaari pong, kasi po magkakaiba po ang ating assumptions, ano? So hindi po namin ma-concretize ng data sa ngayon kasi po wala pa pong, hindi pa po sapat yung pumapasok na claims para sa COVID po. So,
BP Neri Santiago, di po ba dapat bago kayo gumawa ng IRM, meron na kayong assumptions? Kasi nakikita naman po natin yan eh, di ba? Na Metro Manila may problema, ganito yung ibibigay natin pondo, ito yung mga sumusunod na may problema, tapos ito yung nagpapa-hospital. On the, Ms. Kimbo, Congresswoman Kimbo, saan nyo po binase itong mga assumptions nyo?
Ayan po, ay ginoogle search ko lang po. At syempre po, naghahanap tayo ng credible sources. Kaya kung nakikita niyo po, Mr. Chair, WHO ang ginamit ko po para sa hospital admissions. Dito naman po, that's from the DOH. That's their actual classification.
Pwede po ba sabihin na ito rin po yung experience ng China at ng Estados Unidos?
Tama po, dahil yan po ay galing sa WHO, global na experience na po yan, Mr. Chair. So yan po ang aking findings sa ngayon. At sa akin po, hindi katanggap-tanggap yung sinasabi po ni Madam Actuary na kulang pa po sila sa datos dahil po ang petsa po ng pag-release ng IRM, kung ako'y hindi nagkakamali, ay June 9. By June 9, Mr. Chair, alam na natin ang patterns ng ating COVID cases. Halos 100, hindi naman 100,000, pero more than 50,000 na po ang cases natin by then. So dapat po, sapat na po ang datos by then to make a good enough or reasonable estimate. Dahil, Mr. Chair, itong IRM, we're setting aside funds. Hindi po ba? So ibig sabihin, imbis na gastusin natin yan for other purposes, ay talagang itinatabi natin at nilagay pa natin sa mga facilities mismo. So yun po ang aking first concern, and may I proceed po sa aking next concern po.
Honorable Kimbo, again, I will ask the question. Sabi niyo, Madam Actuary, ibang assumption ninyo. Are you saying and you're contesting the numbers as presented by the Honorable Kimbo?
Hindi naman po, Mr. Chair, hindi naman po kino-contest. Iba lang po yung basis ng calculation po. May mga scenarios po na tinitingnan po tayo, kami po, pagdating po sa pag-calculate po ng impact ng COVID cases.
Kasama rin po ba dyan yung suspected na binanggit ni Dr. Pargas na pag suspected, pwede na mag-claim ng package rate na 43,000 sa inyong assumption?
Ang inilalagyan lang po namin ng amount is confirmed cases.
Dr. Pargas mentioned earlier that if it's suspected, pwede na pong mag-avail of the package rate. Is that not correct, Dr. Pargas? You mentioned earlier. Please speak on the record.
Yes, Mr. Chair. Part of our policy are the suspects and the probable, including the confirmed cases.
And they can avail of the 43,000.
Yes, Mr. Chair.
Ayan ang nakakatakot. Congresswoman Kimbo, please continue.
Siguro, Mr. Chair, hingin na lang natin ang kanilang pag-compute, no? Mr. Chair, one more point, no? Itong estimates ko is based on 209,000 cases. Kung si Madam Actuary ay magsabi sa atin na hindi ako agree na 209,000, baka pwede pa tayo mag-usap, di ba? Pero ito pong estimates ko ay para sa 209,000 cases na mismong si Madam Actuary na po ang nagsabi dito sa hearing na yan ang kanilang forecast. So napakadali naman po ng pag-compute. So sana po sa lalong mabilis na panahon ay isubmit po sa ating komite ng office po ng actuary ng PhilHealth ang kanilang computations. Ano ang kanilang naging computational basis para mag-allocate po ng 26.8 billion pesos and 14.9 billion ang i-release nila by June 9 po, Mr. Chair.
Honorable Kimbo, you're correct. Alam mo, ang problema lang, Congresswoman Kimbo, yung classification ng may sakit kasi kahit na anong mangyari, hindi tatama yung numero mo pagka ang mga suspected cases, mga PUM, PUIs, ay isinama dito, talagang pwedeng lumaki ng lumaki numero.
Pero Mr. Chair, hindi nila kailangan magpa-hospital, di ba? Yan ang ating protocol.
Exactly, but they can avail of the 43,000. So mag-iiba na naman yung costing mo.
Opo. Pero klaro naman po kung sino dapat ang maka-admit po sa hospitals. Diba?
I agree
Hindi naman
100%. I agree with you. Please continue, Honorable Kimbo.
Sige po, so balik naman po tayo sa regional, sa basis naman po ng pag-allocate. Kasi syempre po, pag na-determine na po ang total IRM allocations, ma-release na siya. Ang tanong naman po is anong basis ng pag-allocate across the regions. And madalas pong sabihin na ang basis is historical claims. Pero ito po, gusto ko lang ipakita sa inyo na unfortunately, ang allocations by region is not based on COVID cases, which alam naman po natin, ang dahilan kung bakit may IRM at this point is really COVID. So it's unfortunate na for some reason ay hindi sila nagtutugma. So halimbawa po, ang NCR, alam natin may pinakamaraming COVID cases. Ang NCR naman po ay may pinakamalaking IRM allocation. So tama po yun. But for all other regions, Mr. Chair, hindi po nagtutugma. No? Halimbawa po sa Region 1. Ang Region 1 po, ang rank nila in terms of number of COVID cases is 11th. So they have the 11th highest number of COVID cases. Pero po, pagdating sa IRM, they have the 5th largest IRM. Diba? So in other words, disproportionately more ang allocation ng Region 1 kumpara sa COVID cases. Na alam na natin, ito ang pattern by June 9, nung na-release ang IRM. Similarly, ganun din po ang Region 4B. Ang kanilang cases po is hindi po masyadong marami. Sila po ang 15th highest number of COVID cases. Pero ang kanilang IRM is the 9th largest. Pero ang tanong ko naman po is bakit sa Region 6? Ang Region 6 po has the 5th highest number of cases. And although merong IRM allocation na determined for Region 6, which is 1.8 billion, bakit po hindi na-releasan ng pera itong Region 6? Dr. Pargas?
Chair, Attorney Labe will answer po for the IRM.
Yes, Attorney. Please reply.
Chairman, good afternoon. Marami po yung tanong ni Honorable. Yung pinakahuli pong tanong niya ay bakit hindi na-releasan yung sa Region 6 po. Ang nangyari po kasi, as you can see naman po kanina, na-present po natin or namin yung process ng pag-release ng IRM. Just so happen na ang Region 6 po, as per our record, ay umikot-ikot po yung papel niya hanggang sa bumalik uli sa ganito na lang po para mabilisin din. Ang Region 6 po namin na si yung RVP po doon ay supposedly reporting po sapat siya sa area Vice President. Ang nangyari po kasi dyan, ang aming Region 6 na RVP ay hindi po siya nagre-report sa area Vice President, kundi directly po siya reporting sa Senior Vice President namin. And sa kadahilanang yaon, marami pong findings yung sinubmit po nila na document regarding sa Memorandum of Agreement. May mga figure na hindi naman po tugma doon sa allowed or cap or ceiling nung IRM sa bawat HCIs. Kaya po hindi po siya naaprubahan. Kaya umikot uli, bumalik hanggang sa per our record nasa...
Attorney, if I may cut you, Congresswoman Stella, ay gusto mo sabihin, pag kunyari lang, no, hindi ko naman sinasabi, kung tamad o kung hindi, medyo hindi siya competent, yung inyong regional, regional officer, wala nang pondo yung kanyang region. Yung bang point mo?
Sir, hindi po.
Ang sabi mo sa akin, nagre-report yung regional vice president to the senior vice president. Nung pakialam ko dun sa reporting, ang sinasabi ni Kong Stella, kung nanong indication ng COVID, doon kayo mag-allocate ng pondo.
Sir, ang sinasagot ko po kung bakit ang Region 6 ay hindi halos na-releasan.
Sagot mo sa akin dahil nagre-report sa senior vice president. Is that your answer?
And I would just like to clarify, sir, the question of the Honorable Congresswoman was bakit po ang Region 6 ay hindi halos na-releasan po. And I was trying to explain kung bakit po hindi siya halos na-releasan because of the inefficiencies po doon sa pag-ikot po ng process ng application ng IRM, sir.
That is unacceptable. Honorable Kimbo, please continue.
Mr. Chair.
Mr. Chair, di ba malinaw naman po na ang layunin nga ng IRM is precisely matulungan ng ating COVID patients na magkaroon ng access to hospitals kung kailangan nila. Yan ang purpose. So simple lang ang tanong ko. Bakit sa mga places na maraming COVID ay hindi ganon karami o wala ngang release versus sa mga lugar na malaking ang release ay hindi naman po marami ang COVID cases? Bakit may disconnect? Yun ang general question. Wag na po tayo pumunta sa kung saan nagre-report si ganito. Wag na lang po. Conceptually, bakit naging ganito ang nangyari kahit na maliwanag na ang layunin ng IRM is precisely to address the needs of our COVID patients. Mr.
Honorable
Chair.
Kimbo, if I may give the chance to the Honorable Garinos from Region 6.
Yes.
Go ahead, please, Congresswoman
Thank you,
Garin.
Mr. Chair. With the indulgence of Congresswoman Stella Kimbo, I'm from Region 6. And this strikes me to the core. Baka naman po, para maayos ito, can we hear the response? Somebody from Region 6, the senior VP that you're saying, the inefficient person that you're saying, maybe we can hear, Mr. Chair, a response from Region 6 para once and for all, matapos yung problemang ito. Because we cannot say he says, she says.
Do we have the Honorable Regional, Honorable Kimbo, if you will allow, can we call on the Regional Vice President?
Of course, Mr. Chair. Go ahead, please.
Yes. Good afternoon. Can you hear me?
Yes.
Attorney
Yeah.
recognized. Go ahead.
Okay. Yeah, hi. I would just like to clarify that Region 6 submitted our proposals or our recommendations for the IRM on April 8 and April 15 respectively. We submitted it to the office of General Divilla, and the letters were addressed to General Morales. So I have here with me, and I can have it submitted right now to the chairman, my briefer with 26 annexes on how our papers went back and forth. And I just realized last week, upon asking other regional vice presidents, that's why we were having a hard time computing the amount of IRM for hospitals in Region 6 was because all other regions were given a specific list with the specific amounts per hospital, but Region 6 was not given a list of that. So maybe that's why.
Mr. Chair, with the indulgence of Honorable Stella Kimbo, medyo nagulat na ako doon. A specific list of hospitals with specific amounts were given to regional offices. But for Region 6, wala. Baka naman gusto nila ipadala na sa opisina ko para ma-hand carry ko na papunta ng Region 6, Mr. Chair.
VP Olero, is that correct? Yung kinaklarify ni ano?
Yes, actually, that's correct. No, in fact, as early as March 25, we already wrote Dr. Pargas asking about the effectivity of the IRM because in the last clause, the date of effectivity was supposed to be upon publication and submission to the UP owner. So we never got a reply to that letter. In April 8 and April 15, we submitted our recommendations, but without the amounts because we didn't know that amounts were going to be included because we were under the impression based on the corporate orders that the amounts and the approval will be given by the central office. They returned the papers to us, the MOAs to us, asking us to put in an amount. So we had to compute based on the directives in the guidelines, 90-day, the amount paid for the whole year divided by 365 times 90. When we submitted it again, it was again returned to us telling us that the amount was wrong. So we were wondering what the computation was. So the papers went back and forth. And it's not because I was reporting directly to the SVP for operations. It was because I don't know if it was inadvertence or it was deliberate that our papers went back and forth and we were not given the list that was given to other regions, the price, the ceiling of the IRM per HCI.
Okay, thank you for that, Attorney Olero. Congresswoman Kimbo,
Mr. Chair.
nung po nakita ko ho yung hearing ninyo doon sa Senate, narinig ko na rin po si Senator Drilon, who's from Iloilo. Dito po, Congresswoman Garin, ako po, taga Iloilo. Sinabi kanina, suspended yung release ng budget. Pero anyway, mayroon pa kayong natitirang pondo dyan. Will you be releasing for Region 6? Attorney...
Yes, Mr. Chairman. Attorney Labi po.
Attorney Labi?
The suspension is merely intended for PhilHealth to correct all the findings, both houses, doon sa process ng pag-release ng IRM. But of course, we intend to go back releasing because we understand the needs and help needed from PhilHealth po para sa ating mga HCIs. So I
Kailan
would
po
like
itong
also to,
release for Region 6? Kailan po?
yung sa Region 6 po, Mr. Chairman, that the last time I checked ay nasa office na po ni EVP COO kasi what our VP Holier was saying, yun po yung, it really reflects doon sa investigation na kinanda ko kung bakit ang Region 6 ay hindi halos na-releasean ng pondo. Ganun din naman po yung sinabi ko because the documents that I have, ganun din po yung findings ko nung nagkausap po kami kung bakit hindi na-releasean ng Region 6.
Hindi nga po
Honorable
yun
Chair.
ang point nga, hindi dapat nyo ginagawa yung ganyan na meron tayong COVID, pagkatapos nagkakaroon kayo ng sino ba nagtrabaho dito, sino nagtrabaho. Hindi ganun po yun eh.
I understand
Diba?
po.
If at all,
Kaya,
kayo mismo Central Office should immediately fix the problem dahil gusto nyo nga mag-reflect yung budget ninyo for every area. Now, will there be a release for Region 6? Do we get the commitment also of the members of the board kung sakali po yung Region 6? Although the call is to suspend, pero of course Region 6 has to be, there should be a budget allocated dahil kawawa po yung mga tao doon. I saw the budget is 121 million. Napakalit po. Isang hospital lang po dyan, mas malaki pa nga yung isang hospital dito sa Maynila.
And Mr. Chair,
Honorable Chair.
the first few hospitals that responded to COVID patients, severe cases, pero nag-survive are, sorry.
Sorry ha, Congresswoman Kimbo, pagbigyan lang po natin yung taga Iloilo, si Kong Gasatay. Nakita ko yes please, Kong, mabilis, nakisingit po tayo kay Kong Kimbo. Go ahead.
Thank you, Mr. Chair. Very briefly lang po, no? We discussed this last Wednesday night. Just to show na yung regional hospital po dito sa Bacolod, the government hospital, twice na pong awarded best hospital in the Philippines. As early as March 18, sumulat na sa PhilHealth, nagpadala ng letter of intent. March 18, April 4, nag-submit ng 9 copies ng MOA. April 6, nag-acknowledge si PhilHealth na natanggap yung MOA. April 8, nagpadala ng response ang regional office ng PhilHealth sa Corazon Locsin. April 14, ang PhilHealth gumawa ng communication sa regional hospital sa Bacolod na magkaroon ng amendments ng konti sa MOA. April 17, na isubmit yung corrected MOA sa PhilHealth. June 17, sumulat ulit yung PhilHealth na kailangan i-update yung status ng IRM. Humingi yung hospital na Bacolod, that was June 17. June 24, naglabas ng information si PhilHealth na merong kulang sa signature, no, kulang from the part ng PhilHealth. July 7, natapos yung MOA. Until now, wala pong response, Honorable Chair. Kaya ito yung question ko the last time. Pinapabayaan yung Region 6. Di naman pwedeng sabihin na walang intention, walang documentation. As early as March 18, Honorable Chair, sumulat na po yung Regional Hospital ng Bacolod sa PhilHealth, Honorable Chair. Maraming salamat.
Thank you, Congress Ataya, and I'll join you and the rest of the Region 6 colleagues of ours here kung ano po yung move natin to push the release of the budget. Congresswoman Kimbo, please continue. Last na yan, Kong Kimbo, please.
I have one issue na lang po. Dr. Pargas. Nandiyan pa ba?
Mr. Chair.
Yes, andito po siya.
So, ang isang basehan din natin ng IRM, I suppose, is capacity of the hospital. In other words, the bigger the hospital is, in other words, the more beds, dapat mas malaki ang IRM. Tama po?
Mr. Chair, again, the computation po initially ay para sa lahat po and historical po yan. Dahil nung po mga
madali na yung tanong ko. Di ba pag mas malaki ang hospital, mas maraming bed, dapat mas malaki ang release. Tama? Yes or no lang po?
Hindi po ibig sabihin, ma'am, kasi depende po sa dami ng mga ospital. Depende po, kasi nga po historical po yung basis ng ating computation.
Okay, pero more or less, tinignan niyo na ba ang average IRM per bed? So ito, tinignan ko po, ito yung national average. By level, ang level 1, level 2, level 3, more or less, uniform naman ang ina-allocate ninyo na IRM per bed, which is about 240,000 pesos. So ito pa ay sinasadya ninyo or by accident lang na more or less uniform? Was this a target on your part?
No, Mr. Chair.
So by accident lang talaga na naging per bed ha? Doc Pargas, ang pinag-uusapan natin dito is allocation per bed.
Yes, Mr. Chair. Yes, Mr. Chair.
Okay, so by accident lang ito. Pero would you agree with me na kapag mas malaki ang hospital mo, mas marami kang patients because you have more beds, ay dapat mas malaki ang iyong IRM. At kung ikaw naman ay napakaliit na hospital, ang capacity mo ay halos konting-konti lamang, dapat mas maliit ang iyong IRM. Generally. Tama po, di ba?
Opo, kung lahat, yes po, generally all factors being considered.
Yes. Okay. But let me just show you this slide. Tinignan ko po ang IRM per bed ng lahat po ng hospital. And even if the average is 240,000 IRM per bed, meron tayong about 14 hospitals na sobrang lalaki ang nakuhang IRM per bed. Katulad po nito, Bukidnon Provincial Hospital. Ang bed capacity po niyan 25 lamang. Pero ang IRM po niyan is 1.3 million pesos per bed. Pagdating naman po sa isang private hospital, dito po sa Cordillera, Holy Trinity Medical Clinic, 14 lang po ang beds dyan sa hospital na yan. Pero ang IRM per bed is umaabot ng halos 800,000. Anong paliwanag dito? Bakit parang tila merong mga anak ng Diyos no na ang laki-laki ng IRM allocation per bed kumpara po sa national average? What's happening here, Dr. Pargas? And let me show you na if you compare this IRM allocation per bed sa mga mas busy na hospital dahil mas maraming cases dito sa NCR tulad ng Lung Center of the Philippines, tulad ng PGH, ang layo po ng liit ng IRM per bed dito sa PGH. It's only 197,000 per bed. So what's happening here, Dr. Pargas? Parang talagang walang sound basis for allocating your IRMs, whether it's by region, by province, or by hospital. Dr. Pargas.
Opo. Mr. Chair, Madam Congresswoman, again, ang atin pong naging basis for the computation of the IRM is the historical claims of the per facility in 2019. So hindi po kami bumaba or nag-drill down to the allocation per bed. Yun po. Kaya po kung ano po yung kanilang history ng claims in 2019, yun po yung naging basis ng ating computation for the IRM per facility po.
Ang problema kasi, Dr. Pargas, kayo na mismong umamin nung huling hearing na meron tayong fraud. So in other words, meron tayong upcasing, meron tayong ghost claim. So sinasabi ninyo, yung mga hospital na malakas mag-upcasing, malakas mag-ghost claims, and therefore mataas ang kanilang historical claims, sila rin po ang mga hospital na makakakuha ng mas malaking IRM kahit na kakaunti lamang ang COVID cases sa kanila. Yan ang gusto kong ipunto, Dr. Pargas. Yung pinagpipilitan nyo po na historical claims ang basis, talagang maling-mali po yan, Dr. Pargas, no? And
Honorable Kimbo?
Opo.
Yeah.
Mr. Chair, my last slide.
Last slide, Honorable Kimbo.
Yes po. Itutuloy ko na lang po. Ang implication po ng isang bulok na sistema ng IRM na tila parang blank check siya at libreng pautang sa mga hospital, ang nangyayari po dyan is hindi lang po tayo nawawalan dahil sa fraud, dahil mismo ang PhilHealth na nagsabing 7.5% ang nawawala sa fraud, ay meron din tayong foregone income per year dahil sa labis-labis na IRM na nakapark sa mga hospital. Imbis na yung mga pondo na yan ay nasa PhilHealth at ini-invest ng PhilHealth, ang nangyayari ay nakapark po yan sa hospital at discretion nila para waldasin ang pera ng bayan. Kaya ito po ang aking computation, ano ang losses dahil napakabulok po ng system ng IRM. Ang nawawala po from a 26.8 billion peso IRM total fund, pwedeng mawala ang 2 billion pesos sa fraud. And on top of that, meron pang 541 million pesos na nawawala po in foregone investment opportunities ng PhilHealth. Kaya ito po ang aking natuklasan sa lahat po ng submissions ng PhilHealth ng data sa ating committee. Ang sa akin lang po is klaro po na para sa akin na tila ginigisa ng PhilHealth ang kanilang mga sarili sa kanilang sariling mantika. Kaya sana po Mr. Chair ay matapos na ito at malaman po natin kung sino ang salarin sa napakabulok po na sistema po ng IRM dahil talagang at the end of the day po, ang kawawa po ay ang taong bayan na siya pong nagko-contribute po ng kanilang hard-earned money dito po sa pondo ng bayan. Maraming salamat po, Mr. Chair.
Thank you, Congresswoman Stella Kimbo. Si Congressman Fortun, Lawrence Fortun will not be asking question today but he will be in the next round. Reserve na lang po siya. We now proceed to the Honorable Janet Garin. Honorable Garin.
Thank you, Mr. Chair. Let me just... Yeah, Mr. Chair, just to take off from the initial discussion we had earlier, liquidation of IRM already released. Has this been put on hold because there was a memo calling for its deferment, or is it already pushing through? May we have an answer to this?
Mr. Chair, the liquidation right now, as per the memo, is optional coming from the region with the discussion with the hospital. So far po, the liquidated amount as of to date is around 2 point.
No, Ish, the
Yes,
question is very direct. Yung pong mga pinaka-cash advance nyo, after kayong nagpa-cash advance, nag-release ng memo, at ang sabi doon sa memo, deferment of liquidation. Ibig sabihin, okay, ito yung pera, pwede nyong gamitin, walang IRR, bahala muna kayo kung anong gagamitan nyo, pero okay lang na wag mag-liquidate. So my question is clear. Is that memo still in effect or that has been changed?
Has been changed po, Madam, Mr. Chair. And the
If that has been changed, what are the changes and do you have a copy of the memo repealing that memo of non-liquidation?
The change actually, Madam, Mr. Chair, Madam Congresswoman, is that the liquidation is optional with the region. That's why other regions are...
Sorry. Mr.
Yes.
Chair, pasensya na po. Medyo nagising ako doon. Ulitin natin na, nagpa-cash advance kayo ng bilyon-bilyon na pera. Tapos naglabas kayo ng memo, deferment of liquidation. My question is, that memo still stands or meron bang nagbago? Ang sinagot mo, merong nagbago. Tama?
Yes, Mr.
Okay. Ang tinanong ko, ano ang nagbago? Ang sagot niyo po, optional na. Pwedeng mag-liquidate, pwedeng hindi mag-liquidate. What's the difference of that memo to this memo?
Mr. Chair, Madam Congresswoman, the general rule still is for liquidation. However, it was deferred, as you have said, in the earlier policy. Now, with the memo of the EVP and the COO, still it's for liquidation. However, for the meantime, it is option if the regions will already liquidate it or hindi pa po.
Excuse me, Congresswoman Garin. Bago po magpatuloy si Congresswoman Garin, ano po yung karunungan sa likod ng memo na pwede na silang mamili kung gusto nilang mag-liquidate o hindi?
Mr. Chair, our attorney po will answer on the IRM. Yes, sir.
Sige po, Mr. Labe.
Yeah. Mr. Chair, the wisdom behind po doon sa nirelease na memo ni EVP COO, kasi po hindi po naman po lahat ng area sa Pilipinas ay heavily impacted po ng COVID. So yung mga areas po na hindi heavily impacted ng COVID at ang turnaround time po namin sa ibang region ay hindi naman halos naapektuhan, So nag-start na po silang mag-liquidate. Pero sa mga areas po na heavily impacted po ng COVID, if i-implement po namin agad yung liquidation, that is a disservice po sa mga members namin. Kasi for example, mag-start na po kami sa NCR ng liquidation, full liquidation. That would be 3 months po equivalent doon sa reimbursement or sa claims na ipoprocess nila sa amin, na hindi po sila makakakuha ng pera sa PhilHealth kasi nga po na-advance na namin IRM, and to think na tuloy-tuloy pa naman po yung COVID. So that's the wisdom behind kung bakit po sa mga ibang area ay i-deferred muna at yung sa mga areas na hindi naman impacted sa COVID masyado ay...
Mr. Labe, hindi ba iunan nyo ng ibayad sa kanila? Hindi pa nga nila ginagamit yung pera, wala pang gastos, naunan nyo nang iabot yung pera. Tama po ba?
Tama po.
Okay. Ano po yung sinasabi mong magiging disadvantage sa kanila kung magli-liquidate kayo sa mga lugar nila? Mr.
Kasi
Labe.
po, Mr. Chair, yung sa mga heavily impacted po na areas, ay ganun din po ang aming mga empleyado. So yung turnaround time po ng regular payments ay naapektuhan din po. So pagka naapektuhan po yung turnaround time ng regular payments po, Mr. Chair, so yung pag-ikot po ng pagbayad namin sa hospital, pagka full implementation na po ng liquidation, ay hindi po namin sila agad-agad mababayaran. At yung mga pumapasok din naman po na claims ay ibabawas na rin po namin yun sa IRM. So mahabang-haba pong panahon na hindi pa po makakakolekta yung ating mga HCIs. And to think po kasi mas mataas po ngayon yung cost ng kanilang pagsiservisyo dahil po sa mga PPE kahit hindi naman po COVID-related yung services na nire-render po ng ating mga HCI.
Mr. Labe, siguro wala naman tayong pinagtatalunan nila Congresswoman Garin na yung pera gamitin talaga sa COVID. Ang pinaglalaban nga natin dito, dalhin yung pera sa talagang nangangailangan na ospital, panlaban sa COVID. Ang hindi ko maintindihan ay bakit nagkaroon kayo ng pagpili sa ilang mga ospital na ikaw, Hospital A, pwede kang mag-liquidate. Ikaw, Hospital B, pwede kang hindi mag-liquidate. Bakit nagkaroon ng... Dahil yung ganong pagpili, pakiramdam namin, may favoritism yung PhilHealth, Mr. Labe.
Yes, Mr. Chair. Pero ngayon po, Mr. Chair, lahat po ay...
Ano po, yes na may favoritism ang PhilHealth?
Hindi po. Ang ibig ko pong sabihin, Mr. Chair, yun po yung wisdom na nagkikita ng nag-release po ng memo si AVP COO po na dahil nga po yung ibang areas naman ay talagang heavily impacted. Kaya po niya naisipang mag-release ng ganon. But right now po, last week lang po, according to the discussion, ay i-implement na po yung full liquidation.
Hindi naman po yan dahil sa yung iba kasama sindikato, kaya pwedeng wag mag-liquidate, yung iba mag-liquidate na hindi kasama sindikato. Mr. Labe.
Hindi naman po, Mr. Chair.
Thank you.
Thank you
Yes, Congresswoman Garin. Comsec, pakipalitan po.
Eto na. Yeah, thank you, Mr. Chair. So, Mr. Chair, ang narinig ko kanina, ang sabi, meron ng pagbabago, hindi na optional or optional pa rin?
Mr.
Yes or no, please?
Full liquidation na po, Mr. Chair.
Do we have a document to that effect?
We are also waiting kasi...
Do we have the document to that effect? Yes or no, please? Sayang
None
kasi
yet po,
oras.
Mr. Chair.
Wala. Mr. Chair, can we request the PhilHealth officers present to immediately issue a memo for the full liquidation to those who are recipients of the cash advance or interim reimbursement mechanism? Do we have that commitment?
Honorable Garin, nag-request na po tayo niyan eh. Doon na po sinabi na 2.5. Dr. Pargas, you committed to us that you will submit to this committee yung full liquidation ng mga ospital.
Mr. Chair, our finance will have the report on the liquidation.
Finance would be Mr. Limsiaco. Mr. Limsiaco?
Mr. Chair, Your Honor, ano po yun ng tanong, Mr. Chair?
No, di ba nung huling hearing natin, yung tinatanong kasi ni Kong Garin, yung liquidation at 2.5 na nga, no? At as of this time, 2.5 billion na.
Yes,
Ang
sir.
commitment nyo is you will submit to us the liquidation of the 2.5 billion.
Mr. Chair, Your Honor, I think our liaison officer submitted already. Submit na tayo? Liquidation?
No, Mr. Chair, if I may, ang tanong ko po kanina, una, bakit ginawang deferred yung liquidation? Who issued that deferment? And ang sagot nga nila, kasi kawawa daw naman yung mga iba, maraming pasyente, pinagbibigyan, wag muna mag-liquidate. And the next info that they gave us is another decision was made by the management. Was it the management or the board?
Signed by EVP CEO Arnel De Jesus.
Sino po? Sorry.
EVP Arnel De Jesus po. Signed by EVP Arnel De Jesus, the management.
So the CEO issued an order.
Yes,
The initial
Dr. Pargas.
deferment po was signed by the President. The second po for an option is signed by our EVP COO Arnel De Jesus.
What was his basis, Mr. Chair? Una, we were able to establish na wala po talagang basehan ang IRM. And for the record again, Mr. Chair, it is not true that there was a precedence because cash advance is never a payment mechanism in any insurance company, be it government or private. Mr. Chair, if we may get, who is the brains or who is the initiator of this idea of deferred liquidation? And second question, whose idea is it that you now make it optional to liquidate?
Okay, the first question, deferred liquidation. Kanino po nanggaling yon?
It was issued by the President po.
And the deferred liquidation,
That was the deferred, Mr. Chair.
ano po yon?
Yung pong deferred was issued by the President. Yun naman pong optional was issued by the EVP COO.
Optional na.
Yun pong optional. Again po, the general rule is liquidation. However, yun pong kay EVP COO, ang sinasabi po niya is pwede na pong mag-liquidate, pwede pong hindi muna. Because yun nga pong una, as issued by the President, is deferment of the liquidation to a later date. Yun naman pong kay EVP CO after is an option na pwede na i-liquidate kaagad or again to a later date.
Yeah, Mr. Chair, if I may, kailan nga po ba ang issuance ng IRM? What's the date?
The publication po is March 21.
March 21. When did you issue a memo for the deferment of liquidation?
Mr. Chair, we will look for the memo po. Wala lang po akong kopya.
Maybe you can ask your people to check it.
Ma'am. June 16.
June
Tony
16
Uliero?
po.
Okay.
June 16, 2020.
From the PCEO.
And then
the OCOO memorandum on the
July 15, OCOO.
Honorable Garin?
With that, Mr. Chair, can a PhilHealth circular be overturned by a mere memo? Pag may circular po ang PhilHealth, pwede po bang baliktarin? Because you have been saying earlier that the general guideline is liquidation. However, your president issued a memo and another memo was issued making it optional. Is that legal? You have your wala pa na.
We'd like to ask Attorney Labe po.
Yeah, Mr. Chair, just so we won't be wasting time, I am in receipt of what they submitted. What was submitted is a summary of official receipts for interim reimbursement mechanism. Hindi po kasi ito yung actual liquidation. So we again reiterate to give PhilHealth a time frame. Magkano yung pinakash advance nyo, magkano yung naliliquidate na, hanggang kailan sila pwedeng mag-liquidate. And what will happen if there are funds that will never be liquidated?
Mr.
Who takes
Limsiak.
the responsibility?
Mr. Limsiaco, you are directed to please submit to the committee yung pong pondo na niliquidate na. Yung magkano niliquidate, nandiyan na po sa atin, Honorable Garin, yung actual liquidation of expenses, kung pwede yung masubmit dito, Mr. Limsiaco. Ang tanong po ni Honorable Garin, kung hindi po mag-liquidate, ano po ang penalty ng mga tao, ng mga institutions?
Mr. Chair,
Yes, Chairman
Mr. Chair,
Alvarado.
Congresswoman Garin, manghiram lang po ako sandali ng oras. Inabot po kasi sa akin ni COMSEC yung mga nagbigay sa atin ng pahintulot na yung nagbigay sa atin ng waiver para sa AMLAC. Maaari po ba, Mr. Chair, sa susunod na hearing ay maimbitahan natin yung AMLAC dito, pati po yung NBI, para malaman natin kung saan papunta talaga tong hearing natin, Mr. Chair?
Thank you for that, Chairman Alvarado. The COMSEC is directed to invite the NBI and the AMLAC for this purpose.
Yeah, Mr.
Honorable
Chair.
Garin, you're waiting for a reply?
Tomorrow ba daw? Or?
Yes. Well, tomorrow we will be taking up the OFW case in particular. Doon lang po tayo magfo-focus. If you would want to request the NBI and the AMLAC to give us a briefing tomorrow, pwede po, or Thursday. Kung
I
mas
think
gusto niyo po.
Thursday will be better so
Oh,
that
Thursday.
tomorrow we can focus on the OFWs.
All right. So let's focus, let's schedule that on Thursday.
Maybe, Mr. Chair, we can also invite the former COO of PhilHealth, Jan Basa, on Thursday.
Again, the name, Honorable
Jan
Garin?
Basa.
Jan Basa.
Mr. Jan
And
Basa.
Attorney Asuncion, when the all case rate started, siya po yung, I understand, the head of the legal at the time.
Yeah, I leave it to the wisdom of the chair.
COMSEC so directed. Honorable Barsaga, you wanted to say something? Wala po.
Yeah.
Okay.
So,
Honorable
Mr. Chair,
Garin, the question is, kung hindi mag-liquidate, ano yung mangyayari? Dr. Pargas, would you like to reply on that? Kasi sabi ninyo, kanina, just so maklaro kay Honorable Garin, yung pondong IRM, they can use it outside of COVID. Please,
Bale,
kindly
Mr.
reply.
Chair, if I may. Yung una kasing tanong natin, yung IRM. Now, that IRM is issued via a memorandum circular. Yung issuance na memo calling for the deferment of liquidation is a mere memo from the President of PhilHealth. So is that legal? Next is another memo by the COO saying that it can now be optional. Eh natural, kung ako uutang, kung sasabihin mo pwede kang magbayad, pwedeng hindi, pipiliin kong hindi magbayad. That's the usual process. But be that as it may, if these two are illegal, then the guidelines on mandatory liquidation stands. So that's why we want to get the point of the officers here. Is the memo of the President and the memo of the EVP legal or not?
Mr. Chair.
Yes, please reply.
Sa PhilHealth Circular po, number 2020-007, ito po yung sa IRM. Ang nakalagay po kasi dito, Mr. Chair, a separate order will be issued for the accounting recording of the IRM fund. So meaning to say, a separate order with regard to the liquidation will be issued by the management po. And as far as I'm concerned, yung memo po ni General Morales is legal po naman. And I have just some contention doon po sa subsequent memo na in-issue ni EVP COO. Because I understand kapag memo na na-release ng PCEO, siya lang po dapat yung makapagbago nun, not the EVP COO, as far as administrative matters is concerned.
Yes. Thank you, Mr. Chair. Attorney, Mr. Chair, to our lawyer here, ang sabi niyo legal yung pag-utos na deferred liquidation. IRM is a PhilHealth circular that was approved by the board, right?
That is correct, Mr. Chair.
So if the president decides to allow all the recipients not to liquidate yet, isn't it that that needs board approval?
It is Mr. Chair, it is a matter of management because ang nakalagay naman po sa PhilHealth Circular, definitely may liquidation po. But as regards to the timing of the liquidation, yun po yung laman ng memo ng President.
Okay, Mr. Chair, if that is the case, ang tanong ko, dahil po kayo ay nasa PhilHealth ngayon, would you call for immediate liquidation of the funds?
That is now the intent, Mr. Chair, and as...
So with that, Mr. Chair, can we have the timeline? When are you going to issue a memo or an order stating immediate liquidation?
Honorable Garin, if I may interject, pwede pong ba tanungin yung mga board members po natin na nandito, ma'am? Kasi po ang gusto ni Honorable Garin, magkaroon na ng liquidation immediate. Of course, Attorney Labe is only part of the executive group. The policy should come from the board. Or at least, no, the board can come up with the resolution to direct management. Would you be willing to pursue that, yung pong liquidation natin?
Honorable Congressman, actually po, nasa contract na po, nasa Memorandum of Agreement between HCI and PhilHealth na kailangan mag-liquidate actually within 90 days. But as I said earlier, nag-request po ang maraming hospitals because of the number of patients that they have and because most of their employees work from home, baka hindi daw po sila makakomply with the 90 days. So nag-request po sa board ang president kung pwedeng i-extend sa 120 days. Pero lahat po yan required, wala pong exception.
Honorable Garin?
Thank you for that information, ma'am. But the memo says otherwise. Ang nakalagay kasi sa memo, kung babasahin natin, to a date that will be announced later. The 120 days is not in the PhilHealth memo. It's not in the memo signed by General Morales. If I may be allowed, Mr. Chair, pasensya na po. Sandali lang po. Here it says, dated June 16, 2020. Subject, deferment of interim reimbursement mechanism liquidation activities. And it says, in view of the EXICOM agreements, blah, 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 the reckoning date of IRM fund liquidation currently in effect from the incoming claims relative to the provisions of special prayer shall be moved from March 16, 2020 to an appropriate date which shall be announced later. General Ricardo Morales, President and CEO. Ito po ang nakasaad sa memo issued June 16, 2020.
So, Honorable Garin, yung 120 days, hindi naman po yan sa inyo, hindi naman kayo against the 120 days.
I am not against it, Mr. Chair, but I was just
yes.
reckoning on what is stated in the document.
Yes. So, for the board members, would you kindly support the assertion of the Honorable Garin na magkaroon po ng official policy coming from the board na 120 days?
Yes po.
Salamat po, Honorable Garin.
Yes, thank you very much for that, Mr. Chair. Which brings me to another matter. And I welcome the presence here of Attorney Mangawang. You're still the CORSEC now, or are you still the CORSEC?
Good afternoon, ma'am. Yes po.
Yes. As CORSEC, Mr. Chair, this is in relation to the allegations before that funds from PhilHealth were diverted to DOH. Mahalaga po kasing matuldukan ito because if they are still claiming that it is an income where in fact it is not recognized as an income, mahalaga pong matuldukan ito. You mentioned in a certificate you issued that there is a board resolution directing the legal sector to file appropriate charges against officials, employees responsible for the transfer of 10.6 billion to DOH. Do you have the minutes of this board resolution, or do you have a copy of the PhilHealth board resolution?
Madam Chair, Madam Congressman, sorry, I don't have a copy of that PBR, but that PBR was passed by the board.
Yes, you don't have a copy, but you have it in your office.
Yes, Madam.
Yes. Mr. Chair, this is very important in as much as finance reporting is concerned. May I direct Attorney Mangawang to submit a copy within 24 hours?
I will comply, Madam Chair.
You will comply.
Madam Chair, Mr. Chair and Madam Congressman.
You will comply. Okay. So can I have a copy of that board resolution, including the minutes during that meeting? On another note, Mr. Chair, I have your letters also from the former president, Dr. Roy Ferrer. I can go into the details of all of this one by one, but let me take advantage of the presence of Mr. Greg Rolyoda, who happens to be the finance head of PhilHealth before. Sir, if I may be allowed to put forward some questions. Napag-usapan po kasi noong nakaraang hearing, yung napakalaki and the misalignment of the cases of pneumonia being refunded from PhilHealth vis-a-vis the declared cases of pneumonia under the Department of Health. May I inquire from the finance officer, in the meetings that were conducted by PhilHealth before, what was the cause of the sudden surge in pneumonia claims?
Sorry, ma'am, I have no data as far as the pneumonia is concerned.
You were in many of our meetings, Greg.
Yeah, but I cannot remember, ma'am, the data presented during those meetings.
Was it related to the senior citizens law, the expanded senior citizens law?
It would depend on the patients that were treated during that time, ma'am.
Mr. Chair, kung meron lang sanang gamot sa amnesia, I hope we can give it to Greg. Mahirap po kasi pag tinatanong natin at ang palagi niyong sagot, nakakalimutan niyo na at hindi niyo nare-remember. No, it's very important, being finance head of PhilHealth, that you reveal to this committee the truth and facts that actually led to an enhanced fraud syndicate that's happening within. Noong pong nakaraan na ikaw ay head ng finance, remember there was the expanded senior citizens law. Kailan po ito naipasa?
Ito po ay naipasa noong November. Ito po ay na-approve noong November 5, 2014 at ito po ay naging efektibo 15 days from publication, which is November 25, 2014.
When did PhilHealth announce and called on all senior citizens na magpakonsulta at magpa-admit kaagad dahil may libre silang mga benepisyo?
Ang pagkaalam ko po, ma'am, ay ito po, Mr. Chair, is that was already answered during the last hearing by Dr. Pargas, who was then our corporate affairs group vice president.
Am I right, Dr. Ish Vargas, that you announced it in October? During that day when Congress approved the proposed measure on third reading.
Mr. Chair, again, as I've said po last time, I can't remember na po during that time.
Hindi niyo po talaga matandaan. So when you went home after our first hearing, hindi niyo po natingnan because many of those announcements were covered by media. So for sure it is online.
Actually, Mr. Chair, Madam Congresswoman, actually po we were checking, even those who were with me in the car were actually
Don't
checking.
you have a record of your press conferences?
I did not check with our corporate communications.
Okay, Mr. Chair, if Ish refuses to answer, then I respect that. Be that as it may, nagkaroon ng announcement, ginagawa pa lang yung batas, nanawagan na hakutin yung ating mga lolo at lola para mag-avail ng pneumonia package. And this was the cause of why many pneumonia claims were coming into PhilHealth. In fact, that was also the basis why I insisted that a minimum 3-day admission be made at magkaroon ng classification. Moving forward, Greg, because you are here, nung paulit-ulit na sumulat ka as finance head, you were asking for arrears, unpaid arrears, for the enrollment of senior citizens on calendar year 2014 and 2015. Am I right?
Opo ma'am, at ito po ay nag-umpisa noong April 23, 2015 po.
Okay. But being part of PhilHealth and the finance officer, are you aware when a budget of a country is being crafted, submitted to Congress and Senate, and approved on final reading? Mga anong buwan po yun?
Yan po ay yung budget cycle po ng ating national government na ito po ay nag-uumpisa ang paggagawa ng budget a year before the implementation of.
Can we have the specific months of the budget cycle?
Ang mga budget po ay nag-i-start ng April at ito po ay ginagawa ng mga bawat ahensya at ito po ay isasubmit ng ehekutibo sa
When is the budget usually approved?
December or early the following year po.
Mr.
Approval
Chair, I
of
beg
the President of the Philippines po yun. Kasi
No. Greg, my question is, kapag meron kayong proposal at gusto nyong papunduhan, let's say yung PhilHealth, gusto nyong i-enroll yung this certain population, and you ask for an appropriation cover from the government, ano po yung window wherein you submit it and the secretary who defends your budget defends it before the cabinet and it is incorporated in the proposed National Expenditure Plan?
Base po dito sa mga dokumento po natin ay lumalabas na nung April po ay meron na pong billing statement na ginawa ang ating
So bottom line is
membership.
the window period where you request funding is March to April.
April po yung unang billing statement na galing po sa ating membership management group.
Okay. So Mr. Chair, tama po yan because after SONA, tini-turn over na yung printed copy. Ngayon, nagkaroon ng batas na Expanded Senior Citizens Law on 2014 November. By that time, sasang-ayon ka po ba sa sasabihin natin na noong 2015, except for the senior citizens who were already enrolled, wala pong nakasaad na budget for the enrollment of senior citizens based on the new law?
Wala pong nakalagay doon sa GAA na na-approve po noong 2014 dahil it is effective on 2015.
No, 2014 na-approve ang budget.
Yes.
Okay, so 2014 na-approve yung batas. By that time, may budget na yung 2015. Ando dun siya or wala? Yes or no, please?
Wala po.
Wala siya sa budget ng 2015. So what did we do in PhilHealth? We proposed it to be included in the calendar and the budget for what year?
Ito po ay base sa mga exchange of communication with BBM. Nakalagay
Yes,
po
what
doon.
year? You proposed it to be included in the budget for what year?
It should now be included in 2016 po.
Okay. Kapag ang gobyerno wala pang pondo sa 2014 at sa 2015, are you going to implement an unfunded law?
Ayon po kasi sa ipinasa ng ating board, na ito po ay nakasaad sa board resolution na ang sinasabi po dito ay all senior citizens, nakalagay po sa number 6, entitlement to the identified program benefits shall commence on November 25, 2014, the effectivity date of RA 10645. At ang mga senior citizens may file benefit claims directly to PhilHealth under the rules set forth under PhilHealth Circular number 20 to 2014 on ACR policy number 4, directly filed claims for all cases and return to sender. Ito po ay nakasaad doon sa board resolution approving the
Mr.
proposed
Chair,
policy of
Greg,
PhilHealth.
Mr. Chair, Mr. Olyoda, if I may, to shorten your answer, please. Ang sinasabi mo, 2014, 2015, wala pa siyang pondo kasi hindi pa siya napopondohan. 2016, expected na mapondohan. Pero noong 2014, nagkaroon na ng board resolution na i-implement na. Yung po bang sinasabi nyo? Ano po yung financial cover? As a finance officer of the Philippine Health Insurance, kapag sinabi ng board, you implement this, ikaw ba ay maghahanap ng pondo para i-enroll yung mga miyembro o hindi?
Yung pag-enroll po ay isinailalim na po sa listahan ng ating member management group. Kaya nga po nung April ay meron po silang billing na siya pong naging basehan ng finance para
Mr.
po
Chair,
ito ay ilagay sa
let me
libro.
direct the question again, no? Para diretso po tayo, no? Huwag natin pong iikot-ikot. Ang tanong, kapag sinabi ng board, implement this, pero wala pang pondo, are you going to implement it? Yes or no?
Pwede naman pong i-implement kasi nga po gagastos po tayo ng mga
So, Mr. Chair,
benepisyo
for the
ng mga
record,
benefits.
Mr. Chair, for the record, the former finance officer of PhilHealth is saying, maski walang pondo, pag sinabi ng board, pwedeng i-implement. So he is taking full responsibility of the retroactive enrollment of senior citizens whose alleged membership were used to justify fraudulent claims on pneumonia. Is that correct, Mr. Chair?
Madam, hindi ko po malaman kung paano natin maikabit yung aming paglilibro doon sa fraudulent claims. Ayon po sa accounting standards, ito po ay compliance sa ating accounting standards number 18 with regards to the proper recording of
Okay, Mr. Chair,
income.
Greg, pasensya na po talaga.
Yes, ma'am.
Please let us not speak Italian. Laymanize the terms as much as possible para maintindihan ng taong bayan kung paano natin matutulungan yung PhilHealth. Ang sinasabi mo, nagsabi ang board na i-implement yung expanded senior citizens law. Inaamin mo rin na hindi pa ito nakasama sa General Appropriations Act dahil tapos na ang budget ng Pilipinas at ang pinakamaaga ay masama ito sa 2016 na naisama naman. Ang tanong ko sa iyo, kung merong batas na wala pang pondo, pwede bang i-implement? And your answer is yes. That's why my next question is, you are now taking responsibility for the alleged expenditures on the membership of these people.
As far as membership of these people, ma'am, meron po tayong isang opisina sa ating PhilHealth. Ito po yung
Hindi,
membership
yung tanong nga,
management
Greg,
group.
ganito, ikaw yung sa finance. Meron nga yung, ang sabi mo, dahil may order yung board na immediately i-implement. Ang tanong ko nga sa'yo, hindi mo ba sinabi na wala pang pondo para i-enroll sila? And your answer was, ibibill namin ang gobyerno. Meron na po bang IRR ang batas na yon nung binil mo?
Meron pong IRR kasi yung
When was the IRR published?
may PhilHealth circular po na
When was the
na-issue.
IRR published?
The PhilHealth circular number 13 dated December 17, 2014.
Mr. Chair, if I may, a PhilHealth circular is not an IRR of a law signed by the President. The implementing rules and regulations accompanies every law. At ang batas na ito ay an expanded senior citizens law. Kawawa naman po yung ating mga lolo at mga lola na ginamit natin para linlangin ang taong bayan sa katotohanan when it comes to PhilHealth finances. So a PhilHealth circular is not an IRR. Ang tanong ko, nung hinakot, track yung mga senior citizens para sabihing i-admit sa ospital at kunyari may pneumonia, isang araw lang nare-release na kaagad, pero case rates buo na kinolekta. Nung ginawa yon, wala pang enrollment sila kasi wala pang pambayad ng premium. Now you are saying that is legal? How
Honorable
can that
Garin?
be legal?
Ma'am, ang listahan po kasi ay in-enroll ng ating member management group at ang pagdating
Who
po
was
sa
your
amin,
member management group during that time? Andito ba?
si OIC Vice President Albert Manduriao po.
Okay, can we request him in the next meeting? And as finance officer of PhilHealth, kung kunyari ako, sasabihin ko, lahat ng mga empleyado sa Kongreso, i-enroll mo, Greg, sa PhilHealth, papaniwalaan mo ba ako? Sino ang magbabayad ng premium nila?
Nakasaad po kasi sa batas.
Okay, Mr. Chair, let me rephrase the question. As finance head of a very premium institution, when does PhilHealth membership starts?
Pagka nagpasalista na po sila sa atin.
Ano?
Pagka meron na pong mga senior citizens na
No,
mailalagay
Mr.
na
Chair, my
sa
question is
listahan.
direct. Bilang finance head ng PhilHealth, kailan po nagsisimula ang membership ng isang tao sa Philippine Health Insurance Corporation?
Bali sa ma'am, sa ating indigent or other sectors, ay pagka ito po ay nailagay na sa ating database ng ating member management group.
So the reckoning of membership is when you are listed in the database, not when your premium is paid. Sigurado po kayo dyan, ha?
Yun po yung nangyari dito po sa ating senior
No,
citizen.
Mr. Chair. Greg, my question is on policies. You're the finance head of the insurance company. Hindi po natin pwedeng sabihin na kung yan ang nangyari, yan ba talaga ang dapat na nangyayari? Ulitin ko po.
Honorable Green, can we go to our wrap-up?
Yes, Mr. Chair, apologies for this. But I beg the indulgence of my colleagues, but I do hope that PhilHealth officials will answer the questions direct to the point. Ano po ba ang polisiya ng PhilHealth? Kailan po nagsisimula ang membership ng isang tao?
Yun nga po ang pulisiya kasi po ang membership po ay sila yung nagdedetermina.
Nagsisimula ba siya kapag nabayaran yung premium o kung hindi?
Yung grupo po ng individually paying members, yun po yung patakaran po natin. Yun po namang mga nasa listahan po ng indigent.
Hindi po ba, Mr. Chair, na yun sa listahan ng indigent, you submit the names, once you submit the names, you will be given the funds through DOH, and then that funds will allow their enrollment. Ganun po ba? Totoo o hindi?
Ganun po, kasi yung listahan po, pinapadala po natin sa Department of Budget and Management through the Department of Health.
Okay.
Po.
Mr. Chair, to recap, ang sinasabi ng ating finance officer, membership is based on PhilHealth submitting a list to DBM, DBM approves it, DBM transfers the money to DOH, DOH pays the premium. Tama po ba?
May mga direct din po na ang pagre-release ng DBM diretso po sa PhilHealth.
Okay, pwedeng diretso sa PhilHealth, pwedeng diretso sa DOH through PhilHealth. Ang punto dito, gumagawa kayo ng listahan, pinapadala sa DBM, DBM approves it na ito yung mga tao na ito totoong tao, babayaran ng PhilHealth. Tama?
Tama po.
Okay, and that is where membership starts. In this claim of 2014 and 2015, where you included an imaginary membership of 7.7 million senior citizens in the country without names and specific names submitted to the DBM. Ito ba ay nagkaroon na ng pondo o wala pa?
Ma'am, yung wala pong pangalan.
Yes or no? Nagkaroon siya ng pondo, binayaran ba ng DBM or hindi?
Bali, ang DBM po hindi po nakapag-appropriate.
Okay, hindi na bayaran. Nagkaroon ba kayo? Were you able to pinpoint 7.7 million senior citizens? Yes or no?
Hindi ko po masagot diretso, ma'am,
Okay,
dahil
last
membership
question.
po.
Dahil nga wala kayong sinubmit na mga pangalan ng totoong senior citizen, ano ang naging solusyon kung paano babayaran ang premium nila?
Ang pagkalam ko po, ma'am, meron pong listahan na
No, Mr. Chair, the solution that PhilHealth and DBM gave, pasensya na ha, kasi yung oras mapapagalitan ako ni Chair. Mr. Chair, the solution was actually point of care. Ibig sabihin kapag ikay senior citizen, may batas na, hindi na pondohan ng gobyerno, pagka ikaw ay dinala sa ospital, automatic i-enroll ka ng ospital, babayaran ng ospital ang premium, pero babayaran ng PhilHealth ang benepisyo ng senior citizen. In other words, they will be enrolled as long as they appear personally and they get sick. Yan po ang naging basihan. Bottom line is, the 10.6 billion that were alleged by the finance and the legal people of PhilHealth is actually non-existent. May I request, Mr. Chair, that Greg submits a comprehensive report on the investigation that they made with regard to this alleged 10.6 billion. Last na lang po, nakalimutan ko, Mr. Chair. Kailangan po kasi natin ayusin yung finance ng PhilHealth. Greg, there was also a time na merong mga bilyon-bilyones na income na dinideclare nyo sa financial records ng PhilHealth, pero pag hinahanap namin yung actual na pera, wala doon. Ang sabi nyo, it was because nag-increase ang premium ng PhilHealth, pero nung nag-increase ang premium ng PhilHealth, hindi binayaran ng gobyerno yung difference. When was this time? And how much was the total amount?
I think that was the differential of the national government when PhilHealth increases the premium contribution. I cannot remember the amount, but I think it's more than 10
billion. So Mr. Chair, for the record, nagkaroon ng increase ng premium, hindi pa napopondohan ng gobyerno dahil syempre hahanapan muna ng pondo yon. Dineclare kaagad na income ng PhilHealth yung 10 billion plus. Kasama yung dito sa senior citizens na dineclare kaagad ang 30 billion plus na income maski wala naman. What is the implication of this? Greg, how many percent of the gross income can be used for admin expense?
Doon po sa dating batas ay 445. Yun po yung
Percentage, how many percent of the gross income? Was it 7%?
Yung una po noon is 12%.
12%.
That was years back. Pero ma'am, nung may batas is 445. 4% for the benefit payments, 4% for the actual collections, and 5% of the investment earnings.
Okay,
Tapos hanggang
Mr. Chair,
nag-change.
kaya ko po yan naitanong, the implication of that is very huge. If the finance office of PhilHealth declares a bloated income, kunyari ang sinabing 12%, if they declare a bloated income of let's say 50 billion, ang 12% po dyan masyadong malaki. Now kung yung actual income nila nasa 25 lang, ang 12% niyan will actually be 1/3. That is why we are running out of funds because the declared bloated income, marami po doon ang hindi na pwedeng makolekta because in the first place, walang legal basis. So instead of, let's say for example, if it is 7 to 12%, nagiging 21 to 36% ang kinakain dun sa gross income for management and admin costs. With that, Mr. Chair, I'm really sorry for exceeding the time. I do hope that I'll have the document from Attorney Mangawang and Mr. Relyoda, and I think Greg would like to respond.
Yes, Greg.
Ma'am, I'd like to have some modifications dahil po yung percentage po ng ating administrative expense is based on actual payments, actual collections and actual investment earnings. So hindi po nababase doon yung pag-compute ng ating administrative expense. At ayon naman po doon sa sinasabi ninyo na nagkaroon ng na-direct kami ng board to investigate with regards to the alleged funds na senior citizen, nais ko pong ipabatid at ibibigay itong report as far as I am concerned, together with the former Vice President OIC Legal Sector, Jermaine Lim, that we have reported to the board, yung sinasabi nyo kanina ma'am, ito po, and I can cite some of the
No, if you can just submit the letter officially to the committee,
Yes.
and that particular letter will also be given to the Honorable Garin.
Gusto ko lang pong i-emphasize para kay Madam Congressman, ito na po, yung pinakalas niya is, the same cannot be considered illegal considering that there is no showing that the request of DOH, Secretary Garin and Padilla to use the unprogrammed fund. So ito po ay report namin para doon po sa sinasabi ninyong nangyari doon sa senior system.
Yeah. Thank you for
Thank
that,
you so
Mr.
much.
Chair.
Thank you, Honorable Garin, for that. Before we proceed, tanong ko lang ho, yung tinatanong ni Honorable Garin, marami ba kayong mga nakikitang mga ghost members sa inyong listing? Meron po ba kayong ganyan? Yung mga listed na mga senior citizens, anyone can answer?
Yung nasa membership.
Have you validated the listings or the membership role of PhilHealth? Anyone can answer, please. Dr. Pargas, would you like to reply?
We have our Vice President for Member Management Group,
Yes.
Oscar Abadu.
Yes, I'm sorry. Mr. Abado, is that correct? Bago lang po, mabilis lang ho. Bago ko ibigay doon sa next interpolator.
Good afternoon, Mr. Chair.
Yes.
May I, can you please repeat the question?
Hindi, yung tanong ko lang kasi dahil I'm just following kay Congresswoman Garin kasi may mga senior citizens daw na pwedeng pikiin yung pangalan o I'm sure meron kayong mga peking pangalan sa loob. Would you have that situation now?
What the possible scenarios, sir, is that it can happen that we have an exact member, but at the same time it can be an encoding problem. So maaari kasing kahit na let's say nagkamali lang sa middle name, it can duplicate eh.
Hindi, yung sa WellMed for example, di ba mga ghost yun?
Yes, sir.
Ano yung mga yun? Patay na o inimbento yung pangalan?
That I have to validate because I was not then part of the member management group that time.
Yes, but you would know kahit paano kung ano nangyari doon. Pineki ba yung pangalan? Kunyari, magpeki ako ng pangalan, enroll ko sa PhilHealth. Pwede ba yun?
It can happen, but then right now we are asking for documentary requirements to support, especially birth certificates.
Hindi, not now, dati. Pwede?
Yeah, yes,
Pwede.
sir.
At meron kayong, of course, kailangan yung i-purge yung listahan nyo na yan.
Sorry?
Kailangan yung ayusin yung listahan na yan.
Yes,
Ha?
that's what we're trying to do right now. We're trying to clean up the data. Especially we have partnership with PSA for the national ID system and of course with the LGUs for the validation of information.
So senaryo lang, nameki akong pangalan, kakontsaba ko yung ospital, gumawa ako ng sakit, pneumonia. Pagpalagay mo, 10 sila. Nag-charge ako ng 15,000, 150,000. Pwedeng mangyari yung ganitong sitwasyon.
It can happen.
Thank you for that. But anyway, pagtulungan natin po. And I guess the IT is very critical dyan at saka yung ID system.
Mr. Chair, dagdag ko lang po as the MMG head is here. Dalawa po. Pwede po kasing non-existent names, yung parang example, if it's Dan Fernandez, pwede siyang gawing Daniel Fernandez or pwedeng Fernando Fernandez. So, naiiba pero pareho yung ginagamit na data. And maybe Attorney Del Rosario, who used to be the RVP of Region 1, can expand on this because there were actually fake claims that happened in that area when he was the RVP. Dagdag pa dyan, Mr. Chair, ang ginagawa po kasi, kagaya po ng 10.6 billion that I defended 3 times in DBM, Napahiya po ako kasi nung prinisent na, ang ginagawa pala ng ibang mga tao sa PhilHealth, pinagamit nila agad-agad na sa mga senior citizens na maski walang pneumonia, ginagawa ng kwento na kunyari may pneumonia para maklaim. Pero para hindi malugi ang PhilHealth, kasi masyadong maraming lumalabas na pera kesa sa enrollment, pag may pondo ang gobyerno, ang sinasubmit na mga pangalan are carved out from the regular members and their dependents. Ibig sabihin, kung member ako, kukunin ang pangalan ng anak ko na minor, kukunin ang pangalan ng asawa ko, o yung mga senior citizens na nagtatrabaho, na meron namang PhilHealth dahil employed sila, kukunin ang pangalan nila. Yung po ang listahan na sinasubmit sa DBM para bayaran ng pangalawa, pangatlo, or pang-apat na beses ng gobyerno.
Thank you. So thank you for that. Siguro in the amendment of the law, isa yun sa mga ilalagay namin in particular na higpitan talaga yung at least kahit pa paano may basic documentation for membership.
Yeah. Mr. Chair, if I may, in the amendment of the law, mas maganda po talaga sana what was contained in our transition report, pagkapanganak miyembro, pagkapatay na natanggal, because we have the National Statistics Office where all births are documented and all deaths are documented, and we go to individual membership.
Yes. Okay, thank you for that. And now we proceed to the Honorable Kabatbat, Argel Kabatbat
Mr. Chair,
of the ang magsasaka. Honorable Kabatbat is recognized. Okay, pending that, please.
Mr. Chair, Madam Congresswoman, I'd like to inform the body that the recording of the senior citizens was in accordance with COA rules and regulations, as we have the COA then rendered an unmodified, unqualified opinion, which means the financial statement of PhilHealth during that time was fairly presented. Thank you po.
Attorney, in sa membership po natin, sorry pero anyway, anyone can answer. Di ba tama naman yun, no? Mas matama na mag-individual membership na lang tayo kesa yung member plus dependents. Talagang lahat na. Kung anak mo, member. Kung sino para individually kilala natin. Tama ba?
Correct, sir. Right now, we have started assigning pins to the different dependents. Going towards...
Ito, wala na talagang dependents. Talagang from the kumbata yan, member na yan, siya na talaga. Para klaro na.
Amendment of the law would be necessary.
Yes. If you can give us a recommendation on that para maayos natin as part of the recommendation or amendment of the law. So thank you.
Yes, sir.
Thank you so much. Congressman Kabatbat? Okay, if Congressman Kabatbat is not available, we proceed now to Congressman...
Mr. Chair?
Yes, go ahead, Kong Kabatbat.
Yeah, Mr. Chair. Fina-finalize ko lang yung aking presentation regarding the massive recruitment of PhilHealth members sa Region 12. I'm already coordinating with the NBI Region 12, particularly si Agent Vernon, and all of the documents have already been submitted. Mr. Chair, I would like to present tomorrow sa continuation kasi pina-finalize lang namin. But
Congressman Kabatbat, bukas po kasi OFW po tayo dahil nakasabay po natin yung Senate. Most of the officials of PhilHealth will be at the Senate. Would you want to present it on Thursday instead of tomorrow?
Yes, Mr. Chair. Okay lang.
Okay. So thank you, Congressman Kabatbat. We will give you on Thursday to make your presentation. The Honorable Gasataya, you were interjected earlier. You may want to continue. Congressman Gasataya.
Thank you very much, Honorable Chair. Magandang gabi sa lahat po. Just very briefly, Honorable Chair, I think it's very clear already, no, na on the part of the central office na pabayaan ang Western Visayas or ang Region 6 in terms of the releasing of IRM. May tanong ko lang po at humingi po ako ng clear picture from the central office. The moment po na matanggap nila yung papers from the regional office papunta sa central office, meaning, for example, the memorandum of agreement, which I believe is the final document necessary prior to the release of the IRM. Sino po ba, Honorable Chair, yung tumatanggap sa central office? From VP Vargas?
From the region po, it will be forwarded to the area offices po na nasa central office. And then
Sino po yun? Can you please name names po para malaman namin?
The area vice president po. The area vice president po that time, covering, for example, for Region 6 is the Brigadier De Villa, who also is the senior vice president for operations then.
So meaning, please proceed.
Pagkagaling po sa opisina nila, ipapadala po yan sa amin po sa Health Finance Policy Sector para po ma-check yung mga documents, and then papunta po sa Fund Management Sector para po sa pondo, pagkatapos po ay sa aming EVP, and then to our Head Executive Assistant of the President, and then from there to the President po for approval. After po ng approval, it will go back to the Program Management Team for Claims para po magawa ng voucher, and then it will go to the area head kasi po ang signatory po is the area, and then the EVP, and then the PCEO para po masignan yung voucher. Pag nasignan na po yung voucher, it will go back to the finance po para sa release of money.
We're talking of the MOA, di ba? MOA, the Memorandum of Agreement. Di ba, ito na po yung last required document prior to the release, Mr. Vice President?
Yes, Mr. Chair. Yes po, Mr. Congressman, the letter of intent and the complete MOA po.
No, I'm only talking of the MOA already. Tapos na tayo sa letter of intent eh. MOA na lang. So, ang MOA, pirmado from the hospital, and then pinorward sa regional, and from the regional papunta sa inyo sa central office. Sinabi mo na you have, ilan yun? 7 persons na dadaanan ng MOA prior to the release. Tama ba yun?
Yes, Mr. Chair.
Pero yung 7 persons or offices na dinadaanan, is this ministerial na lang on their part, or parang meron checklist pa ulit sila? Can you enlighten me on this, Mr. Senior Vice President?
Mr. Chair, katulad po sa amin, chinecheck po namin ang MOA kung ito po ay katulad po noon, may amount, meron po mga perma, tama po ba yung details. Pagdating naman po sa fund management, kung ang nakalagay po na amount is allowed up to the maximum allowable limit, yun po. So meron po mga pinagdadaanan para po ma-check yung mga ganong bagay.
So in the case of Bacolod City, the regional hospital in Bacolod City, the MOA was signed July 7, no? Pinadala sa inyong office. Ano ang status ng MOA na ito ngayon at saka yung application na ito, Mr. Senior Vice President, Honorable Chair?
Chair, I'd like to ask Attorney Labe, who checked the status of all the MOAs provided by Region 6 po.
Yes, Mr. Chair. So lahat po ng mga MOA na provided ng Region 6, the last time I checked and on my record, okay na po siya kasi na-correct na po yung figure. Waiting lang po ng final approval from the Office of the President.
Waiting for the final approval. So kailan mo chinek to, sir?
I checked this last week because this is also one of the requirements being asked by Senate, and okay na po lahat ng content ng MOA. Si Presidente Morales na lang po ang pipirma for its finality po. Kasi siya po yung authority.
Bakit lahat-lahat nung applications from Western Visayas mukhang natagalan?
Yes, Mr. Chairman. As explained nga po kanina ni RVP Holiero, tama po yung sinabi niya. It reflects also to what I've explained na umikot nga po yun dahil as process po from region, dapat po check siya ng Area Vice President Office. In this case po, ang kanyang Area Vice President Office is si Senior Vice President for Operations po, si Brigadier De Villa. And it would appear on my record na doon po nagtagal yung papel, and in fact, there's a note na coming from HEA, yung Head Executive Assistant, na mali-mali po yung mga figures na naka-indicate sa MOA, kaya hindi po ito nag-move.
Honorable Chair, may we allow the Vice President from Western Visayas of PhilHealth, Attorney Holiero? I think she's raising her hand, Honorable Chair.
Yes, can we request the Regional Director Olero?
Yeah. Hi, good afternoon. I prepared a briefer, and in my briefer, the papers of the hospitals from Negros, Western Visayas went back and forth. When we submitted our recommendations, it did not contain an amount because that was not contained in the MOA that was annexed in the circular. When it was returned to us sometime in April 16, we submitted it to the hospitals with a computation, and then we resubmitted it to the central office. But then it came back to us with penciled numbers on the side, indicating an amount. So we had to ask the central office, what is the correct amount? Because you did not transmit the amount to us in an official manner. It was just written on the MOA. And I have an IRM validation team who is composed of two CPAs among others, and they computed the amount of the MOA based on the guidelines. So when we transmitted it back to the central office asking what should we use, we didn't get an answer. We got an answer June 22. That's why we had to give back the MOAs to the hospitals for them to put the correct amount. And then we resubmitted it July 8 and July 9. So, and then as of 2 weeks ago, I was told it was pending in the Office of the President for approval. So that's what happened. And in fact, sometime late June, President Morales threatened to file a case of gross neglect of duty against me for not doing my job. But you know, I'm documented. I have all my documents here.
Mr. Chairman.
Yes, please.
I remember vividly during the executive meeting, one of the executive meetings, that the area vice president will be the one to forward all the capping per hospital. And I think all of the ABPs naman provided except for, I believe, except for Region 6, because when I talked to RVP Holiero, she was not provided with the capping or the maximum limit of amount per hospital.
Yes.
And I think that's one of the reasons bakit po tumagal po yung pag-ikot po ng MOA, kasi hindi po pipirmahan ng presidente kapag lagpas po based on the guidelines.
Mr. Chairman, if I may.
Yes, go ahead.
Yeah, I wrote General Morales, when he scolded me, I wrote him a letter dated June 23. In that letter, I enumerated with timelines all my submissions. And I have here with me my submissions, April 15, I copy furnished not only his HEA, but also his executive assistants, because all my memos were addressed to General Morales through General De Villa. So I don't know why that happened. I don't know if it's a grand plan to, you know, oppress the region, but as I said, I'm documented.
Attorney Leva, Attorney Olero, I think this case of who said who did what, sino ba yung nagtrabaho, sinong gumalaw. Sa akin, immaterial eh. Meron kang pandemya, COVID. Diba? Alam mo, ito yung problema. Eh kung tamad yung NCR mo, kunyari lang, I would accept kunyari yung argumento, tamad yung NCR mo, o incompetent yung NCR mo, ibig sabihin wala nang pondo for the COVID patients in NCR. So I think, tigil yung debate na yan. Hindi yan yung point. If I was president of PhilHealth and I saw that there is a need na yung mga regions ko ay kailangan mabigyan ng pondo, hindi na ako magtuturoan pa at maninisi pa. Honorable Gasataya, you may continue. Congressman Gasataya. Okay, if the Honorable Gasataya...
Honorable Chair.
Go ahead.
Yeah.
Congressman.
Yeah, thank you. So, before I close, yung katanungan na lang, kailan mai-release yung IRM for Western Visayas, considering, Honorable Chair, na kailangan na ng mga hospitals. Just this afternoon, 7 hospitals in Bacolod nagkaroon ng meeting, and I participated in that meeting, which is ongoing up to now. They're pleading for help because paubos na. Wala nang pumapasok na mga patients, instead na COVID cases na lang. Other elements nagtakot ng pumunta ng hospital. The funds are depleting. The regional hospital, government hospital in Bacolod, meron pa siyang molecular laboratory. This is over and above sa expenses ng hospital. So they have about 35 to 40% increase in their expenses, Honorable Chair. So gusto naming malaman sa Western Visayas, kailan mai-release yung IRM, Honorable Chair?
Attorney Leva? Labem, sorry.
Thank you, Mr. Chair. We will go back to the board because I understand that temporarily the IRM is suspended by the board. But as soon as the board will allow us to facilitate it again, we will process it immediately.
No, I think
Thank
the
you,
board
Mr.
is
Chair.
committed to that. We asked them earlier. Ma'am, okay po tayo, no? For the Western Visayas?
Yes. Yes, Your Honor.
So we have the commitment of the board, Congressman Gasataya.
Maraming salamat po, Chairman Defensor. In closing, naalala ko meron tayong salawikain before na aanhin pa ang damo kung patay na ang kabayo. In this case, we are hoping, Honorable Chair, na hindi mangyari sa mga hospitals dito sa Bacolod at buong Western Visayas dahil aanhin mo pa ang kabayo, aanhin pa ng kabayo kung ubos na ang damo. Maraming salamat po, Honorable Chair. Magandang gabi sa lahat.
Attorney Labe, just to follow up on the request, kailan niyo po pwedeng i-elevate sa board?
Come again, Mr. Chairman.
When can you elevate to the board yung pong allocation for the Visayas, Western Visayas, and the release of that?
Mr. Chair, we are just, since the board is already okay with it, that we will release, then we will not elevate it to the board, Mr. Chair, because the signatory of the contract is the PCEO.
Yes, but at least man lang yung approval lang na for Western Visayas, they have a resolution to release for that particular region.
The CORSIC will release it, Mr. Chair.
Yes.
Thank you.
Thank you. So we have that commitment, Attorney Labe.
Yes,
para
Mr. Chairman.
maayos natin. Thank you, members of the board, for that. Yun lang naman po we suspend, but for Western Visayas, let's pursue. So with that, we are now about to end our... before we end, last points coming from our Deputy Speaker, the Honorable Dan Fernandez.
Okay, maraming salamat, Mr. Chairman. Tayo nagsimula, tayo rin magtatapos. Okay, anyway, kanina naputol ako dahil para mapagbigyan natin yung ating mga kasama mga congressman. Naputol tayo dun sa system nyo, sa payment system. Kanina sinagot tayo ni Attorney Duque Attorney Duque, di ba? Tama. At sinabi po ninyo na yung pong payment system natin, automatic credit payment system, ay walang authority na nanggaling sa Bangko Sentral So ngayon, liwanagin po natin ulit dahil mukhang tumataas na ng kamay si ma'am at
Yes po.
siguro sagutin po natin ng tama kung meron po talagang authority na galing po sa Bangko Sentral yung inyong pong payment system. Sige po,
Yes.
madam.
Maraming salamat po, Mr. Chair, Your Honor. We tried to coordinate with the Land Bank of the Philippines. Sila po kasi ang aming partner bank regarding po dito sa auto credit payment system. Ang auto credit payment system kasi, sir, Your Honor, yan po ay merong portion to sa part ng PhilHealth na system na nabanggit nga po ng aming CIO to facilitate po yung payment. Papasok naman po sa...
Attorney, hindi po system yan ng Land Bank. Ang auto credit payment system ay system po ng PhilHealth.
Yes.
At kung kayo ang may-ari ng sistema, dapat kayo po ang kumukuha ng authority, hindi po yung mga Land Bank,
Yes,
hindi
sir.
po mga bangko. Ang mga bangko is just a gateway.
Opo.
No? Kayo po ang may-ari ng sistema at as a matter of fact, Mr. Chairman, dito po ay humihingi kayo ng pondo sa ISSP nyo. Nakalagay yung mga pondo para po sa system po ninyo na binubuo. At huwag niyo pong gawing dahilan, Mr. Chairman, Attorney Duque, na ang sistemang ito ay partly nasa mga bangko. Hindi po. Sistema po ito ng inyong ahensya na nakalink lamang through API yung mga bangko. Kaya huwag niyo sabihin, huwag niyo idahilan sa amin to at huwag kayong magpalusot na ito po ay nasa mga bangko. Ito po ay pag-aari ng PhilHealth. At ang katotohanan nito, Mr. Chairman, dahil po sa violation nilang ito, hindi po sila pwedeng mag-disburse ng pera. Hindi nila pwedeng ipadala ang mga perang yan without a prior authority coming from the central bank. Ngayon, ang tanong ko muli, dahil ito po ay policy dapat to, Mr. Pargas, hindi nyo ba naisip na dapat na humingi muna ng authority sa central bank para yung inyong payment system ay maging designated na ng central bank and at the same time, kayo, PhilHealth, bilang kayo ang isang entity na humahawak nito, mabigyan kayo ng authority. Dahil kung hindi kayo bibigyan ng authority, lahat ng ginawa nyong paglipat ng mga pera sa mga bangko at sa mga lahat ng mga healthcare institution, lahat ng yon ay illegal disbursement. So ano masasabi mo, Mr. Pargas? Ba't hindi nyo ginawang polisiya na humingi muna? Ano ba naman yung sabihin nyo sa board, ng monetary board ng central bank? Humingi kami ng authority dahil sinasabi sa RA 11127, bago kami makapagsimula ng payment system namin, ide-designate muna kami ng central bank. At bibigyan kami ng authority yung mag-ooperate, no? ng nakapangyarihan para i-operate yung inyong pong sistema. Pero dito, it seems na hindi nyo ginawa. Di ba? Kung ayaw, may dahilan at kung gusto, may paraan. So, bakit, Mr. Pargas?
Mr. Chair, on my side po, hindi ko po yan talaga naisip because ang amin pong policies with regard to accounting and payment and the systems, one, the accounting and payment.
Okay, kung hindi ikaw, sino? Kasi ignorance of the law excuses no one.
Opo.
Okay? At hindi kayo, wala kayong lusot dito kung nagpapalusot kayo. Kasi Mr. Chairman, what I'm trying to drive out in here, dahil po yung sistema nila ay ginawa lang po nila internally. Katulad na sinabi po ni Senior Vice President Opida Aragona, sila po ang gumawa ng sistema. At according sa e-commerce law natin, dapat ito, pumapasok kayo sa mga parameters ng e-commerce law at ng Bangko Sentral. At according sa batas ng RA 1127, kailangan nyo muna ng authority. Alam nyo po ba ang penalty dito?
No, Mr. Chair.
Mr. Pargas, hindi nyo alam.
Hindi po.
Attorney Duque, alam niyo po ba ang penalty dito? Ma'am Aragona.
Meron po
Sige po, Ma'am Aragona.
Yes po. Mr. Chair, kawalang po ako ng clarification,
Yes.
confirmation. Kasi yung ACPS po ngayon, I stand corrected, patawad po. Yung API po na tinatanong nyo, wala pa po siya as in from us to the bank. Ang nangyayari po ngayon, may isang text file And then meron silang tinatawag
Nakuha ko na yung
post-pay
sinasabi niyo,
debit system.
Ma'am Aragona. In other words, yung inyo pong sistema, kung wala pa kayong API, hindi kayo secured. Kung ang nangyayari dito, nagkakaroon lamang kayo ng parang tinatawag na bank transfer. At yung pero ang problema nyo dito, Mr. Chairman, dahil bumuo na kayo ng ACPS at yun na sinasabi nyo sa SOP na pinadala nyo sa amin at sinusundan namin, yung inyong standard operating procedure, ang sinasabi nyo, yung sistema nyong ACPS, yun ang ginagamit nyo. But unfortunately, wala kayong authority na nanggagaling sa Central Bank. At according sa Section 19, Mr. Chairman, dito po sa Republic Act 1127, ang inyo pong magiging penalty dito ay magbabayad kayo ng multa, no? Ng not less than 200,000 but not more than 1 million in every transaction and continuing violation of 100,000. Kung 711 yung transaction nyo, Mr. Chairman, that is 711 million. At hindi lamang yon ang magiging penalty ninyo. Dahil according sa Section 20, lumalabas dito, meron pa kayong kulong. Makukulong kayo ng hindi bababa sa 2 taon hanggang 10 taon sa pag hindi nyo lang pagkuha ng authority sa Bangko Sentral. Alam nyo, hindi ko alam kung talagang sinasadya ninyo na hindi kumuha ng authority. I don't want to think about na sinadya ninyo. Pero, ang tagal na nitong batas ito, 2018, ang pumirma ng batas ito ay si Presidente Rodrigo Duterte noong 2018. At ang sinasabi ng batas, ito ang inyong kapupuntahan kung sakaling hindi po kayo kumuha ng authority. Since wala kayong kinuwang authority, so pwede ba kayong mag-disburse ng pera? Hindi. Yun ang sinasabi ng Bangko Sentral. According to Section 26, yun ang kapangyarihan ng Bangko Sentral dahil kayo ay hindi kumuha ng authority. At any rate, Mr. Chairman, kaya ako lang po nabanggit to kasi meron din ako nabasa in relation dito po sa paggamit nila ng system. Kaya siguro ayaw nilang i-undergo to ng scrutiny ng Bangko Sentral at mag-undergo ng mga parameters ng e-commerce law. Meron po ako nakakitang 114 million noong panahon ng, hindi ko alam kung kailan panahon to, yung sa Accenture Company, na kung saan 114 million yung binayad nilang premium payments sa 22,000 employees nila. Nandiyan yan, sa paki-post nyo nga yung GMA News Online, na kung saan nasa database nila, Mr. Chairman, yung 114 million at 22,000 na employees ng Accenture. But ang problem po, nung iniimbestigahan na ito, lumalabas, the amount appeared on the agency's database but was later revealed through accounting that the premiums were never actually remitted to PhilHealth. So in other words, yung inyong system, hindi po siya ganong kasecure, hindi po siya ganong kareliable. At ang sinasabi po ng 1127, ang layunin po ng gobyerno, kaya sinasabi na humingi muna kayo ng authority sa central bank para i-allow kayo, is to make it safe, secured, efficient, and reliable. But the problem is, hindi po ninyo ginawa. Ano ang dahilan?
Honorable Fernandez, yung po binabanggit nyo, 122 million?
144 million sa Accenture na kung saan po sa database nila nakalagay pero nung in-accounting na nila nawawala po yung 144 million. Kaya nga ako po nagtataka bakit ganun ka simple yung kanilang presentation ng kanilang kanila pong ACPS. Kasi ako hindi po naman ako masyadong expert pero nakakaunawa po ako sa sa sistema.
Ito po kailan po tong case na to?
I think this case was last if I'm not mistaken, 2014, Mr. Chairman.
VP, would you know about this case? Hindi po.
2014.
Sa IT po to, di ba? Tama ho, sa IT po to.
Yes po, pero I was not there during that time. 2015 po ako pumasok.
Oh, okay po.
Yun nga, nakakapagtaka, Mr. Chairman, hindi na natin alam kung ano nangyari doon sa 144 million na kung saan yan po ay nasa ABS-CBN, nasa GMA online. At dito pa lamang, kitang-kita na natin, Mr. Chairman, no? Parang hindi alam ni Pargas, Mr. Pargas, hindi alam ni Attorney Duque. Hindi nyo alam na may ganitong batas na sinasabi na kailangan kayong humingi ng authority para yung inyong system ay makapag-function. So ngayon, pag kayo kinasuhan ng Bangko Sentral, lahat kayo kulong. At any rate, Mr. Chairman, kung hindi po nila masasagot ito, Mr. Chairman, I'd like to proceed doon po sa susunod ko pong I'd like to proceed sa dito po sa internal audit na diniscuss ko po kanina din, Mr. Chairman. Ito po bang kay Ma'am Aragona, no, since ikaw ang IT head, no, out of the 3.4 billion na capex, ang naaprubahan nyo para po sa ICT is 1.5. No? At according dito sa report ng internal, I think nasagot nyo na to eh. Lumalabas na majority ng 1.5 ay hindi kasama sa ISSP. At parang nadinig kita sa Senado na sinabi nyo na mayroon na kayong revision dito sa tinatawag na ISSP, na kung saan dun sa COB po ninyo for 2020, meron na kayong panibagong proposal na naaprubahan po ng inyong board. Ito yung tinatawag ninyong big tickets project. Is that correct? Big ticket projects.
Yung iba po, let's say sa 1.5, meron po yung iba na nasa ISSP na previously approved. Meron po yung wala, yung po yung pinapa-approve kasama po doon sa budget natin.
In other words, ito pong pakikita ko po na project po ninyo, proposed, big ticket projects proposed by ITMD, signed by Calixto Gabuya. Ito po ba ay, yung mga yan, ay aprobado po ba yan ng board?
Mr. Chair, hindi ko po masyadong...
Okay, banggitin ko po sa inyo. Ito po yung mga workstation for programmers, 10 million. Yung po sa mga desktop, laptops, sa mga software, hardware. Ito po ba ay dumaan na po sa board? Ito po ang halaga po nito is almost 760 million, Mr. Chairman.
Magkano po?
760 million.
760. Yung 760, hindi pa yan po approved, pinapa-approve pa namin sa board.
Okay. So, in other words, Mr. Chairman, itong 760 million, kasama siya sa ISSP pero hindi pa po siya approved ng board?
Hindi, kasi ganito po yun eh. Yung budget na yan, saka yung items, ipapa-approve pa namin sa board. Pag
Okay.
na-approve pa yun sa board, tsaka namin siya ipo-forward sa DICT for approval. Kailangan po ng endorsement ng board. And then we amend the ISSP and then we forward to the DICT for approval.
So in other words, ang simula po ng proseso ay aaprubahan muna po ng board yung budget, tapos dadalhin sa DICT. Kapag naaprubahan ng DICT, babalik sa inyo para isama sa ISSP? Or
ay, hindi,
baliktad ata, Ma'am Aragona. Sandali po. Kasi ang pagkakaalam ko po, yan pong ISSP is a strategic plan, no, ng 2018 to 2020. 3 taon na na plano para po sa IT program po ninyo. So kumbaga sa lengguwahe ng mga common tao, Biblia yan eh. Ito yung Biblia nyo, ito susundin nyo, ito plano ninyo, ito poponduhan natin, ito ang aaprubahan nating appropriation for the IT program. So nagsisimula ang pondo doon po sa ISSP, doon nyo po nilalagay. Di po ba? At tapos pag inaprubahan na ng board dyan, babudgetan po ninyo, tapos dadali sa DICT, at pag naaprubahan ng DICT, saka nyo po sila ibibiding. Yun po ang proseso. Okay. Ma'am Aragona, ang question ko lamang po ay ang ginagamit po ninyong license, no, sa inyo pong system, sa pagbili nyo ng mga solution, ng mga application, ano po, Oracle? Oracle license po ba tayo?
May Oracle license po sa
So,
database
okay,
po
ang
namin.
database nyo po ang ginagamit nyo, Oracle. Okay?
Opo.
So, in other words, yung mga ino-order nyo rito mga software, kapag hindi po to Oracle, hindi po to magmamatch. Ibig sabihin, Mr. Chairman, ang Oracle po, kasi isang ano to ang tinatawag po natin, legacy system to No? Kung baga, pag nagsimula ka sa Oracle, hindi ka makakapagawa ng ibang programa. Hindi mo siya mapapasok doon dahil exclusive siya, Oracle lang. Kaya nakita ko sa proposal nyo, Mr. Chairman, meron kayong mga duplication. And nasa Oracle na kayo, pero gusto nyo pang magkaroon ng software development platform solution na kumbaga, nais nyo gumawa ng sariling platform which will be redundant kasi meron na kayong Oracle. But if you wanted to have a transition from Oracle to a different platform na being managed and owned by PhilHealth, okay po yun. Pero ang tanong, magkano na po ba ang nagastos ninyo noong 2018 saka 2019 pagdating po sa programming ng inyong sistema? Magkano na po? 2018 saka 2019?
Sa 2018 po, ang total namin MOOE and CAPEX po.
Sa IT lang po to,
Sa
magkano?
IT lang po. 2018, we have a COB of 1.4.
1.4 billion.
Yes, 1.4 billion, but we only utilize 334 million.
334. Okay. 2019 po.
2019, we have 1.5 in our COB. We only utilize 317 million.
317. At
Apo.
ngayon pong 2020,
Yung ngayon pong 2020 kasi nasa pipeline for approval, yung ibang budget, but we have 589 million, pero 79.9 million ang utilized, meaning na-procure.
magkano utilize?
79.9 million.
Mr. Chairman, Ma'am Jovita Aragona, is it true noong December 15, 2019, nag-propose daw kayo ng 2.1 billion para po sa department po ninyo na nireject ng board? Totoo po ba to?
Hindi po totoo. Nag-present kami 2.1 pero hindi po siya ni-reject. Deferred for presentation.
But you requested for 2.1 billion. Yes or
po,
no lang? Yes
as
or no lang?
provided.
Kasi nasa minutes
Yes
naman po yan.
Yes.
Okay, yes. During the risk committee hearing, yung January 8, 2020, ito po yung pinagbabasihan ko doon sa mga sinabmit sa aming dokumento, no? Ito galing kay Attorney Kit itong pinagbabasihan po natin. At nakalagay dito, January 8, 2020, yung po daw 2.1 billion, nireduce po ninyo sa 1.9 billion. Totoo po ba to?
Totoo po.
At nung March 15, 2020, lumalabas po yung 328 million na supplemental budget for ICT project were approved with the contention that without it, PhilHealth will collapse. Totoo po ba to?
Hindi po. Ang term na ginamit ko, down.
The system will be down. Will be down. Anong ibig po sabihin ng down at collapse? Ano po bang pagkakaiba nun?
Yes. For collapse, totally, wala ka na. Yung down, because if the main production site is not available, so temporarily, systems will be down and we will shift to the backup site.
At nung April 23 po, nung board meeting po ninyo, nag-propose po kayo ng 750 million for procurement ng items ng IT sector. Totoo rin po ba to? Ito in-endorse daw ni General Ricardo Morales. Yes or no po?
Yes.
Okay, Mr. Chairman. So, in other words, Mr. Chairman, 1.4, sa 2018, 330 million. Sa 2019, 317 million. Sa 2020, umabot tayo ng 79 million. So kulang-kulang ng mga 800 million para lang po sa sistema ng PhilHealth. Ako naging mayor po ako. Yung aking city, nakabuo kami ng automation internally and externally not exceeding 100 million, Mr. Chairman. At dito, pag mapapansin mo, Mr. Chairman, sa mga proposal po ninyo, na pirma ito ni Gabuya, ha? Ito, i-explain ko lang po itong sinabit nyo sa amin. For example po, 123 units ng desktop, 12 million. Ang nakalagay po rito, 97,000 each. Ano po ba to? Apple po ba itong bibilin po ninyo? Or Lenovo? Or ano po ang bibilin nyo rito? Bakit ganito kamamahal? 97,000.
Usually sa computers po, generic, hindi po tayo naglalagay ng brand. Pero pwede po namin ibigay yung detailed specs ng bawat computers.
Ito, Mr. Chairman, 113 million. Desktop computer with standard specification. Nag-propose po kayo dito. 113 million para sa 1,314 units na desktop. Lumalabas na 85,000 each yung pong desktop. Eh kung bibilin mo lamang to sa Apple o kaya sa Lenovo, Diyos ko, napakamura nito, Mr. Chairman. I really don't know why. I really don't know why you are trying to put a system that will take you so many years, no, para ma-develop using almost 700 to 800 million. Tapos meron pa kayong additional na ngayon na hinihinging 760 million. Redundancy, repetitious, yung inyo pong approach, Mr. Chairman. At nakakalungkot dahil nga parang hindi tama po itong ginagawa talaga ng ating pong PhilHealth. At anyway, Mr. Chairman, sa last na po ako.
Last
na po
question,
to.
Deputy
Promise,
Speaker
Mr. Chairman.
Fernandez. Yes, please.
Kay Mr. Renato Limsiaco, andiyan po ba siya?
Mr. Limsiaco is recognized.
Kanina nadinig ko yung nagtatanong si Congressman Abante about doon sa total asset ba yon? Asset o yung total na equity? Ano ang sagot mo doon? 260 billion ba?
Mr. Chair, yung tinatanong kanina ni Congressman Abante is the total asset of the corporation, Mr. Chair. And of course, the discussion also relative to the equity of the corporation po.
Okay, total asset yun. No? Okay. Magkano yung equity sa premium natin? Yung total na nakukuha natin sa premium, galing sa sponsored by the government, by private individuals, tapos yung mga sponsored, gano'n. Magkano yung ating premium? 2019, magkano?
2019, Mr. Chair, the recorded premium income is 146.4 billion pesos, Your Honor.
146? Are you sure? Hindi ba 151? 2019? Kasi kayo nag-submit nito eh. Ba't mali-mali ang sinasabi ninyo? Ano ba totoo? 146 o 151? Kasi babato natin yan sa debt ninyo eh. Para makita natin ang totoo. Sa record mo, 146. O sige, gano'n na lang. 146. Magkano debt noong 2019?
Come again, sir?
Magkano yung liability natin noong 2019?
2019 liability, sir. Let me check my record. The liability amounting to 111 billion, 0.3, Your Honor. This represents current liability and non-current liabilities.
So 111 billion yung ating liability.
Yes po.
Kasama na ba dito sa liability yung mga hindi pa nababayaran mga ospital?
Yes, Your Honor.
Kasama na?
Kasama po dito. Yes, Your Honor.
So in other words, meron pa tayong lumalabas na mga 35 billion. Kasi kung pagtutuusan natin, premium lang, saka yung mga babayaran lang natin sa mga utang, 146, saka ng equity, liability na 111, lumalabas meron pa tayong 35 billion.
Yes, Your Honor.
Magkano
if
pa
we
ba
will
reserve
deduct-
natin sa PhilHealth?
Come again, sir?
Magkano ang reserve funds?
Reserve fund, Mr. Chair, is 110 billion, Your Honor.
Yung 110 billion na reserve natin, ano yan? Solid na pera yan. Hindi
This is
kasama yung
our-
asset.
This is our members equity, Your Honor. If we will talk about pondo na asset as to the investment and ang ating time deposit and cash, Your Honor, let me give you the figure, Your Honor.
Okay.
Our investment, Your Honor, and securities is amounting to, as of June 30, 2020, Your Honor, is 132.1 billion, Your Honor.
132.
Yes po. Ang ating investment in time deposits, Your Honor, is 35.5 billion. And ang ating cash and cash equivalent...
35.5 billion?
Yes po.
Okay.
Yes, Your Honor. Cash and cash equivalent is 48.4 billion, Your Honor.
48.4. Last point.
Okay, maraming salamat, Mr. Chairman. And, gusto ko po sana, andyan po ba si Yusek? May tatanong lang ako isa, Yusek ng Department
Honorable
of Justice.
Fernandez, you promised to ask the last question.
Okay, since na...
You have Thursday. I'll give you Thursday.
Okay,
Tomorrow is
Mr. Chairman,
OVW.
sige po, yun lang po muna at nakakaya naman po kay Congressman Barsaga. Maraming po salamat.
Salamat, Deputy Speaker Fernandez. Yung talon ng mga tanong mo, Deputy Speaker, from IT to Finance. The Honorable Barsaga, our lawyer accountant, is recognized.
Maraming salamat, Mr. Chairman. Babalik ulit ako sa IRM. Unang-una, ang IRM, ang binasihan natin initially, for the COVID, yung circular ni General Morales dated March 20. Tama po ba?
Yes, Mr. Chair, when it was signed.
Then, doon sa management meeting ng Board of Directors, tama ba na ang unang pagkakataon nagkaroon ng meeting ang board about COVID, IRM is March 31, was March 31, 2020. Corporate Secretary.
Attorney Mangawang.
Yes, Mr. Chair. The IRM that was presented on by management on March 31 was for the COVID
Ang
pandemic.
tanong ko lamang, tama ba na ang kauna-unahang meeting ng Board of Directors pertaining to IRM was on March 31, 2020?
That is correct, Mr.
That
Chair.
is correct. So, kay Mr. Lim Siako naman, kailan ang kauna-unahang pagkakataon na nag-release kayo ng pondo pertaining to IRM?
Mr. Chair, Your Honor, the first release of the IRM ng PhilHealth ay March 23, 2020, Your Honor.
So sa madaling sabi, nag-release na kayo ng pondo ng IRM even without the prior approval of the Board of Directors. Yes or no? O bakit hindi tayo makasagot? Ang sabi nyo, first release March 23. Admitted din na March 31 ang first meeting ng board about IRM. So nag-release kayo ng pondo on March 23 even before the meeting of the Board of Directors. Tama ba? Yes, what is your answer? You are?
Attorney Labi po, Mr.
Oh yes,
Chairman.
attorney.
Honorable Barsaga, sir. If I may look at the PBR po, 2496.
Hindi ang tanong ko.
Aris.
Ang tanong ko, admitted ni Attorney Mangawang, ang first meeting ng board pertaining to IRM ng COVID was March 31. Correct?
Correct.
Second question, tinanong ko si Renato Limsiaco, kailan siya unang nag-release ng pondo para sa IRM? Ang sagot niya, March 23. So tamang sabihin na nag-release na ng pondo ang PhilHealth for IRM even without prior meeting and approval of the board. Yes or no?
No, Mr. Chairman.
No, Mr. Chairman. This I am warning you, attorney. You are on the road, and I am just relying on the documents which you have submitted and based on the answer of Mr. Limsiaco. So sa madaling sabi, nagsisinungaling si Mr. Limsiaco nang sabihin niya na nag-release, ang unang release ay March 23.
Can I be allowed to explain further?
Yes, please.
Yes, nagsisinungaling ba si Mr. Limsiaco ng kanyang sabihin na ang unang release ng IRM was on March 23?
No, Mr. Chairman. The record also that I have in my disposal is also March 23.
Okay, kaya nga, kung March 23, ibig sabihin, nag-release na kayo ng pondo ng IRM even before the meeting of the Board of Directors. Tama. Attorney, you are a lawyer.
Mr. Chairman, as I've mentioned, if I may be allowed to explain further.
Yes.
Please.
Yes, please.
Mr. Chairman, if we go back to the PhilHealth Board Resolution number 2496, as we can see in the fifth whereas.
What is that date?
The fifth whereas, Mr. Chairman.
Anong date yan? Ano yung date?
This is January 30, 2020, Mr. Chairman.
Oh, ano ang nakalagay dyan?
The fifth whereas, if I may read, whereas in order that it can provide quick and timely response
Oo
to the
nga, pero
healthcare needs.
sinasabi ko, ano yung binabasa mo?
This is the blanket authority pertaining to IRM, Mr. Chairman.
Ano, sino ang nag-issue niyan?
It was issued by the board, Mr. Chairman.
Issued by the board?
Yes, Mr.
O ano
Chairman.
nakalagay dyan? Nakalagay ba dyan na pwede na kayo mag-release?
This is a blanket authority whenever there is a fortuitous event and emergencies, Mr.
Oh,
Chairman.
alam na natin yan eh. 2020 ba yan?
Yes, Mr. Chairman.
Do you have a copy of that?
Fifth whereas clause.
Okay,
Mr.
next
Chairman.
question. So, na-release tong mga pondong to prior to the approval ng specific approval ng board sa IRM. Diyan sa binabasa mo, walang nakalagay dyan na 30 billion.
There's none, Mr.
Oh,
Chairman.
there's none. Second, ang releases were made before March 31.
Correct.
Ha?
Correct, Mr. Chairman.
Oh, correct. Pagkatapos, ang sinasabi nyo, the funds will be coming from the special savings.
Come again, Mr. Chairman.
I'll address the question to Mr. Limsiaco kasi siya nagsasabi rito. PhilHealth investment portfolio is as follows. Special savings, 65 billion. Sino ang nagbigay nitong amount na to?
Mr. Chair, Your Honor, as of anong period, sir, yung hawak ng report, sir? Kung if po pwede po.
I am just relying on the records ng inyong board as of in the meeting held on March 31. Nakalagay rito, as of February 2020, special savings is 65 billion. Sino nagbigay ng amount na 65 billion? Sa board. Attorney Mangawang.
Tingnan mo.
Mr. Congressman, pwede pong pakiulit yung amount that you mentioned?
Okay, ito nakalagay sa inyo. Ang nagawa nito, this one, summary of board actions, etc. Sino ba nagawa nito? Nag-submit dito sa amin. You were the one who gave me this copy, Attorney Mangawang.
Yes, sir.
Okay, ang tanong ko, nakalagay dito, as of February 2020, number 10, PhilHealth investment portfolio is as follows. Special savings, 65 billion. Treasury bonds, 107 billion. Corporate bonds, 18 billion. And treasury bills, 7.03 billion. Okay, sino nagbigay nitong figures na to?
Mr. Chair, Your Honor, okay. The mentioned amount of the special savings deposit is as of February 20. What we have now is the latest. If you want the latest.
No. My only question is that, sino ba ang nagbigay ng mga figures na to na ipinarating nyo sa inyong board of directors? Kaya reflected dito sa minutes. Was it Mr. Limsiaco?
Sino nagbigay?
Mr. Chair, sadali lang po. I confer ko with Attorney.
So normally, sino ba nagbibigay sa board ng financial standing ng PhilHealth? Especially when it comes to a disbursement of 30 billion. Kung si Mr. Morales, si General Morales, sino magre-report sa akin? Ito pondo ng PhilHealth. Pwede natin gastusin.
Mr. Chair, Your Honor, kami po sa FMS, Fund Management Sector, the one providing the information as to the financial.
Who?
Particularly ako po as the Senior Vice President for the Fund Management Sector.
What is his name?
Renato Limsiaco Jr.
Ha?
Renato Limsiaco Jr., Your Honor.
Attorney Limsiaco, he's the one.
Oh, Attorney Limsiaco, ikaw ang nagbigay ng impormasyon na to.
Mr. Chair, correction po, hindi po ako lawyer.
I'm sorry.
No.
Sino nag-present? Ako nag-present? Kailan ba ito?
Ito yung March 30.
March 31 na board.
Tapos pinag-mention.
Mr. Chair, Your Honor, the figure presented here is as of February 2020, Your Honor.
Na February 20, binasa ko. Ang tanong ko lamang, sino ang nagbigay ng amount na to?
Mr. Chair, ako po ang nagbigay ng figure na ito, Mr. Chair.
Ikaw ang nagbigay?
Your Honor. Yes, sir.
Where did you get this amount?
From our financial report, Your Honor.
From whom?
From
A specific person?
From the financial report prepared by our Controllership Department, Your Honor.
Okay. Nakalagay rin dito, last sentence ng number 10, IRM funds will be sourced from the special savings. Do you confirm, Renato Limsiaco, na tama itong nakalagay rito sa aming dokumento?
Mr. Chair, Your Honor, yun po ang pagkukunan natin ng pondo para sa
Okay.
po. Readily
So,
available po yung pondo. Yes,
In
sir.
short, kukunin nyo sa special savings.
Yes, Mr. Chair, Your Honor.
Well, as I can recall, when the inquiry was made by Congressman Gimbo kung saan nanggaling ang pondo ng IRM, ang sagot nyo ay sa CAPEX.
Mr. Chair, Your Honor, dalawa kasi po ito eh. No, one, when we say kunin natin yung pondo, source of fund para sa 30 billion ay kunin natin sa sorry, Mr. Chair, Your Honor. Ang source of fund po nito, talking about at budgetary requirement, ay kukunin po sa corporate operating budget ng PhilHealth for the year 2020. And
Ang tanong lang natin simple. Nakalagay dito sa minutes, kukunin nyo sa special savings. Ang inyong savings ay 65 billion.
Yes, Your Honor, kung
Yes,
sa pondo
okay.
po, sa cash, dyan po natin kukunin sa special
Okay,
savings
pero
deposit po.
nagtanong kanina si Congresswoman Timbo kung saan nyo kukunin yung 30 billion. Ang sagot nyo, sa CAPEX, sa capital expenditure. So ano ang tama?
Mr. Chair, Your Honor, hindi po sa CAPEX po, sa corporate operating budget, COB po.
Pero pag sinabi natin corporate operating budget, that cannot be considered as savings. Hindi ba? Are you an accountant?
Yes, Your Honor.
Oh,
Hindi po sa
pag
savings po.
special savings, that is a reserve fund. Tama ba?
Mr. Chair, Your Honor, if po pwede ko po i-explain ng konti po, kung marapatin po nyo, ibigay ko po yung konteksto po ng sagot po natin. Now, ang pondo po na pagkukunan as to the pera mismo, fund as to cash, ay dyan po sa special savings deposit natin. Because meron ho tayo special savings deposit, mayroon tayong time deposit, and mayroon tayong investment na pondo, Your Honor. And
So, teka muna. Ang sinasabi natin, itong pondo para sa IRM ay hindi kasama sa inyong regular budget for 2020. Sapagkat kung titingnan naman natin yung budget nyo for 2020, wala naman kayong nakalagay doon na COVID.
Mr. Chair, Your Honor, ang corporate operating budget ng PhilHealth for the benefit is 184 billion, Your Honor. Nandyan po siya lahat para sa mga benepisyo po yan.
Hindi nga, ang tinatanong ko nga, wag mo nang sabihin sa amin because we are the one making the budget for Congress. Kabisado natin ang budget ng bawat ahensya. Sa inyo, for 2020, wala kayong budget pertaining to COVID. Tama ba o hindi?
Mr. Chair, Your Honor, ang PhilHealth po ay gumagawa ng sariling corporate operating budget po.
Alam namin yan. Tanda ka lamang.
Tayo.
Kasi ang budget nyo for 2020, ginawa natin noong 2019, August. Hindi ba? Noong August 2019, wala pang COVID. Yes or no?
Mr. Chair, ang COB po ni PhilHealth po ay ginagawa niya as a corporation po, hindi po siya dumadaan sa national government po, Your Honor.
Hindi nga, alam nga natin yan. Pero ang sinasabi ko, kung hindi man dumadaan sa national government, dito ba sa budget nyo for 2020, may naka-indicate na expenses for COVID?
Mr. Chair, Your Honor, hindi po siya nakalagay ang COVID but part of the computation of our actuary, Your Honor, if SBP...
Hindi, magdandaan ka kasi ang problema nga natin, magsalita ka ng dahan-dahan. Simple lamang ang tanong ko, yung bang special savings kasama sa inyong operational budget for 2020?
Mr. Chair, Your Honor, special savings po ay hindi siya kasama sa COB po.
Kaya hindi kasama.
Yes po, ibang ano yan po, ibang...
Hindi nga, wag na ka na mag-explain, hindi kasama.
Hindi po, ibang account.
Okay, so para maisama to, for a new expenditure, kinakailangan ba ang approval ng Board of Directors? Yes or no? O hindi na?
Mr. Chair, ang ating SBP Santiago po ang maka-explain po ang laman ng benefit.
Kaya nga, simple lang tayo. Yung bang special savings na nakadeposito, gusto nyong gamitin sa COVID, kinakailangan ba o hindi na kailangan ang approval ng Board of Directors? As simple as that. Hindi na kailangan.
Sa tingin ko po, hindi na kailangan po ay
Hindi na kailangan.
nakapresent din po sa board during that board meeting, Your Honor.
Sa tingin ko po, Mr. Chair, Your Honor, hindi na po
Private
kailangan
Secretary,
po.
special savings, nakadeposito, savings, special. Pwede ba itong gamitin 30 billion without the prior approval of the Board of Directors? Corporate Secretary, you are a lawyer.
I'm sorry, sir, but I am not familiar with the law pertaining to that. I'm sorry, sir, but I am not a finance person, sir. So I cannot.
Legality. Meron na bang special savings before na ginamit ng PhilHealth without the prior approval of the board prior to disbursement?
Mr. Chair, Your Honor, under the regular benefit payment po natin, ang source of fund po ng pera, ng cash na tinatransfer po natin
Ang
sa
pinag-uusapan
region
lang natin
ay
is
galing
special
sa-
savings.
galing sa
Mr.
special
Lim
savings
Siako,
po.
will you please listen first?
Sorry, Your Honor.
Ang pinag-uusapan lang natin is special savings. Hindi kasama sa regular budget ito. Savings sa bangko. Pwede nyo ba itong gastusin, 30 billion, without the prior approval of the Board of Directors? Your answer is yes.
Mr. Chair, Your Honor, as I mentioned po, ang benefit payment po natin ay gagaling sa special savings deposit na
Hindi na natin
ginagamit po natin.
pinag-uusapan yung benefit payment kasi hindi naman benefit payment to na normal. Ito, bago.
Mr.
Kaya
Chair,
ang tanong ko lamang, simple, special savings, 30 billion, pwede nyo gamitin without prior approval ng board? Yes or no?
Mr. Chair, Your Honor, yun po ang source of fund po
Ano ang sagot mo?
benefit po natin at sa kakagaya din
Mr.
dito
Limsiaco,
What is your
it's
answer?
a very
Yes or no lang?
simple question. Yes or no, can you utilize that special savings or not?
We can use, Your Honor,
On Thursday, I'm giving you to make a legal position paper to justify na yung special savings na 30 billion pwede nyong gastusin without prior board approval. Otherwise, I would be filing a case against you if you will not be able to justify it legally.
Mr. Chair, Your Honor, if may I, Mr.
Yes.
Chair, ito po ang 30 billion po ay napresenta po sa board.
Okay,
for
Attorney
confirmation.
Champo, we don't need to debate about this. The Honorable Barsaga is asking you to submit a legal position paper on this. So you can check with your legal, you can draft it and submit it to this committee. Honorable Barsaga, Attorney Labe would like to reply.
No. And as a matter of fact, the special savings were spent even prior to the approval of the board. That's a fact. You justify that legal issue. Kasi unusual na nga ito eh. 30 billion up to now, walang implementing rules and regulations. Hindi alam ng mga ospital kung paano gagastusin. Pag sinabi ng presidente ng isang ospital, kailangan ko bagong sasakyan, sapagkat kinakailangan pumunta ako lagi sa ospital, you can use this IRM. Sapagkat wala kayong implementing rules and regulation. Kahit yung mga doktor, hindi nila alam kung PD, entitled ba kami sa 30% na babawasin namin doon sa mga COVID payments ng PhilHealth? We don't even know the guidelines and we don't want to be held liable. So as of now, wala tayong implementing rules and regulations. Yes or no? Attorney.
Attorney Labe. For the information of everyone, Congressman Barsaga, may certification na po. In fact, from our infirmary, from our, here from our medical services, kay Attorney Del Rosario, nag-hypertension kanina. Si Mr. De Jesus, nag-exit kanina dahil nanghihina na. Huwag niyo na pong galitin si Congressman Barsaga. Patapos na lang po tayo ngayong araw. Attorney Labe, kindly reply.
Just for the record, Mr. Chairman, heart bypass ako, Kinti Paul. 20 years ago, I am also diabetic. Kaya kung magkakaroon ng unang hypertension dito, siguro ako, simple lamang ang tanong ko, attorney. As of now, meron na bang implementing rules and regulations kung paano gagamitin ang IRM? You are a lawyer. You answer my questions directly. Meron na bang implementing rules and regulation? Yes or no?
It is embedded in the circular, Your Honor.
Hindi
Mr.
nga,
Chairman.
huwag natin sabihin ng circular. Iba ang circular, iba implementing rules and regulations. Kasi ang sinasabi ko naman, alam nyo,
Congressman
that
Bersaga.
once there is an implementing rules, as long as they are in accordance with the law, it will be valid and binding. Kaya, implementing rules, meron ba o wala?
On our record, there's none, Your Honor.
Oh, there's none. So, hindi alam ng mga ospital kung paano nila gagastusin o kung paano sila magre-reimburse sapagkat up to now, walang implementing rules and regulations. Is it usual? Pangkaraniwan ba, attorney, sa PhilHealth na nagkakaroon tayo ng advances na 30 billion in advance natin as early as March 23, April, May, June, July, August, 5 buwan na, wala pa tayong IIR, samantalang yung pera ng gobyerno nasa mga institusyon na in the sum of 27 million. Pangkaraniwan bang ginagawa yan sa PhilHealth? Attorney?
Attorney Labe.
I believe, Mr. Chairman, part of the circular which states the monitoring.
Hindi na natin pinag-uusapan yung circular. Iba yung circular sa IIR. Ang pinag-uusapan natin dito, 30 billion. So walang implementing rules. Admitted. Pangkaraniwan ba, nag-advance kayo ng pera na walang IRR?
For this particular issuance, Your Honor, I am familiar there's no IRR, but subsequent or
Okay.
prior issuance, I have no
Oh,
knowledge.
in spite of the fact na meron ng lapse na 5 months. Kaya nga pwedeng gamitin to pambili ng kotse ng presidente ng ospital. Pwedeng ibayad sa sweldo ng mga empleyado or for their overtime, including these allowances. Totoo ba o hindi?
The objective is clear, Mr. Chairman. That
O
is
eh,
intended.
babalik na naman tayo sa objective. Ano ba objective?
Attorney,
Ano
I
objective?
don't think we're here to blame anyone. These are just facts being laid down the table by the Honorable Barsaga. Kasi kung may problema, may mali, pwede pa rin nating i-correct eh. Pero wag po natin sabihin o i-justify kasi hindi po natin mako-correct.
Eh, ang pag-objective naman, ang sasabihin mo, Panyero, for the COVID. Tama. Tapos tatanong ko naman, kung ang objective niyo COVID, eh bakit binigay niyo dialysis center at saka lying in? Oo. Eh yun lang naman nililinaw natin eh. Kasi narinig naman natin ang statement ni Atty. Hulyara. Meron ng listing sa bawat region kung sinong ospital ang bibigyan.
At ano po, Congressman Barsaga, simple ako, Attorney Labe, binigay mo na sa akin yung, ako kunyari may-ari ng ospital, no? Ex-corporation, nandun na ho yung pera nilagay ninyo. Would you have a way to monitor ang paggastos ko? Wala
Again,
po, di ba?
as I said, Mr. Chairman, it's part of the
No.
PhilHealth circular.
Binigay mo na sa akin. Alam niyo po ba kung paano ko ginastos? Let's say, I'll cite one para lang malinaw na. Concrete. Yung tinatanong ni Congressman Barsaga, nagbigay kayo kay A Dialysis Center ng 9.9 million. Would you know paano niya ginastos to? Or ginagastos to?
On every detail, no, Mr. Chairman, but we can check it during liquidation.
Exactly. So you don't know. Okay. Congressman Barsaga.
So ang sinasabi mo circular, itong 2020.007.
That is correct, Mr. Chairman.
Kailan naging effective tong circular na to?
It was effective immediately after publication or on March 21,
Okay, so sa
2020.
madaling sabi, kailan na-publish?
This was published on March 21, 2020, Mr. Chairman.
On March?
21, 2020 po.
Do you have a certification of the newspaper where the publication was made?
We can provide, Mr. Chairman.
O saang dyaryo?
Saan ba ito? I'll check it, Mr. Chairman.
Eh sabi mo na i-publish ng March 21. Hindi mo naman alam kung anong dyaryo? Ano ba yan? Philippine Star? Manila
are-
Bulletin?
Please allow us to check for a while, Mr. Chairman.
Congressman Barsaga, after this, opo. Yes. Dapat to yung mga nandito, Honorable Barsaga, we'll ask our committee members, those who are present will be given extra time. I mean here in plenary. If they will allow.
Mr. Chairman, while waiting lang.
Mr.
Yes. Honorable
Mr.
Senator
Chairman,
Bradley.
it was published through Manila Bulletin on March 21, 2020 po. 2020 via Manila Bulletin po.
With the Manila Bulletin, although I believe your statement. Wow, nawala na ako, Mr. Chairman.
Yung pong sinasabi nyo, yung dialysis centers, yung yung next question nyo. Lying in. You're mentioning earlier about the funds, and then the next is, because COVID-19, bakit napunta po sa dialysis and lying in?
Well, they cannot explain. Hindi ba? Hindi niyo maipaliwanag kung bakit napasama dialysis?
Mr. Chairman, actually, from the very start, there was a misunderstanding as regards to coverage of the IRM. And that's why we cannot really come to a same conclusion, because we are saying that this is provided for the entire country because there's already a public health emergencies, and hence, in fact, if we are going to review, Mr. Chairman, the basis of the IRM fund is almost 27 billion, because it is based on the historical claims of the total HCIs during the 2019.
O wag na yung historical. Kasi ang sinasabi niyo namang historical, I read your circular, ang sinasabi niyong historical, yung PhilHealth payment nyo for the last 3 months noong 2019. Hindi ba? Tama ba yun?
That's right. That's
Okay.
correct, Mr. Chairman.
Ang sinasabi mo nga lang kanina, ang objective natin for the pandemic, for the COVID. Kaya hindi nyo maipaliwanag bakit nakasama ang dialysis at private lying in.
Actually, Mr. Chairman, it is intended not just for the COVID-infected members, but the entire. It is similar to
but
the.
Attorney Labe, I saw the minutes of the discussion, yung kay BM Mercado. The whole time it was just COVID. There was no discussion of providing funds for different hospitals, for other cases. It was really a COVID-19 proposal. Go ahead, Congressman Barsaga.
Tuberculosis, kasama ba tuberculosis?
As far as I'm concerned, it is kasi lahat po ng cases po, Mr. Chairman.
Lahat ng cases?
The intention was.
Oo nga, pero pag sinabi natin lahat ng cases, wala tayong question pag na-compense sa hospital. Pero pag dialysis naman, alam naman natin yun, ever since, hindi matitreat kahit na COVID positive sa dialysis center. Tama ba? Pagkatapos sa layingin natin, birthing facility, policy ng DOH sa mga LGUs, pero hindi nyo binigyan ang mga public birthing facility. Kaya nga doon nakikita ng karamihan that there was favoritism sa pagbibigay. Yun lamang ang point namin. Pagkatapos ura-urada tayo, no implementing rules and regulations for the amount of 27 billion. Well, anyway, I would go with another question. Treasury bonds, 107 billion. Oh, Mr. Limsiaco, tama ba to?
Mr. Chair, Your Honor, Treasury bonds, 107 billion, Your Honor.
Next question. Treasury bonds. Sino ang mga nag-issue nito?
Mr. Chair, Your Honor, our manager for the Treasury nandito
The
po.
biggest issuer of the treasury bonds na hawak ng PhilHealth. Philippine government? Ha?
Yes, sir. It's the government po.
Oh, kailan ang maturity nila?
Different dates, Mr. Chair, Your Honor.
Earliest,
About ranging 5 years, 3 years, sir.
5
Your
years,
Honor.
10 years,
Opo.
earliest, 5 years. Okay. So wala tayong aasahan sa treasury bonds na 107 billion within the next 5 years. After 5 years pa ang maturity. Okay. What about the corporate bonds? Oh, sino nag-issue nitong corporate bonds in the sum of 18 billion? Baka naman ang nag-issue nitong korporasyon, insolvent na.
Mr. Chair, Your Honor, ang ating pong mga corporate bonds or investment in corporate bonds, based on what is being provided our laws and regulations, very conservative po tayo dito, Mr.
Kaya ang gusto lang naman namin, with this pandemic, marami ng corporate bonds ang bumaksak. Kaya we want to know how safe was the investment of our contributors, 18 billion. Okay, next question. As of June 30, 2020, how much is the cash position of PhilHealth? Mr. Limsiaco.
Mr. Chair, Your Honor, for the cash position of the corporation, Your Honor, as of June 30.
June 30.
Yes, sir. Ay, nahanap ko lang po yung presentation ko po kanina.
19. What is your ending cash position in 2019?
Ito na po, Mr. Chair, Your Honor. Ang ating cash po ay cash and cash equivalent 48.4 billion, Your Honor, and investment
How much? Dandaan lang tayo.
48.4 billion, Your Honor.
Million, billion?
Billion po.
Ha?
Billion.
Billion.
Opo.
Billion, sir.
As of December 31, 2019.
June 30, 2020 po. June 2020, sorry, Your Honor. As of June 30, 2020, our cash and cash equivalent is 48.4 billion, Your Honor.
Okay. What about the liability as of June 30, representing the claims of the hospitals and other HCI?
Mr. Chair, Your Honor, for the claims, our on process, Your Honor, as of June 30, 2020 is amounting to 20.2 billion, Your Honor.
22 billion.
20.2.
Okay. Next question.
Claims.
What other cash collections do you expect to receive starting July up to December? Very simple question, Mr. Fund Management Manager. Ang cash mo, 48.4 billion as of June 30. Meron ka ba bang aasahang tatanggaping cash mula June 30 hanggang December 31?
Mr. Chair, Your Honor, ang projection ng ating actuary po for the premium ay 149.8 or 150 billion, Your Honor.
Itong 150 billion, ito yung expected collection nyo sa premiums ng PhilHealth.
Tama po, Your Honor.
Ha?
Tama po, Your Honor.
Do you think that the employers would be able to pay this 150 billion with this pandemic?
Mr. Chair, Your Honor, this represents direct contributor and indirect contributor.
Oh, yung direct contributor, sino nga yun?
Yung mga direct contributor po natin, Your Honor, ito po yung mga private, government, informal.
Inaasahan mo ba yung mga private makakapagbayad ng 150 billion as well as the informal?
Ang informal po, 71.3 billion,
O
Your Honor,
nga,
ay
so
national
what do you
government
expect
po.
to collect? Huwag nyo nang sabihin na yung mga the economy is not practically moving.
Mr. Chair, Your Honor, on the part of the national government, we are expecting 71.6 billion, Your Honor, and the difference po ay makukolekta natin sa ating private government informal. Sa katunayan po, Mr. Chair, Your Honor,
At
for
the
the month
next
of
scheduled hearing, you provide with us your estimate regarding the collections which you have to provide. Second, you provide us with your operating expenses starting July up to December 31. Third, what would be your expected payments sa HCI, including COVID cases, starting July 1st? At ngayon, bukod sa COVID, nagbabayad din kayo sa isolation facilities. Tama ba yun? Yes or no?
come again, Your Honor.
Yung mga isolation or quarantine facilities, nagbabayad ba kayo?
Isolation facilities.
Yes or no?
Mr. Chair,
Yes, go ahead.
we have a package for community isolation units po.
Oh yeah, isolation. How
Yes.
much is your payment?
The package is around 22,000 po.
Around 22,000. That is per person.
Yes po.
More or less, ganong karami sa tingin nyo ang babayaran nyo up to December 31? You give us that projection.
More or less, doesn't have to be exact.
More or less, because we want to find out kung totoo yung sinasabi nyo na walang problema ang PhilHealth. Okay, next question. Nagbabayad din kayo sa testing.
Yes,
Magkano ang binabayad nyo sa testing? PCR.
We have ano po, the package, if all services are provided, it's at 3,409. 409. Yes.
Okay, so ano projection nyo? Ilang mga tao ang kaya nyong bayaran ng 3,400 up to December 31 based on your budget?
Mr. Chair, can we call our actuary who does the projection
Hindi
for
nga,
this?
submit na lamang next hearing kasi hindi na namin
Yes, we will
makakaya.
submit po next year.
Okay.
In the Senate hearing, ang sinabi nyo, 300 million na more or less. Di po ba?
Yun pong 300 million, yun po yung na-release na natin as part of the
Exactly.
payment for...
Tapos meron kayo ngayong binabayaran sa Red Cross, na 700 more or less.
Yun pong 300 na nabanggit natin last hearing, more or less 300 plus, yun po yung naibayad na natin sa PRC or sa Red Cross that time.
That's right. Tapos meron kayong ngayong existing na binabayaran na 700.
Yes, according to our ano po,
We don't have to be exact. Just para lang may
Yes,
idea.
Mr. Chair, may bagong billing daw po.
Yes. Okay.
Kasi ang nagdududa ang ating mga kababayan na baka hindi umabot ang inyong pondo. That's why we want to show them na kahit na kayo nagbabayad sa COVID, nagbabayad kayo sa testing, nagbabayad kayo sa community quarantine, safe pa rin ang PhilHealth.
Honorable Barsaga?
Just a reminder,
Yes.
during the last hearing, Dr. Fragas, ang dami kong hiningi sa iyong dokumento. Listing of healthcare facilities together with their location, level, name of individuals, amount paid for community-acquired pneumonia for the last 3 years, 2017, 2018, and 2019.
Yes, Mr. Chair, according to our secretariat, we have submitted it already.
Oh, ay sinabit nyo ba yung hinihingi ko? Ang sinasabit nyo lang, Region 1, ito total. Region 2, ito total. Wala yung HCI together with the patients, together with the names. Meron ba?
According to our secretariat, we have submitted na daw po.
Wala pa. Oh.
Yes. Well, if we can request, I just discussed with the COMSEC, Honorable Barsaga, i-Google Drive na lang din natin because there are voluminous documents. If we have to copy everything and give to our members, it would be harder for us.
Yun
Go
ang
ahead.
sinasabi ko. Pwede nyo bang gawin PDF file? Kami na magpiprint.
Yes.
Kasi ang binibigay nyo, hard copy. Kalahating maleta. Tapos i-reproduce pa nila at ang dami namin humihingi. Can you do it PDF file para mas madali? O wala kayong IT?
Yes, Mr. Chair.
Okay?
Okay.
Oh, in the event that you would not be able to comply for the second time, Dr. Pragas, I will move that you be cited in contempt. Eh kasi ang dami naming dokumentong hinihingi. Wala naman kayong binibigay ng maayos. Okay? You remember that? Together with all the persons here. Because we are helping you. Ngayon, kung wala naman kayong hindi kayo involved sa mafia, okay, ito pa isa, last, bago ako matapos. Andito si Attorney Corporate Secretary. Mangawang, your name was mentioned during the Senate hearing that you were part of the mafia. What can you say about that? Nalaman mo ba yun na na-mention ang pangalan mo?
Yes, sir. I denied that allegation. I denied that allegation, sir. I denied that allegation during the Senate hearing, sir.
Okay. Pagkatapos, na-mention din ang pangalan ni Mr. Mas. Andito ba siya? Wala.
Andito po.
Oh.
Same here,
You
Mr.
deny.
Chairman, Your Honor. I deny it.
And the other one mentioned, aside from Attorney Del Rosario, sino pa yung isang na-mention? Oh, si Mr. Lim Siangan. Of course, you also deny.
Of course, Your Honor, Mr. Chair, I deny that allegation.
Ano naman dahilan, publicly, na i-mention ng inyong pangalan na kasama sa mafia sa PhilHealth? Do you think of any reason kung bakit dinawit kayo, Mr. Lim Siako?
Mr. Chair, Your Honor, based sa hindi ko maintindihan kung bakit niya ibinanggit na ang pangalan ko eh sabi ni ni Attorney Kit yung Execom ang mafia. And on the part ni BM Kabading, hindi ho namin klaro kung na-mention na kami yung sinasabi niyang mafia sa PhilHealth. Mr. Chair, Your Honor.
What about Mr. Mas?
Ganun rin yung honor, no? Hindi nga rin klaro doon, no? Kay Board Member Kabading. Pero kay Attorney Torson, sinabi niyo buong Execom. Part rin kasi ako ng Execom.
Ha?
Part 2 ako kasi ng Execom. So sabi ni Attorney Kit, ang Execom daw yung ganun nga, no? Ganun yung connotation. Part rin ako ng Execom. Pero doon naman sa kay Board Member Kabading, hindi niya naman sinabi yun na ganun as such.
About kay Attorney Mangawang, bakit naman dinawit ang pangalan mo?
Mr. Chair, Mr. Congressman, actually the question that was asked of BM Kabading was, if you are president, who would you let go? And that was when BM Kabading mentioned our names. But it was Attorney Keith who said that the Execom is a mafia.
Pero kasi ito naman nagbibigay ng accusation laban sa inyo. They are not ordinary employees of PhilHealth. Kabading happens to be a member of the board of directors who was appointed only during the time of General Morales. Tama ba?
That's correct.
Okay. Pagkatapos si Attorney Kit is the head of the anti-fraud division of PhilHealth. Yes.
Attorney Mangawang, you're the corporate secretary.
I don't know, Attorney Keith.
Tamang siya ang head ng anti-fraud ng PhilHealth division.
Negative, Your Honor. Ano siya? PhilHealth Anti-Fraud Officer. Hindi PhilHealth Anti-Fraud Officer, hindi talaga siya yung head, no? Isa lang siyang abogado, isang ano. So PhilHealth Anti-Fraud Officer.
Whatever. They are occupying responsible and sensitive positions in the PhilHealth. Yun lamang ang point ko. Well, anyway, I'll continue at the next scheduled hearing, Mr. Chairman.
Thank you, Honorable Barsaga. VP Aragona, if you can submit to this committee the documents regarding the 334 million 2018 bidding, 317 million 2019, and 2020, 79 million, total of 730 million. Yung process ng pagbidding at saka yung specs po nito. This was requested by the Honorable Dan Fernandez. So, okay, if we can continue, I think the Honorable Bernadette BHD would like to make a manifestation. Congresswoman BHD, are you still there?
I'm still here, Mr. Chair. Thank you very much. Naputol lang po ako kanina. Pero magre-reserve na lang po ako ulit bukas kasi may mga bago akong katanungan that developed from the other questions. But I would stick to my promise na manifestation lang. This is regarding, dun gusto ko lang i-wrap up kanina, my concern again for the new memorandum circular from DTI and DOLE na mandatory na ang magiging testing sa symptomatic patients by the employers, private employers. At ang sagot nila, at ang sabi doon, PhilHealth ang sasagot dito. Kaya gusto ko lang malaman, number one, may existing guidelines na ba si PhilHealth kung paano ia-atake ang bagay na to? How will PhilHealth handle this considering everything that's happening? Since in aid of legislation naman tayo, I want to have clear answers from PhilHealth as to how they will manage this. Paano nila sasagutin ang mandatory testing na once every quarter para sa ibang sektor, once a month para sa ibang sektor, nung ating mga empleyado na magiging mandatory sa ating mga employers na ang sasagot daw ay PhilHealth. Siguro ang tanong ko, Chair, number one, meron ba tayong existing guidelines now on this one or gagawin pa lang nila?
Dr. Pargas?
Mr. Chairman?
Yes po.
Just for clarification, kay attorney at saka kay Mr. Limsiaco, meron bang budget ang PhilHealth for the year 2020?
Mr. Chair, come again, Mr. Chair. Ano ang tanong po? Ano yung tanong po?
May budget ba for 2020?
Ang PhilHealth?
Yes, Mr. Chair, we have COB for 2020 approved by the board.
So, may budget kayo ng 2020. Pwede bang bigyan nyo kami ng kopya at the next scheduled hearing?
Yes, Mr. Chair.
Okay.
Your Honor.
Next question.
Congressman Barsaga, the Honorable Bernadette D is asking a question.
Sorry.
Yes. Yes. Dr. Pargas, can you reply? Yung pong mandatory testing na pinirma ng DOH at DTI for all I'm sorry, and DOLE, every quarter RT-PCR.
Mr. Chair, as said earlier, we still have to see that MOA. And as soon as we have read it po, and we will make the proper guidelines and information.
Thank you. Honorable PH. Congresswoman BH. Congressman D. Okay, you may, while waiting for, ayan na, go ahead.
Mr. Chair, baka naman kahit paano I'm sure na pag-isipan na to because DOH will not commit PhilHealth kung hindi sila handa sa bagay na to. Dahil pumirma rin naman ang DOH dito sa memorandum na to. So sana bigyan nila tayo ng balangkas kahit tomorrow at sana i-input na nila lahat ng natutunan nila dito sa mga hearings natin, lahat ng mga pinag-discuss natin dito for the past several days. Para may ayos natin to kasi this is going to be very difficult again for the country and I want to make sure that PhilHealth is ready and taking into consideration everything that we have discussed here. Meron siguro naman may point person sila dito, baka naman kahit tomorrow afternoon, Mr. Chair, meron silang maibahagi sa atin na kung paano nila gagawin ang bagay na to. Is that possible?
The reply of Dr. Pargas is that they have not seen the MOA, so they don't have yet a policy. But Dr. Pargas, in the event na yung sinasabi ni Kong BH, would you be ready and what would be the cost for all of this?
Mr. Chair, currently po, we have naman our testing package. Now, with regard to the cost, yan po ang hindi ko po masasagot because I don't have the numbers po of how many will be, as our good Congresswoman is saying, mandatory daw po. So we have to know also gaano siya kadalas, ilang beses magagawin, and kailangan nating makita sino po yung sinasabing i-cover talaga para at least we could get the numbers and come up with the costs po.
Kong BH?
Yes, Mr. Chair, thank you very much for that. Ang akin lang, please take caution doon sa mga sumusunod na siguraduhin natin na yung sinasabi yung no copay para sigurado lahat ng testing facilities mapababa natin yung presyo. Kasi hindi to kakayanin ng Red Cross alone. If all employees, mandatory siya once every quarter, that's going to be very difficult doon pa lang sa existing testing centers natin in the country. So I'm expecting PhilHealth na mas maging mas mahigpit and at the same time na mag-accredit ng mga facilities na hindi na kailangan pang pagbayaran ng extra ang ating mga employers or yung ating mga kababayan na mga PhilHealth members naman sila, mga paying members naman sila. So I would expect na makita kaagad namin yung guidelines with regards to that. At sana po, i-take into consideration natin everything that we have discussed in the past few hearings. Yun lang, Mr. Chair. Siguro meron lang akong 2 questions na hindi naman kailangan sagutin ngayon, pero kaya ako magpapalista tomorrow or sa next hearing because I would like to be clarified lang on this. My first question is, uulitin ko, wala bang ginalaw na savings or walang ginalaw na investments for RIM?
Same question by the Honorable Barsaga. They will submit to us a position paper on this. Mr. Lim Siaco will be doing that. Congressman BH?
Yeah, I just wanted to make sure na kung totoo. And number 2, meron na bang nakapag-liquidate na ospital sa narilisan nila ng IRM?
Dr. Pargas?
Mr. Chair, Madam Congresswoman, yes, meron na po and we are asked to submit also the details of the particular liquidation po.
Yes, please. Gusto ko malaman, out of the 771 hospitals, ilan na ang nakapag-liquidate and how much have they liquidated to PhilHealth?
Yes, Mr. Chair. Madam, just to check po, it's 711 hospitals.
I'm sorry. Okay. Ayun lamang, Mr. Chair, palista na lang po ako for the next hearing and I hope that PhilHealth will be able to have answers for us kahit bukas with regards to this kasi this is a serious matter pagdating sa how we could really help our employers dun sa mandatory testing ng ating mga empleyado kung PhilHealth nga talaga ang sasagot, especially in the situation that PhilHealth is in right now. Marami pong salamat, Mr. Chair.
Thank
Isa
you,
na lang, Mr.
Congressman
Chairman.
BH, Honorable Barsaga.
Kay Mr. Lim Siaco, bibigyan nyo kami ng budget ng PhilHealth for the year 2020. Makakapagbigay ka ba rin ng statement of income and expenses income realized as of June 30, 2020?
Mr. Chair, Your Honor, we will provide you with the COB 2020 and the financial report of PhilHealth as of June 2020.
Okay.
June 30, 2020 po.
Pwedeng ibigay mo PDF file para hindi na kayo mahirapang magbigay ng hard copy.
Yes, sir, Your Honor.
When will be the earliest time that you can give them so that we can prepare for the next scheduled hearing?
By tomorrow morning, Mr. Chair, Your Honor, maipapadala na po natin yung ating financial statement and of course the COB po.
PDF file lang kailangan namin.
Come again, sir?
PDF file.
Yes, sir. Yes, sir.
Okay.
We will do that, sir. Thank you.
So, we will expect that tomorrow morning.
Yes, sir. Yes, sir.
Thank you very much for your cooperation.
Maraming
We are also
salamat po, sir.
cooperating with you.
Yes po, sir. Maraming salamat po, sir.
Thank you, Congressman Barsaga. I'm happy that you are happy now. Earlier, you were already getting angry. So I now recognize Honorable Stella Alabastro, our last interpolator for the night. Congresswoman Stella, yung mga kasama po natin sa PhilHealth, kailangan din po sila bukas sa Senate. Again, if I may remind, only one from legal, just on the OFW side, one for finance. Yun lang po, yun sa data lang naman. We don't need anything because what we're going to discuss tomorrow is actually the provisions of the law, of the UHC law, and what we can do to amend the law in order to help our OFWs. Honorable Kimbo?
Yes, Mr. Chair. Salamat. Permission to share a screen again.
Go ahead.
Mr. Chair, itong slide na to ay pinakita ko kanina, and the concern that I raised was that there are some hospitals na hindi naman kalakihan, ibig sabihin halimbawa 14 beds lang sila or 25 beds, pero napakalaki po ng IRM na natanggap nila. In other words, kapag kinuha niyo yung IRM, i-divide ninyo by the number of beds, may mga ibang hospital na napakalaki po ang nakukuha po nila. So, pinakita ko na tong slide na to. Ang concern ko lang dito is bakit tila mas maraming government hospitals kumpara sa private hospital ang nasa ganitong situation. So siguro ang first question ko, and I will ask this question to Mr. Lim Shaco, whom I believe is in charge of fraud control. Tama po ba, Mr. Lim Shaco? Kayo ba ang in charge po sa fraud control?
Mr. Chair, Your Honor, ano po yun, ma'am? Sorry po.
You're the one who's in charge of fraud control, tama ba?
Mr. Chair, Your Honor, kami po ay sa fund management sector, sa controllership and treasury po.
Who is in charge of fraud control? Sa fraud?
There has to be somebody who's in charge of fraud control, tama po ba? Sino po yun?
Our legal, Mr. Chair.
Legal attorney De Rosario.
Who is
Wala
not
po
that?
legal na nandito? Wala na?
Oh, hindi na bale, Mr. Chair. Itatanong ko, ibahin ko na lang po yung tanong ko.
Mr. Chair, the manager for internal legal department is here.
Sige po.
The manager for internal legal is here. Pwede po bang sumagot?
Ang tanong ko po, sir, is meron din po bang fraud na nagaganap sa public or sa government hospitals?
Siguro po ang question, Honorable Kimbo, is that doon sa fraudulent cases na recorded ninyo, meron yung recorded cases ng fraud. Kahit na hindi nanalo, yung recorded cases lang na pinrosecute nyo or kung may pinanalo kayo, the better.
Doon sa sinasabi po kanina ni Chairman Mike na may 51 cases ba, Chairman Mike? Meron 51 hospitals dito na merong fraud cases.
Well, the existing fraud cases they have is 4,000 now sa mga
So, ilan?
4,000 cases, 4,000 plus. Honorable
So,
Kimbo, someone from legal here can give us a brief. If you can just yes, go ahead.
Ilan porsyento po dito sa 4,000 plus total fraud cases ang nasa government hospitals?
Good evening, ma'am. Good evening, Mr. Chair.
Good evening.
Although our department is not not part of the quasi-judicial process, no, hearing cases against healthcare providers, but we have received and the legal sector has filed several administrative cases involving fraudulent acts of healthcare providers.
Attorney, before we start, may we know your name and your position?
Sir, I am Attorney Rogelio Pucalyan, Jr. I am the Senior Manager of the Internal Legal Department.
Attorney Pucalyan.
Yes, sir.
Okay, Attorney Pucalyan, ang tanong lang po ni Congressman Kimbo, meron ba kayong cases sa government hospitals?
Yes, sir. Ang pagkakaalam ko po, meron pong mga...
Ano pong nature?
Upcasing din?
I'm not sure lang, sir, kasi hindi yung department namin is not involved, no, in the quasi-judicial process, so I cannot really give you a certain answer on that. Pero may mga cases po against healthcare, government hospitals po.
So ilan taon na po kayong nagtatrabaho sa PhilHealth, sir?
Since I started as attorney since 2008.
So nakahalos 12 years na po kayo. Ano po sa pagkakaalam ninyo?
Congressman Kimbo?
Yes, sir.
Yeah. For our guidance, baka pwede magpasubmit na lang tayo sa legal. Kung ano yung mga cases nila in the government at saka ano yung nature ng case para, because I'm also interested, ano ba talaga nangyari dyan? Ba't nagkaroon ng kaso? I think it would better guide us kung makita natin talaga yung nature of what is happening there. Attorney,
Yes, sir.
can you please, Congressman Kibo?
Okay, so Mr. Chair, so habang hinihintay natin yung datos na yan, kung ilan porsyento ang fraud cases sa public hospitals at sa private hospitals, ang tanong ko po sa inyo, and maybe this is for Dr. Pargas, kasi siya sigurong makakasagot dito. Can you explain to us, Dr. Pargas, kung ano yung sistema ng sharing ng PhilHealth claims among government employees? Tama po ba, Dr. Pargas, na yung PhilHealth claims are shared by government employees?
Doon po sa ating ibinabayad na case rate, meron po doon para sa professional fees. Yun pong professional fees po, yun po yung shared amongst the personnel of the government po.
And is there a prescribed sharing rule or is there a specific guideline on how that portion of a case rate is to be divided among the employees of a government hospital?
Wala po. Ang nakalagay po sa ating polisiya, it is dependent on the management of the hospital po.
Kasi follow-up, excuse me ha. Ang pagkakaalam ko sa case rate, 70% goes to the institution, the remaining 30% goes to the employees and the physicians. 15% ng 100% sa mga doktor at nurse, sa mga doktor, at yun namang remaining 15, all other personnel. Hindi ba ganoon ang ruling ng PhilHealth?
Mr. Chair, wala po kaming inilabas na guideline pagdating doon because it is left in the management po of the with
No,
the
I'm referring
management.
to public hospital.
Yes, Mr. Chair.
So bahala na ang public hospital.
Yes, Mr. Chair. However, I think po meron pong and I will have to check on this. Meron po yata dati ang DOH guideline with regard to this on 50-50. Pero for PhilHealth po, wala po. It is dependent.
Sinasabi ko nga sa inyo, kasi we have a public hospital. Yan ang laging sinasabi sa amin. 30% of the total amount to be paid to be divided among the physicians and the non-health personnel, and the remaining 70% to the institution.
Mr. Chair, tama po kayo doon sa parte na yon because doon po sa case rate, pag medical cases po, 70% ay para po sa hospital charges, the 30% para po sa professional fees. Pero yun pong para sa professional fees na yon na 30%, kung paano po siya i-share doon po sa mga personnel, yun po yung hindi po kami naglabas.
Pero sinasabi natin, yung 30% na professional fee, hindi lamang para sa doktor, kundi sa lahat ng empleyado ng hospital, including janitors.
Yes, Mr. Chair.
Congressman Barsaga, we allow Congresswoman, go ahead, Congresswoman Kimbo.
Okay, so Dr. Pargas, so in other words, the maximum na mapupunta sa empleyado ay 30%, tama? Yung maximum sa bawat case rate.
Yes, Mr. Chair, pagdating po ito sa ating medical cases, 70% ay hospital, 30% po yung para sa mga as paid for the professional. Pagdating naman po sa surgical cases, in general, 60% po of the case rate is for the hospital, 40% will be for the doctor or for the professional. So pagdating po sa gobyerno, yun po yung papasok doon sa sharing na tinatawag.
Dr. Pargas, I have here the case rates.
Pero ano?
Hindi po ano sa inyo eh. Ang nakalagay lang po doon, hospital fee and professional fee of the doctors. Wala pong workers, walang anything.
Yes po. Pagdating po doon sa government part po, meron po kasing yung sa government because yun pong lahat ng para sa...
No, let me just...
Yes, sir.
Ito, pneumonia. Ito, hawak ko mismo sa inyo. 32,000 ang case rate, yung high risk. 9,600 ang professional fee. Ang healthcare institution fee, which is the one paid to the hospital, 22,000. So yun
Yes.
lang.
Apo.
Yun lang. Okay, yes.
Meron ibang polisiya na nagsasabi po na pag nasa gobyerno nga po, especially po yung professional fee ng
Yes,
hindi
Dr.
private.
Pargas, what I'm saying is, you're taking the position of PhilHealth. Yun lang ang sabihin mo. Di ba? Kasi pag sinabi mo pa yung pwede hospital, pwede wala ganun eh. Ito yung inyong ano eh. Go ahead, Congresswoman Stella.
Pero Chairman Mike, matagal ng ganitong sistema ng PhilHealth na nasa discretion talaga ng hospital chief kung paano dinidivide ang claims, kung ilan porsyento ang mapupunta sa empleyado. Tama ako, Dr. Pargas?
Yes, Mr. Chair.
I don't understand how you can do that when you have a policy, case rate, and then ito, I'm holding it right now. I printed it from what you have in the website, Honorable Kimbo. I have it with me. In fact, tinignan ko ito lahat eh. Klaro, hypertension, emergency, 9,000 ang case rate, 2,700 ang professional fee, healthcare institution fee, 6,300. Yan lang ang inyo.
So tama yun eh, Mr. Chair. So halimbawa 70% mapupunta sa Dr. Pargas.
Sa hospital, Mr. Chair. Apo.
So in other words, ang bawat claim, ang bawat case rate na binabayad sa isang public hospital, call or judgment call or bahala na ang hospital chief kung paano yan i-divide doon sa cost na ginastos ng hospital, in other words, for supplies, etc. At ilang porsyento doon ang ipaparte-parte ng employees. Tama ba?
Yes, Madam Chair po. And this professional fees po, ito po yung para sa mga pasyente na admitted po doon sa ward or doon sa charity. Because kung titingnan po natin, ang isang government hospital, meron din pong mga private rooms. So doon po, that is paid to directly to the doctor. Pero pagka po ito ay para sa hospital or in the ward, ito po yung sinasabi niyo po na isinishare po.
Correct. So, ang tanong ko lang, Mr. Pargas, is, for all intents and purposes, pwedeng 100% dyan is mapunta sa mga empleyado. Kasi hindi niyo naman po minomonitor po yan, di ba?
Yes, Mr. Chair.
Congresswoman Kimbo.
Yes, sir.
Tingin ko kaya tayo nagkakaproblema pati sa government hospitals.
Ito yung sinasabi ko sa iyo, Mr. Chair, kaya po ako nagpalista ng second round.
Yes, go ahead.
Kasi po, itong problema natin, yung IRM, napaka-excessive. Sobra-sobra ang nakapark na pondo sa bawat hospital. Number 1 yun. Number 2, narinig natin kanina, they have absolute discretion over how that IRM is spent. Number 3, for all intents and purposes, ang bawat claim pwedeng ibigay sa employees ng buo. So number 4, there is every very strong incentives for fraud, 'di ba? So yan ang aking gusto sanang tanungin.
Di ba po yung UTI taon-taon, meron po tayong nakikita na almost 2 billion a year. Ang professional, ang UTI is 7,500. 2,250 is the professional fee. Ang interpretasyon ko dito, yung doktor na nag-administer o nag-check up sa'yo, yung pala, kahit walang doktor, 3 nurse lang tayo na lahat-lahat, inayos ka, yung 2,250, pwede namin paghati-hatian. Tama ba, Dr. Pargas?
Hindi po, Mr. Chair. Kailangan pong laging may doktor because ang ina-accredit lang po natin, especially sa mga ganitong kaso, except in some cases po, ay ang mga doktor po talaga yung tumitingin.
So, dito sa pneumonia na 2,700, ay yung heart disease, kailangan may doktor.
Mr. Chair.
Professional fee. Saan napunta yung hati-hati sila? Saan ang galing yun?
Think po, Mr. Chair, sa gobyerno po, ito po ay sa gobyerno lang, yung pong mga house cases nila or yung charity or ward, yun po yung pumapasok po yung pera, even yung payment ng professionals to the hospital, at yun po yung part po ng professional fee na 30%.
No, that's what I'm
asking.
asking. Sabi ko nga sa iyo, di ba, pumunta ako sa government hospital, UTI. Ang professional fee, 2,250. Kunyari lang, 3 kaming nurse. na nandun, charity ward, will we be the ones to get the 2,250?
Hindi. Kasi po yung sinasabi pong sharing, gaya po na nabanggit ni Congressman Barsaga kanina, ay para sa lahat po, hindi lang para sa doktor, including the utilities, healthcare workers.
Para madali,
and
madali.
all-
Dr. Pagas, madali. UTI, 7,500. Pumunta ako sa government hospital. Okay. Kanino mapupunta yung 2,250 ko?
Kung ito po ay, Mr. Chair, kung kayo po ay naka-private room in a government,
Hindi.
in
Oh.
ward po,
Oo.
kung nasa ward, PF po ninyo ay mapapapunta po, ibabayad natin sa ospital at yun pong PF na yun po ang paghahati-hatian ng buong ospital.
Kaya nga, yun nga mga tinatanong ko kanina pa eh. Kaya nga di ba sinasabi ko, kung ang professional doon ay 3 nurse, sila maghahati-hati.
Kasama po ang doktor. Kasama din po yung mga utilities dun po sa maghahati-hati.
Okay, I understand. Congressman, yes, and then ito na yung potential na talagang gagawa sila ng pondo to increase the professional fee at paghati-hatian. Congresswoman Kimbo?
Yes, Mr. Chair, that was what I wanted also to point out. In a situation na hindi matindi, no, hindi sapat ang fraud control, lalong-lalo na po sa government hospital, napakalaki ng insentiba na magkaroon ng fraudulent claims. Kasi the more claims means mas masaya lahat ng tao, di ba? So, and mas madali rin yung collusion, di ba? Kasi
Dito sa COVID, yung 43,000 ninyo, lagyan na natin na 45,000, 15,000 of that professional fee?
Dating po doon sa COVID cases, Mr. Chair, hindi po tayo naglagay nung hatian kung paano ang professional fee at saka po yung magkano ang para sa ospital dahil dito po ay sinusunod na po natin kung ano yung nakalagay sa UHC law na we shall be paying without differentiation for the facility and the professionals po. Kaya po kung makikita po ninyo, doon po sa sinasabi
Magkano
natin...
po, Dr. Pagas, ang professional fee?
Po?
Magkano po yung professional fee? Can be 50%. Can be higher.
Yes, po sa pag-uusap na po ng ospital.
Okay, thank you. Congressman Kimbo?
Pero Mr. Chair, I also just want to put on record na ako naman ay hindi naman po ako kumukontra doon sa, kumbaga bonus kasi ito sa mga hardworking employees natin sa mga government hospitals, di ba? Wala akong problema doon. Ang problema ko lang, kapag ganito ang sistema, tapos meron tayong isang sistema called IRM na alam naman natin is very imperfect. Kaya ngayon po, pagsama-sama natin lahat ng mga factors na to, talagang hindi na tayo magtataka na this IRM is really designed to fail. It is really designed to be laden with fraud. Kaya sana po, Mr. Chair, pagpatuloy po natin to try to get to the bottom of the mess. And syempre, tayo naman po is really in aid of legislation. So, yun na lang po. Sana finally, malaman na talaga natin kung ano nangyayari dito sa PhilHealth kasi kung hindi natin tutugunan, Mr. Chairman, parang sirang plakang PhilHealth, babalik at babalik na naman dito sa Kongreso at magkakaroon na naman tayo ng gantong klaseng pandinig. So yun lang po, Mr. Chair. Maraming salamat.
Thank you, Honorable Kimbo. Yes, Honorable Barsaga.
Just a clarification, Dr. Bragats. Kasi kami mayroong public hospital. I was the mayor when that public hospital started the operation. Ang laging sinasabi sa akin ng mga doktor at ng aming mga empleyado, based on PhilHealth regulation, kung magkano ang binayad ng PhilHealth, 30% shall be considered as professional fee and 70% goes to our public hospital. Tama ba?
Apo, for medical cases.
At yung 30% ay paghatian, 50% of the 30% goes to the physician, the remaining 50% goes to the non-medical personnel.
Tama po kayo, depende po kung ano
Hindi na,
yes
pinagbabasyan
po.
natin.
Yes,
PhilHealth regulation. Kasi marami na naman ang magtatanong sa akin bukas, base sa iyong statement. Tama?
Yes, Mr. Chair, the 30% is shared amongst.
Okay. Pagkatapos, meron tayong tinatawag na no balance billing.
Chair.
O, senior citizen, kahit na nasa private ward, wala siyang babayaran. Sa public.
In ward accommodation po. In ward accommodation po.
Ward accommodation.
Eh kung yung public hospital ay may private, magbabayad ba yung senior citizen?
Yes, Mr. Chair.
O hindi ba? No balance billing ang ating senior citizen?
Ang atin pong no balance billing policy is in ward accommodation po sa ngayon.
Private room, may bayad.
Yes, Mr. Chair.
Eh itong COVID natin, kinakailangan sa private room bago mabayaran ng PhilHealth.
Alin po, sorry, Mr. Chair.
Itong mga pneumonia, COVID positive.
Mr. Chair, pakiulit lang po, sorry.
Itong COVID,
For
pneumonia, nakalagay sa inyo, 49,000, level 1 to level 3, private room.
43,000. Yes.
Doon po naman sa polisiya ng COVID po, nakalagay din nga po doon ang no copay kahit po ito ay nasa private room.
Kung nasa ward?
Kung nasa ward po, no copay pa rin po.
Entitled?
Entitled.
Nabayaran
Mr.
kahit
Chair.
nasa ward?
Yes, Mr. Chair.
Kahit 8 sila sa ward?
Yes.
Kasi nakalagay sa inyo, private room. Tingnan niyo yung guidance nyo.
For the mild, hindi po dapat kasi hindi naman yun nag...
Level 1 to level 3.
Sorry.
Yung guidelines regarding COVID. O general guidelines. Package code C19-PI, package amount 43,000. Level 1 to level 3 hospital, private room. Guidelines. Benefit availment.
Yes, Mr. Chair. Yun pong, nilagay po natin yung standards dyan na kahit po sa private room, no copay. Kasama din po yung public dyan. So kahit po, ang sinasabi po natin, kaya po natin inilagay dyan, is pagka po ganyan, no copay po. Pero kung halimbawa po ang pasyente ay pumasok sa hindi regular private room, kundi halimbawa po suite room with amenities, doon po pwedeng singilin na yung pasyente for amenities.
Your mic, Honorable Barsaga. Yung mic niyo po.
143,333 nakalagay lahat dito, private room, ICU. Private room. Eh paano nga kung nasa ward? Sapagkat napakarami naman ngayong COVID patients, nagsasama-sama sila sa ward at sabi naman noong doktor namin sa infectious disease, kahit na sila magsama-sama sa mga ward, they are all COVID positive, hindi na sila magkakahawahan. Eh dito sa inyong guidelines, puro private room.
Mr. Chair, opo, nakalagay po yung private room, including the ICU and all, pero dito po ang sinasabi po natin ay yun nga po, no copay po sila kahit po nadodoon sa mga private rooms. So kung makikita po natin...
Ang nakalagay niyo rito, probable or confirmed COVID. Sa private room ang babayaran nyo.
Mr. Chair, ang nais po nating iparating dito ay kahit po doon sa nasa private room sila, no copay pa rin po sila. Katulad din po ng nasa mga ward accommodations.
Ano sila? COVID pa rin?
Hindi po. No copay pa rin po sila. No copay po.
No?
No copay. Walang copayment, walang copay. No copay.
No payment?
No. Wala pong kasamang copay. Copay.
Kaya po, Mr. Chair, doon po sa...
Inaw lang natin.
Doon po
Walang
sa,
kasamang ano?
wala pong babayadan dapat.
Oo, pero kailangan sa private room sila.
Ay, Mr. Chair, hindi naman po.
Eh bakit hindi nyo nilagay both private and public or ward? Nilagay nyo private.
Siguro po, Mr. Chair, sige, we will clarify po pagdating dito. Pero the intention po is kahit po nasa private room sila, dapat no copay pa rin po.
Kaya nga. Pero hindi nakalagay ang public dito. Ang ward.
Oh, hindi po nakalagay dito, pero ang intention, Mr. Chair, pero ang intention po talaga ng polisiya ay yung pong ward plus yung pong private ay no copay po sila.
So sa madaling sabi, kahit nila ay nasa ward, 10 tao na mild pneumonia, each of them will be entitled to 43,997.
Yes, Mr. Chair.
At kung 10 tao sama-sama sa private room, wala sa ICU, 786,000.
Babayadan po natin at dapat wala pong babayadan na yung pasyente.
Depende na sa billing ng ospital. Kahit na ang cost sa public hospital is not 786,000.
Yes, Mr. Chair.
Okay, so baksak na naman tayo sa case rate.
Or kahit 1 million po, yun din po ang babayadan natin. Pero dapat wala na pong
Hindi,
sisingilin
kung
sa
ang cost
pasyente.
lamang ay 50,000, 733 ang babayad nyo.
Yes, case-based pa rin po.
Oo, kaya nga case rate. Talo na naman tayo sa case rate. Okay, Mr. Chairman. Thank you very much.
Thank you, Honorable Barsaga. With that, we'd like to thank all of our guests here. I know that you will be in the Senate tomorrow. Again, our request, kung pwede one from finance and none from legal. Hindi naman po complicated yung questions. We will focus it on the OFWs and in particular, yung UHC law. So yung UHC law po natin and the previous laws that we have para lang humayayos natin at maitugba. We'd like to thank also the members who are in Zoom. Of course, to the Honorable Barsaga, who's been here since 7 o'clock up to 8:30 this evening. Sa inyo po lahat, maraming salamat po sa ating po mga officials of the PhilHealth organization. And this meeting, we will now adjourn this meeting until tomorrow.
Suspend. Pareho lang yan.
Okay, upon advised, we will be suspending this meeting, I think tomorrow, 9 a.m.